We will begin in under 10 minutes, ladies and gentlemen. I thank you for your patience, and I thank you all for taking the time and joining us here on time. I request those who are still in the pre-function area to come and make their way into the ballroom and take their seats, please. Thank you very much. We will begin very shortly. Here's a polite reminder for all of us. I think we need to ensure that our mobile phones don't go ringing when we have the inaugural ceremony. So may I urge all of us here to please keep our mobile phones on silent. Thank you very much, ladies and gentlemen. Once again, let us begin in under 10 minutes.
Expertise with our innovations, and the only way we measure our success is by yours. In your offices, in your labs, and in your hands, for your patients, your families, your communities, and wherever care is needed and delivered. Because the future is more promising when we work together, when we innovate together, knowing we can make tomorrow better together. BD, advancing the world of health.
Life. It doesn't always unfold the way we imagine, but we all aspire to experience more of it. More time to connect with loved ones. More dancing, more playing, more celebrating, more living. Everything we do at Boston Scientific is so that patients can experience more. From our beginning, we've held a bold belief that meaningful innovation could transform medicine and add more to patients' lives. But creating profound advancements in clinical practice requires more than technology alone. It requires insight, courage, and the kind of collaboration that's rooted deep in our DNA. Working globally, listening and learning alongside healthcare professionals and patients is how we strive to tackle healthcare's greatest challenges. Never satisfied with the status quo, we have a passion for innovation, and together, we build solutions that extend and elevate life. With the same caring and winning spirit that got us here, we'll stay humble and driven. Driven to develop the best technologies and therapies. Driven to collaborate with our customers, and driven to advance science for Steve, Roy, Kyra, Rod, Cynthia, and millions of patients. Together, we're advancing science for patients for life.
In a world where large parts still face healthcare challenges, we decided to challenge the norms. With a simple vision, access to precision medtech for every patient globally. And we believe we have challenged the notion that Indian medtech can't be a global leader. Challenging it with our focus areas: advanced surgery, wound care, and arthroscopy. With 52,000 SKUs, our precision medtech products are used in 1 in 5 surgeries globally. Healthium today has a proven track record of commercializing its products. With a seasoned leadership team backed by an experienced board, our belief that we can is constantly challenging the norms and helping change the world. Because we believe that the change we bring matters. Healthier. Each life matters.
Good morning, distinguished dignitaries, industry leaders, innovators, and respected guests. On behalf of the Confederation of Indian Industry, I extend a very warm welcome to you all to the 17th edition of the CII Global MedTech Summit here in New Delhi. Ladies and gentlemen, in the Indian tradition, we revere Lord Dhanvantri as the divine physician and the harbinger of health. And his presence in our mythology reminds us that healthcare has always been seen not merely as a treatment, but as a service to humanity. And today, as we gather here, this summit continues that timeless legacy, bringing science, innovation, and technology together in service of human well-being. CII Global MedTech Summit, over the years, has become the definitive platform for dialogue and action in India's medtech space, bringing together industry experts, MDs and CEOs, key opinion leaders, innovators, academicians, policymakers, and healthcare professionals on one powerful platform. And the world of healthcare is at an inflection point. The challenges of rising demand, affordability, and accessibility demand is one thing, and innovation that is impactful, scalable, and sustainable. And as it has often been said, medicine knows no national boundaries. Its mission is as global as humanity itself. And this year's theme, Innovating for a Healthier Future, Advancing MedTech for Global Impact, is both timely and transformative. It calls upon us to build solutions rooted in India's strengths, yet designed for global resonance. In short, make in India, make for the world. And throughout the day, we will deliberate on areas critical to India's medtech growth story during the sessions that have been planned for this summit. And each session, ladies and gentlemen, is designed not only just to discuss, but to drive actionable outcomes that will shape the trajectory of this sector. And at this juncture, we are deeply honored to be joined today by leading voices who have been instrumental in steering healthcare transformation, from government decision makers to industry captains, from researchers to startup trailblazers. I have to say your presence underlines the collective commitment to make MedTech a force for good for India and for the world. And ladies and gentlemen, it is truly my privilege and my honor to invite to the dais Shri Amit Agrawal, Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India. And let's welcome him to the dais with a huge round of applause. I welcome you, sir. May I also take the privilege of inviting Dr. Naresh Trehan, Chairman, CII Steering Group on Health and CII Healthcare Council, as well as Chairman and Managing Director, Medanta MedCity. A very warm welcome to you, sir. May I take the privilege of calling on to the dais Mr. Shishir Agarwal, Chairman, CII National Medical Technology Forum and President and Managing Director, Terumo, India. Warm welcome, sir. I take the privilege of calling on to this dais Mr. Hariharan Subramaniam, Co-Chairman, CII National Medical Technology Forum and Managing Director, Siemens Healthcare Private Limited. Mr. Gaurav Agarwal, Co-Chairman, CII National Medical Technology Forum and Managing Director, Innvolution Healthcare Private Limited. And may I take the privilege of calling on to the stage Ms. Amita Sarkar, Deputy Director General, Confederation of Indian Industry. Ladies and gentlemen, let's welcome our eminent panelists with a huge round of applause. And with that, ladies and gentlemen, distinguished dignitaries, we now move into the opening plenary session, and I request Ms. Sarkar, Deputy Director General, Confederation of Indian Industry, to please deliver the welcome address.
Thank you, and a very warm welcome to one and all. And this just shows the interest in a rainy morning in Delhi. We have such good and appropriate audience, and of course our chief guest, the Honorable Secretary. This is the 17th CII Global MedTech Summit, and it has a very apt theme, of course, which has come about after a lot of deliberation, which is innovating for a healthier future, advancing MedTech for global impact. And I think given the current geopolitics, this is even more relevant today. Shri Amit Agarwal ji, Secretary, Department of Pharmaceutical, Ministry of Chemical and Fertilizer. Dr. Naresh Trehan, Chairman of CII Steering Group on Health. I'll skip his Medanta designation because we own him for these 2 hours at least. Mr. Shishir Agrawal, Chairman of CII National Medical Technology Forum and President and Managing Director, Terumo, India. We also have with us Mr. Hariharan Subramaniam, Co-Chairman, CII National Medical Technology Forum and Managing Director, Siemens Healthcare Private Limited. Mr. Gaurav Agarwal, Co-Chairman, CII National Medical Technology Forum and Managing Director, Involution Healthcare Private Limited. Friends from the government, media, and distinguished industry leaders. It is my privilege to welcome you to the 7th edition of the CII Global MedTech Summit, a CII flagship platform that has, over the years, continues to bring together policymakers, industry leaders, innovators, clinicians, and researchers under one roof. Over the years, the summit has emerged as a catalyst for dialogue, collaboration, and action to strengthen India's medtech ecosystem. At the same time, we all know, I really do not want to preach, all of you know more than me about the medtech ecosystem, but I would just like to say that this journey, as we undertake it together, calls for a much deeper participation between industry and government, a sharper focus on affordability and accessibility, and a continued commitment to quality and patient safety. It is through such collective efforts that we can truly deliver Make in India, Make for the World. Over the course of today's deliberations, we will hear from distinguished leaders and experts who will share their insights on key areas from global regulatory pathways and innovative ecosystems to skilling research and future of exports. We will then compile all the relevant suggestions and recommendations, Secretary Sir, and present to you for your kind consideration. I'm also confident that the discussions here will spark new ideas and collaborations that will drive sustainable growth for the sector. On behalf of CII, I once again extend a warm welcome to all of our esteemed speakers, partners, delegates, and our chief guest. Thank you for joining us for this very important convention.
Thank you very much, Madam, for that warm and insightful welcome and also for reaffirming the commitment of CII to driving India's medtech journey. Ladies and gentlemen, to establish the context for today's deliberations, it is now my privilege to invite Mr. Shishir Agarwal, Chairman, CII National Medical Technology Forum and President and Managing Director, Terumo, India. Please help me welcome him to the podium, Mr. Shishir Agarwal.
Thank you, and thank you, Amita ji. Thank you for the warm welcome to all of us. It's indeed a privilege to be here. But more than anything else, I believe that we are really thankful to our distinguished guests, Amit ji and Dr. Trehan, for gracing this occasion, and for all our friends and colleagues from the industry, for making sure that all of us are here today to deliberate on something which is really important. It is not only important to just do innovation in healthcare, but if you look at it, the theme of this year's Global Summit is around innovating for healthier future, advancing medtech for global impact. And the time is now. And this is about the right time. Amita spoke about geopolitical situations also. But more than anything else, I believe that it is the Indian patients who deserve what innovation can bring to them in terms of accessibility, affordability, and experiencing the care that we can provide to them. But overall, if you look at it, our medtech industry, it is at a transformative journey. Whether it is in accessing it, or the providers delivering it, or our patient experiencing it. And this is a journey that we really need to make it smooth for them and make sure that everybody is getting access to equitable healthcare. And again, innovation is not only about invention. It is also about our intention on how do we actually bring forward all of this together and make sure that our patients in India get the very best of what's available globally. Yes, we understand that we have rising disease burden. Yes, there are economic disparity, but at the end of the day, healthcare should be uniform for everyone, whether they come from one country or another geography. So if you look at it, this journey of India really changing the course of healthcare started more than 20 years back. But in the last 10 years, if we look at it, we have really transformed significantly. One of the significant areas has been in the reduction of out-of-pocket expenses, going down from 65% to almost 45% in the last decade, which is a significant change. The second one is the Ayushman card. I'm sure everybody has heard enough about it, but getting 350 million patients registered is no small achievement. And similarly, the digital transformation. If you look at 420 million digitized health information is also demonstrating the commitment that we as a country, as a society, are making to our citizens. If you look at it, overall per capita healthcare spend has gone up by 80% in the last decade. Yes, it could have been higher, but this step is also very significant to a larger segment of our entire population. Digital transformation, I believe that we have a very strong foundation for digital healthcare. It has been created by the adoption of all this internet technology, mobile phones, etc. Almost 55% of all households in the country have at least access to a smartphone. And I think this is an area which will really build different healthcare models, connected care also, but at the same time providing solutions which have not been thought in the past. So if you look at it, the government support over the years has been phenomenal. Whether it was the Ayushman Bharat, whether it is the PLI, the production-linked incentives, whether it is really creating the medtech manufacturing zones, or whether it is R&D incentives. I think all of this has come together to not only create capacity in our country, but also ensuring that we have a very robust healthcare ecosystem. And this ecosystem is something which will not only find solutions for India or similar emerging economies. I'm very, very confident that this healthcare ecosystem, which is actually building out, will help even the developed world. Because if you look at it, there are cost pressures. across all economies. And we really need to look at not only frugal innovation, but we need to look at innovation which is going to drive care in a much more efficient manner. So overall, if you look at it, India as a nation, we have certain benefits, whether it is the scale. We have a large population, and we can truly build up scale very quickly. We've done that in some of the other industries as well. And at the same time, we've got cost innovation and also a digital backbone, which has been recognized across different industries. So yes, the future of medtech in India is very strong, and I really hope that all of us will be able to come together and make sure that we are willing to do what is needed for the patient in our country. And overall, as we speak about many subjects during the day, I believe that healthcare is not only about technology, it is also about impact. The real measure will be the patients whose lives will be made healthier over the course of time. I thank all of you again for joining us today and really look forward to very rich discussions. Thank you so much.
Thank you very much, sir, for establishing the context so succinctly and for highlighting the opportunities and the potential that lies ahead for India's medtech ecosystem. With that, ladies and gentlemen, it is now my privilege to request Mr. Hariharan Subramaniam, Co-Chairman, CII National Medical Technology Forum and Managing Director, Siemens Healthcare Private Limited, to please share his address. Ladies and gentlemen, Mr. Hariharan Subramaniam.
Good morning, everyone. A warm welcome to our chief guest, Shri Amit Agarwal, Secretary, Department of Pharmaceuticals. Dr. Trehan, who's been the guiding force for us in the entire industry as chair of the Healthcare Council over several years for his leadership. Distinguished guests, industry leaders, and fellow colleagues from the industry. It's a privilege to join you in the 17th Annual Global MedTech Summit. Already the secretary challenged me before I started this meeting by asking what has changed and how many years we have been having this summit. And he also challenged us in his analysis, how has MedTech grown compared to the GDP? So I hope we answer some of your questions, Secretary, during the course of the session. We are at a defining moment in terms of India's healthcare. When I say defining, fortunately for us, it is about the opportunities and promises in front of us. We have traveled along in terms of MedTech, in terms of contributing for the healthcare delivery system, the care providers. But if the next phase is really about scaling up our impact in healthcare. And we must really deepen as a MedTech, as members of the industry, we have responsibility to really deepen our value chain and also move faster. Over the past decade, we have made several remarkable progress. MedTech has grown rapidly, largely powered by visionary entrepreneurs like Dr. Trehan, who's here, and others in the forum, world-class clinicians, research capability, and most importantly, a strong government backing, which is reflected through Ayushman Bharat, the universal health cover, the Ayushman digital mission, as well as the PLI scheme for all of us in the medtech industry. The role of government has really changed, I would say, over the years, from being a healthcare provider to become a facilitator for healthcare to address gaps in healthcare access as well as funding. This can be gauged by the increased healthcare spend over the years. The number of AIMS probably has tripled in the last decade. The transformation of primary healthcare into Ayushman Arogya Mandirs, or sheer increase in capacity of the healthcare professional, be it nursing, doctors, medical colleges in the last decade. Most of them have doubled or tripled. Another important development, I would say, is the transformation in the digital ecosystem, which Shishir also mentioned. We have a telemedicine backbone, which enables access in more than 550 districts, touches more than 350 million IDs, I would say. And the fundamental shift, I would say, is the PMJY insurance scheme, more than 500 million people and more than 45% of the households have some form of insurance cover due to the PMJY scheme. Specifically for us in the industry, in the medtech, PLI has been a great source of encouragement. A large number of domestic and local players have really benefited from the PLI. It is a big encouragement for the medtech sector. Perhaps one of the most, I would say, unspoken sector in the medtech is also the software. We can be very proud to say, apart from manufacturing, the heart of the medical device is also software. And we can very proudly say that the contribution of India to the medtech in software is rarely spoken. There's a lot of emphasis on manufacturing, but the software plays an integral role. And most of the global and local players have the software, which is the heart of the medtech, coming out of India. Despite the strong trends, we still have some distance to cover in terms of becoming strong and self-sufficient a country in the medtech space. While we have made progress in many devices, in some of the advanced devices, if I get into specifics, the bill of material, more than 80% still continues to be imported for advanced diagnostics and treatment. And these are not available, for example, semiconductors, imaging sensors, and specialized electronic assemblies. The market in India for high-end equipments, when I say high-end, advanced imaging and therapy equipment is, while it has grown, it is still limited in scale if you compare to other markets. Hence, shifting of capacities to India requires large boost in demand from India. After the solid progress, the next phase of growth depends on having a more welcoming and strong ecosystem for medtech. And the singular biggest ask from the industry, and we also have a responsibility to contribute towards this, is ease of doing business, which needs to be further enhanced to support this vision of make in India, make for the world. We will discuss some of the topics during the course of the day, but I would largely say areas which can help us get there is ease of doing business. We have a very evolving regulatory landscape for medtech, but we also have several duplicity with overlapping mandates. While we respect and understand the need for quality and governance because we are dealing with health, the duplicity can be avoided. There are multiple quality control orders which are intentionally good, but also has overlapping mandates. So largely ease of doing business is one area which we feel will help give a big fillip to the medtech industry. And second is boosting demand. While there has been significant growth in terms of pure scale that is required for addressing some of the cost economics, it is still not there in India. Some of the components and the ecosystem, while it has gotten better, if you really have to bring affordable innovation, the scale is still not sufficient. Unlike mobile phones or automobiles, the scale of medical devices globally is not that big. And if you look at some of the geographies where it has become possible to do, one of the significant factors is having a large domestic demand. So these are the two areas where I feel it will help to focus in the next phase of our growth. So if you have to turn this momentum into deliver impact and elevate healthcare at scale, some of the topics which we could discuss during the day is establishing a medtech regulator. This has been foreseen in the medical devices bill. It is still not fully materialized, I would say. A single window clearance system, which will also help bring in affordable and newer innovation quickly to the market. Some of the targeted measures to boost demand will also improve the outcomes. And like Shishir mentioned, the whole focus is getting better health outcomes, and technology plays a role. And not to forget, healthcare is also one of the largest employers. It's also not spoken too often. More than 8 million people directly or indirectly is employed by this sector, and clearly boosting demand will be very helpful. QCO reforms, while it is evolving, there is a lot of progress. Clearly, this is we discussed in the first MedTech forum also that this is one reform which will really help the MedTech industry to scale better. Finally, I would say in conclusion, why does this matter beyond India? If we can build, like we have demonstrated in other industries, affordable innovation for 1.4 billion people, it's not just for us. It can create a roadmap for other emerging economies. The combination of India's manufacturing ambition as well as software and innovation strengths creates a unique advantage which no other country offers. Make in India, make for the world. It's more than just local manufacturing. It's about innovating for global impact, starting with India. In conclusion, let's bring together our expertise, energy, and commitment to create solutions that serve India as well as inspire the world. Thank you, and I look forward to the insights and bold collaboration this summit will ignite. Thank you so much.
Thank you very much indeed, sir, for outlining the transformative journey of India's medtech sector and reminding us of our shared responsibility to make in India, make for the world. And ladies and gentlemen, with that, it is now my privilege to request Mr. Gaurav Agarwal, Co-Chairman, CII National Medical Technology Forum and Managing Director, Innvolution Healthcare Private Limited, to please deliver his address. Let's welcome Mr. Gaurav Agarwal, please.
A very good morning, and it's very hard to be the third speaker in a plenary session. A lot has been already touched upon by my esteemed chair and co-chair, Shishir and Hari. But very warm greetings on behalf of CII and Innvolution to what I believe is one of the most prestigious congregation of thought leaders from the healthcare delivery space, medical device space, Government of India, researchers and academia. And with that, I'd like to open the summit's theme is innovating for a healthier future. And a lot is being spoken about AI, but my personal favorite is that AI is not artificial intelligence in medtech's context. It's academia industry collaboration. So with that, I would like to thank Piyush Goyalji, Honorable Minister of Commerce and Industries, who's going to be gracing us with his presence. Shri Amit Agrawalji, Secretary DOP, thanks a lot for being here. All the esteemed dignitaries from Government of India and Industry. I'd like to thank Dr. Naresh Trehan, the Chairman of CII Healthcare Council, Dr. Amita Sarkar, Deputy DG CII, Shishir, Chairman of CII National Medical Technology Forum, Hari Haran, who's the co-chair of CII and MTF, and the tireless efforts of Mamta Sharma and Abhishek. Thank you so much. I truly believe that the 17th Global MedTech Summit has arrived at a transformative moment in healthcare, where innovation, equity, and global collaboration are central to redefining healthcare delivery. Now, touching upon the summit's theme, innovation for a healthier future, it's not just a rhetoric, but actually a strategic imperative. All of us know and are aware that we are making the shift from Industry 4.0 to Industry 5.0. And I believe that healthcare is also pivoting from Healthcare 4.0 to Healthcare 5.0. In Healthcare 4.0, we saw telemedicine, we saw remote diagnosis and EMRs, while Healthcare 5.0 will bring in collaborative AI, will bring in personalized diagnostics, and will bring real-time analytics, all keeping the patient at the center. I truly believe that today, in our decade and time, medtech delivery can only succeed if it's accessible, affordable, and available. And today, there is a bunch of medtech entrepreneurs in the country, a very enabling ecosystem in places like Andhra Pradesh MedTech Zone, the world's largest medtech park in the world, where under a single roof, a CT scan, an MRI, a cath lab, and a ventilator are being produced. So I would also like to mention that today there are many companies, there is no dearth of companies that are building solutions and products that are locally relevant but globally scalable. You know, India's export success in medical plastic consumables and disposables is already known to us. But very recently in implantables, a very high-tech area like stents and orthopedic implants have shown on the global stage. Now, touching upon the medical device industry in India, I was thinking of talking about digital health, but it's been spoken of at length. And we have our esteemed guest, so I'll not take much time. The industry has truly scaled up from under $4 billion in 2015 to $16 billion last year. A four-fold growth in the medical device industry is unprecedented. And I personally believe, this is just my thought, that what 1990s was for the telecom industry, 2000 was for the IT industry, 2010 was for the pharma industry, 2020 is truly for the medical device industry. I truly personally believe that this is the golden decade for medical devices in India, and my optimism is fueled by the fact that for the first time, our exports, our medtech exports, have outpaced our imports. For a country that's still 80% dependent on medical device consumption, I think the time is for translational research and not just breakthrough research. I go to a lot of institutions and engineering institutes of excellence which are still focused on breakthrough research, but I think as a country that is still trying to be Atmanirbhar, a lot more translational research is required. And with that, I think Secretary Sir and also the regulators have constantly spoken about India making the shift from volume to value. As we scale up our high-tech medical equipment and medical electronics sector, which still contributes to about 65% of India's medtech export, I truly believe we are at a pivotal point in our journey where we'll see a large CT scan company, a large cath lab company, a large ventilator company, a large linear accelerator company exporting from India for the world. Jai Hind. Thank you so much.
Thank you very much, sir, for spotlighting the remarkable growth of India's medtech industry, the shift towards collaborative AI, accessible innovation, and global partnerships that are shaping a truly enabling ecosystem. Thank you very much. And with that, ladies and gentlemen, it is now my privilege to invite to this podium Dr. Naresh Trehan, Chairman, CII Steering Group on Health and CII Healthcare Council, and Chairman and Managing Director, Medanta MedCity. Let's welcome him.
Thank you, and good morning to all of you. So, in a way, I can renew the welcome to this conference, 17th CII Global MedTech Summit. Like said before, a lot depends on how we map our future, because we have been blessed by a little kick in you-know-where to actually tell us that, look, we know India matters, but do other people think India matters or not is our challenge. So it is a great opportunity for all of us. Like has already been said, that the addition of Ayushman Bharat, the government, the schemes of CGHS, ECHS, and now the growth of private insurance has brought in millions and millions and millions of people into the safety net of healthcare delivery. What we have an opportunity, and Gaurav just talked about it, that this is the decade for medtech industry. What did telecom do? Telecom leapfrogged. This is an opportunity for us where it has been enumerated that all the ingredients are here. If we have the IT industry, which is actually the leading edge for the world, we are making aircraft parts for the rest of the world. We are making automobile parts, all the software, a lot of it goes from India. The problem is that we have not learned the power of collaborative movement. Still, I interact with a lot of the companies, and some of the companies individually have done a great job. When you talk about stents, we talk about the percutaneous valves, we talk about many, many things that have, but they are all copycats. We must transform ourselves from copycats to innovators. That's the challenge. we get comfortable very quickly because we start making some money and we say this is great success. That is not the benchmark that we really need to travel. As I said, the government has been great support. But our productivity is lacking. Our precision is lacking. We don't demand of ourselves what we need to do to compete with the world. So I think we need to all wake up and look at the clarion call given to us by some of the countries that import huge amounts from us. If you look at it, a lot of the companies are represented here in our council. But the theme always is there's not a big enough market in India to manufacture in India or to collaborate to manufacture in India. I think those days are gone. You look at the rapidity with which, and it's been said by the earlier speakers, that the rapidity with which the delivery system has gone up. The number of employment that we can give to our population which sorely needs, which is growing, and we need to actually bring into the loop all the young demographic opportunity that we have. So I think this is the time, and like you said, MedTech parks have been established. Nobody in the world who's leading, including Siemens, Terumo, all the companies that are here, you can think of, can do it on their own. Nobody can manufacture every part. The problem of COVID showed that the whole worldwide industry came to a standstill because the parts were not available from different parts of the world. So I think we should get away from the fact that we will do it all ourselves. It doesn't happen. We need to enlarge our relationships. We need to leverage the huge resource we have in our IITs. Just to give an example that we have traveled, we have reached the stage of making robotics, surgical robot ourselves. So there are many other innovations that have happened, but we have not been able to leapfrog the world, which we have the opportunity to. Because we have the brains, we have the support from the government, money, as you know, is available. The will to actually be leaders of the world is still a little wobbly. I think that this is the opportunity which I like the fact that Gaurav said this is the decade, the 20s, so we have till the end of 30, we can actually 5 years is a long time for us to transform ourselves. So the collaboration is between, ultimately we must look at what the patient needs. We must also look at what the providers need. And that's the collaboration because there is a good amount of interest in us, the deliverers of healthcare, to actually help collaborate and do the innovation, do the development, do the translations, but you have to reach out. You can't be just holding money to your chest and saying, this is what it is. You have to make an investment. So I'll urge all of you in this room to think afresh. I'll tell you a very simple example. I was addressing 3,000 techies in Calcutta. And I was talking to them about MedTech in healthcare. It was an international conference. After me came a speaker who was a professor from Oxford. And he started his lecture to say, each one of you 3,000 wants to be a unicorn. Is that true? And all 3,000 raised their hands. So he said, unicorns are not geniuses. Look at the history of unicorns. You take Uber, you take all the Amazons and all of the world, you take the delivery system of the world. He says, Uber was born because between 4 to 6:30 every evening, a weekday, people, you could see hundreds of people standing on the avenues, Park Avenue. In fact, they've made a statue of a person hailing with his handbag, hailing for a cab. They couldn't get a cab. So the guy said, why don't I provide a system? And digitization had taken place. IT was a robust platform. And that's how Uber was born. The idea of how, so he said, I suggest to all of you, take one day of the week. From the moment you open your eyes, every activity that you do, you note down in a pad or a book. At the end of the day, every activity that you did, think about how you could do it better, how the world can do it better, and you will get your answer of unicorn. So it's not rocket science. It's basically our motivation to actually be the power. Our Prime Minister has actually set the goal very high, which is good. If the inspiration is not there, you will never get there. So I think this is the moment where we can actually, there'll be, the program is there. I'm sure we are going to have many important subjects discussed. But think about it, how India can be the leader of the world in medtech over a period of 5 to 10 years. That's what it will take. And I can urge our Secretary, respected Secretary Amit Agarwal ji, that the dialogue between industry and government, and as I said already, you have done a great job, but the dialogue of day-to-day problems, if they are streamlined, it'll only make us more competitive. In the end, I would say, don't look at 1.5 billion people of India. Look at the 4 billion people around us who are economically weaker than us. That opportunity, the West does not like to see, because they think it's a market that they can manage themselves. But the potential of just Africa with 1 billion people is so huge, there is so much to catch up, that international, like there are 3 major companies that produce high-end medtech stuff. But all the innovation, I know CT scan and MRI came out of Oxford. UK missed the opportunity. These 3 companies ran with the ball. Now there are new technologies being born on a daily basis. We have to be looking for them and then running with the ball like the rest of the world did. Thank you very much. Sorry for taking so much time. Thank you.
Thank you very much indeed, sir, for those very compelling reflections, and for also urging us to harness India's strengths, deepen collaboration, and unlock the full potential of our medtech industry. And with that, ladies and gentlemen, it is now my privilege to first introduce and then invite Mr. Amit Agrawal, Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers. Before I invite him for the special address, ladies and gentlemen, let me take a moment to introduce him briefly. Mr. Agrawal, an IS officer of the 1993 batch, brings to his role as Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, a distinguished blend of technical acumen and administrative leadership. And since assuming the Secretary's position in late December 2024, he has spearheaded transformative initiatives to position India as a global medtech and pharmaceuticals hub, championing data-driven R&D, the academia industry discovery marketplace platform, medical device innovation through MedTech Mitra and Patent Mitra, and the development of medical device parks and internationally accredited labs. His leadership, ladies and gentlemen, reinforces India's vision of healthcare that is accessible, affordable, and globally competitive. Let me take the honor to bring him to this podium, Mr. Amit Agrawal, Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India.
you, and it's my pleasure to be amidst all of you. This is my first occasion where I'm interacting with the entire MedTech site ecosystem in India on a single platform, and it was a pleasure to hear all my, the distinguished leaders of this ecosystem before me, right from Dr. Trehan, from Shishir Agarwal, Gaurav Agarwal, Hariharanji. All of them made wonderful points about both what has been achieved and what lies ahead, and India's role and potential in this. MedTech, as has been rightly said, is at the heart of the MedTech enterprise is the human being, the patient, human healthcare. When observations are made about India not having scale, let us not forget that this is one industry, whether it is healthcare or it is medical devices, whose ultimate demand comes from a human being, and India is home to the largest population on the globe. And this population, despite the birth rates coming down, would continue to grow for several more decades. So, and this population has high economic growth, the highest among all the major economies, and that too, by every estimation, is expected to continue to grow for, again, decades to come. The purchasing power which matters is not that of the national economy, it is in purchasing power parity terms, where India is already third in the globe, expected to move on even to second. So anybody who reads their tea leaves right should know that scale is not a problem. Imagination is the problem, as Dr. Tehan said. Are we willing to take risks? Are we willing to bet on the future, or we are looking to the past as a guide to the future, which is something business planners often do very well. Take the average of the last few years and extrapolate it. But what innovators and entrepreneurs and visionaries do is they look into the future, they look into the crystal ball, they know what is going to come and start preparing for that. And that preparation is not rocket science, as was rightly said. That preparation is actually knowing what is being done every day and how can it be done better. That is again something which is best done by innovators rather than established incumbents. Both have a very important role in an ecosystem. And I'm very here to listen to all the industry leaders present here and the wonderful growth that India has collectively achieved among them. A fourfold growth, as was said, in 1.5 decades, a huge amount of employment potential. When external dependence was said, let's not forget that pre-COVID, while firm data is not available, the general estimation is that only 10% of domestic demand was domestically manufactured. Today, on the average, it's estimated to be about 30%, and even in high-end devices, around 20%. This number is, however, misleading. As we know, the first thing you learn about a product cycle or about entry into a market and its development is there is a phase. And that phase, a crucial Rubicon in that, has been crossed post-COVID in India. Today, India is producing things that were unimaginable prior to the COVID pandemic, which has been a watershed here. I mean, India is producing linear accelerators. India is manufacturing cobalt machines, MRI and CT scan machines, mammography machines, ultrasound machines, heart valves, occluders, drug-eluting stents, balloon catheters and defibrillators, ventilators for high flow oxygen devices, dialysis machines, knee implants, rods. This is just a beginning. But once we have crossed that Rubicon of being able to manufacture locally, once we've seeded into the Indian ecosystem the manufacturing and the capacities to make this happen, and couple it with expanding growth, expanding purchasing power in the form of public health care and general economic growth, a tide that raises all boats, it is but a matter of time that this will grow, and this will grow rapidly. At the same time, scale will also come because India is building trade partnerships and bridges with countries across the globe. We recently concluded the trade agreement with UK. We are committed to concluding an agreement with Europe before this year is over. and that includes an investment chapter. And we are in advanced stage of negotiations with New Zealand, also with Australia. And there is tremendous interest from countries across the globe, in particular the Global South, which is looking to India for affordable solutions, for healthcare solutions which are for the poor. That is India's unique strength. What we have discovered in the space of technology, in information communication technology, and this is a point which is often lost on people, everybody recognizes India's technological leadership and innovation ecosystem, that medical device is also technology sector. We are a natural with a large task force and an increasingly innovative and entrepreneurial system to really occupy this space. India's health tourism, as it is called, which has seen a fivefold growth in medical twofold growth in medical visas in just 5 years, is testimony to this is healthcare is ultimately an experience good. People come, a regulatory certification or a certification of a standard setting organization is merely a certification of the minimum necessary standard of quality and safety. But when people come again, and people come from global north and global south alike, and they come in increasing numbers, that is proof that they find healthcare here better. And when they come here, a good amount of devices that are used here are also manufactured in India. So let us believe in ourselves. Let's not look to the vision of that we need to bring the best of the things that are manufactured across the globe into India. I don't think that is where the future lies. I think actually day in and day out as a secretary to the government, in every single government to government interaction that we see, every country is actually looking to India for leadership here. They are not looking primarily for India as a market. So I think we need to invert our vision. We need to realize the opportunity. The biggest opportunity, again, the point that was made is actually lies having created a manufacturing ecosystem, which is a key step, is to realize, go up the value chain to innovate. That is really ultimate value lie, but both are extremely important. You cannot innovate alone, because if you don't have a manufacturing ecosystem, that innovation goes nowhere. Point was also rightly made that when you have breakthrough innovations, you need then translation. Beyond translation, you need manufacturing capacities. Beyond that, you need investors to really bet on that translation and take it to scale. We need to move every part of the chain. So solving the ecosystem problems, solving the scale problems means we work on every part, every stage of the value chain, and we work amongst every collaborator, every stakeholder within India and beyond. And if we do that, the scale problem is absolutely a given. Building on what we've achieved, I've already, and my previous speakers have already mentioned the numbers, we've mentioned the growth in scale, we mentioned the opportunities. What we need to do next is several things to my mind, starting from the very fountainhead, the connect from breakthrough innovation to translational innovation and to all the way up to market and commercialization of products. The Department of Pharmaceuticals runs 7 national institutes of pharmaceutical education and research, and they also cater to medtech and medical devices. And I've right in front of me in one of your future sessions, the director of NIPER Ahmedabad, which in 2012 set up the first medical devices dedicated course in the country and is now anchoring the Center of Excellence for Medical Devices there. And these institutes, we recently have had conversations with the NIPERs, including in the NIPER Council chaired by the Honorable Minister of Health and Chemicals and Fertilizers. And we've taken a decision that we will completely dedicate and reorient these institutes to industry partnership, institutionally, which means that we shall have an institutional anchor, a champion there, a dedicated cell, a national level coordination council with industry representation on it. I'll also be there. And to ensure that the demand and supply sides of these are fully meet, increase industry representation and boards of studies so that curricula are devised actively with the involvement of industry, enable faculty to go out and work in the industry for understanding its requirements, incorporate students in, as part of their curriculum and courses in research and education to go to the industry and do things there. to adopt a cluster of industries nearby to understand through an institutional mechanism as a forum to do things together, to have an institute level, again, academia cell in every single NIPER, so all the way, and to really measure the success of the institute not by papers published or by patents held, but what gets translated and how much of it is applied and how much of research is undertaken in partnership with industry. So what I am really saying is government intends in the department that I hold to fully commit its NIPERs to very active industry partnership, and I take this opportunity to really appeal to all of you to step forward. We'll shortly be having over the coming month interactions with all stakeholder industry associations. Through them you can reach out, and independently as well. We'll be looking for partnerships. We'll be looking for your research leaders to really associate very actively. And we'll be there not in a receiving mode in the sense that you please give your suggestions and we'll consider it, but to try to co-create the agenda there with you. So that is one thing. The second thing is making this whole innovation grow. Now, it's been a long time coming, and almost 2 years ago, we announced the promotion of research and innovation in pharma medtech sector scheme, a rupees 5,000 crore scheme, which was the largest kind of a scheme there, with ticket sizes going all the way up to rupees 100 crore and covering both early and late stage innovation. And all the financing would go directly to industry or startups and MSMEs. But we had very extensive consultations in the month of March and subsequently a non-participative EOI in the months of April, May. We've analyzed them threadbare. There are a number of improvements that were sought and we've identified. And we've had those considered recently in the Empowered Committee chaired by CEO Niti Aayog. They have set up a subcommittee which too is about to wind up its task. So very, very shortly we expect to go live, hopefully in the coming month, with a call for proposals under this. And this I expect will create a sufficient volume of innovation pipeline in India. And we hope this will move forward. I'll encourage industry and including events like this to, I hope in future, to see more participation from the innovation ecosystem here. The interesting thing again about innovation, I made a contrast with ICT industry, and that was my previous charge before I joined in this ministry. I was in the Ministry of Electronics and Information Technology. Someone made a parallel with telecom. And similarly, I would say basically the way I look at this medtech industry is we are somewhere where we were about, say, 8 years back in IT industry. Except that this has a regulatory track, a longer journey, and because many people could not traverse that journey, products, breakthrough innovations that were done here, developments that were done here were sold out, but they nevertheless happened here. We are already innovative. I don't know how many of you have taken note that in 2020, the number of registered life sciences startups in India was just about 900. And by 2024, it had crossed 10,000. It's a silent thing which we often do not take note of because they're still small. For the first time, we did a roundtable with the VCs and PEs in the country, and their one point was, look, successes are happening in India. We are not celebrating those successes. We are not showcasing those successes, and it's very important to do that. Innovation always happens more with the people who are part of the innovation ecosystems and startups, which is not to denigrate what industry does. Industry offers a scale, the ability to take it to industrial scale, the ability to take it to markets, the ability to make it something which customer needs ultimately in its fullest sense. So there's a role for a partnership here, a role for a jugalbandi here, and I expect whenever you have your 18th summit to really give this a pride of place also. This is very, very important. On the manufacturing side, what we really think is, having created the finished products as I recited, there is nevertheless a very high import component in portion in terms of components and raw materials, because those are medical grade things, medical grade ferroalloys, medical grade polymers, medical grade glasses, medical grade ceramics, medical grade packing material, high-end testing facilities beyond the basic, testing facilities that are accredited overseas so that people who are trying to innovate and create products, their cost of entry and cost of registration and certification abroad reduces because it is locally available in India, and access to this at scale. This is the next challenge. We have, as was rightly said, we have the Andhra MedTech Zone. We have 3 upcoming medical devices parks, and all 3 are expected in the coming year to become functional. They give us additional anchor points where things at scale could achieve. We have an opportunity of the scheme coming up for renewal and review beyond March 26. As part of that, we are thinking in terms of strengthening and investing on things which will enable this kind of deepening of the value chain in the domestic ecosystem, creating capacities for that. That too will help scale. Scale doesn't happen only with purchasing power demand. Scale also happens by deepening of value chain and local production of that. Because then the advantages of producing locally, the margins that you get by producing locally, they increase. So that is one key direction, and testing also. So that is another key area in which we think things can happen. It is very important because this industry is nascent and is not very well understood and not very visible to people. It has not yet caught the imagination of the general public, of policymakers, of intelligentsia in this country. The things that you said from this podium, I would encourage everybody here, including the leaders of the CII Forum Council and the forum on the podium, what you've been saying, I would encourage and request all of you to write about it in social media, in op-eds, and in your, whenever you have interactions with policymakers and with the general public. People need to realize the potential here. People need to, socialization of an idea is a function of time. It is important not just to talk amongst yourself and with the government, but to take every opportunity to help people realize that, look, it is 8 million jobs. That's not a joke. And this 8 million can equally become 2x, 3x, 4x in some reasonable time frame. Now, that is an idea which needs to be spoken of, that we've grown 4-fold in 1.5 decades. Which other sector has grown 4-fold? And even then, we are a small fraction of the global export market. Well, we can grow that hugely. We are entering into trade deals with so many countries. We can occupy space there. So these thoughts and these ideas are very, very important. Lastly, a bunch of points were made about issues which relate to standard setting, which relate to regulation, etc. Most of them lie with various other stakeholders in the government. While industry and the economic angle is one lens, the other is, of course, healthcare. And therefore, the leadership of people like Dr. Trehan and his Council on Healthcare becomes very, very important, that all of what we are talking about will not just help industry and economically, it is also for the patient's welfare. That thought, when you talk about a separate regulatory bill or something else, needs to be very clearly articulated. Otherwise, it becomes any industry asking for special treatment for itself, whereas the overriding concern in matters of regulation and health is always human-centric. So the human gains of whatever you are proposing on those terms need to be very clearly brought out, and they need to be brought out for those stakeholders as being in the interest of it. And there, the healthcare service industry, I would suggest, is the right champion to take this idea forward. Once again, I thank you all for organizing this and offering me this opportunity and platform to really communicate with you. I really look forward to all the ideas that would come out of this. I compliment all the organizers, Anita ji and your entire team, and of course the chairpersons and of the forum and co-chairpersons and everybody else that they named for this event. And I look forward to the outcomes. Thank you.
Thank you very much, sir, for your significant inaugural address, reminding us that India's true strength lies not just in scale, but in imagination and innovation, and that having created a medtech ecosystem, we must now invert our vision to fully realize its opportunities. With every stakeholder and collaborator coming together, we can address the challenge of scale, make innovation grow, and pave the way for affordable, world-class healthcare. We cannot thank you enough, sir, for your presence and your address. And with that said, it is now my request to you, Secretary Sir, Mr. Amit Agrawal, and the esteemed dignitaries on the dais to kindly now release the CII BCG report on unlocking India for the world in medtech. For this, I would also like to invite Ms. Priyanka Agarwal, Senior Partner and Managing Director, Boston Consulting Group, and Ms. Garima Malhotra, Associate Director, MedTech, Boston Consulting Group, please. And I'd request respected Secretary, Mr. Amit Agrawal, sir, and the dignitaries on the dais to kindly release this report. Ladies and gentlemen, this is the CII BCG report on unlocking India for the world in MedTech. And this report provides very valuable insights into India's potential to emerge as a global MedTech hub, highlighting pathways for innovation, investment, and inclusive growth. Thank you very much. Thank you once again to all the dignitaries for doing the honors. And with that, it is now my privilege. Thank you. Thank you, ladies. Yeah.
Good afternoon, everyone. It is a great honor and pleasure to be here. Today to talk about the potential of MedTech sector in India. Of course, all the, dignified panelists already spoke about the huge opportunity we have at this moment in time. What we've tried to do with this report is bring together 360-degree perspectives from the government agenda, regulatory agenda, the local manufacturing, which is already growing in a very vibrant way, what the MNCs can do to collaborate and bring a lot more innovation to India, and put it together into a board. We believe from the 16 billion today, and only a share of 2% of the global medtech market, Indian medtech has the opportunity and the potential to potentially, not in a very far time frame, over the next 10 years or so, become even as big as 10% of the global market, but not just quantitatively, bring a lot more innovation, and Dr. Trehan spoke about it. Frugal innovation, invented in India, but applicable for rest of the world, leapfrog. And just like today, everyone very proudly talks about India as the pharmacy of the world. In a few years from now, I hope we'll be standing here in this room today and talking about India also as the medtech hub of the world. So that's the aspiration. And what we've done in the report is laid out a 9-point agenda for everyone in this room to come together and what they can contribute to making that happen. I'll leave it here and won't steal the thunder too much more. I'm sure a copy of the report will be circulated, and happy to have more discussions. Thank you.
Thank you very much, Ms. Agrawal. And with that, ladies and gentlemen, it is now our privilege to thank Shri Amit Agrawal, Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, with a small token of our appreciation. And I'm going to request at this juncture Dr. Naresh Trehan, the Chairman of the CII Steering Group on Health and CII Healthcare Council, to please do the honors and present him with this small token, please. Dr. Trehan. Can we have a huge round of applause, ladies and gentlemen, for Shri Amit Agrawal, Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers. Thank you very much, sir. And with that, I now request Ms. Amita Sarkar, Deputy Director General, Confederation of Indian Industry, to please help us thank our esteemed dignitaries on the dais, starting with Dr. Naresh Trehan. Let's have a huge round of applause, ladies and gentlemen. Can we have a big round of applause for Mr. Shishir Agarwal, Mr. Hari Haran Subramaniam, as also Mr. Gaurav Agarwal. And we will definitely have a photo opportunity with the mementos. The photographer is going to ask for this photo. Thank you very much once again, esteemed dignitaries. And with that, ladies and gentlemen, the opening session for the 17th edition of the CII Global MedTech Summit comes to a close, or a conclusion, if I may say. Thank you once again to all the esteemed dignitaries for their inaugural remarks. And we now are going to move into, ladies and gentlemen, the special plenary and technical sessions.
So we just stand by for the minister to come in, please, in a couple of minutes maybe you can have a short bio break and be back in 5 to 7 minutes. Thank you. You're doing a great job. What I will do is that I will just talk about what Minister has today, because I know and she's still here.
Share is shared. Everyone benefits.
Our dedicated team of 30,000 associates worldwide delivers more than 50,000 innovative products and solutions to medical settings. Since our foundation, we have continued to strengthen healthcare's foundations with 23 R&D bases and 34 production bases globally. We develop a wide range of products for treatments and procedures, including vascular intervention and cardiosurgical solutions, blood transfusion and cell therapy technology, to medical products essential for daily clinical practice, such as transfusion systems, diabetes care, and peritoneal dialysis treatments. We are dedicated to delivering superior quality, cutting-edge solutions across all our products. At Terumo, we take pride in our role as a medtech company, as we contribute to the patient's quality of life, healthcare professionals, and society. We are committed to delivering value in healthcare.
We see you. We recognize your struggles and your pains. We see you. We care about what matters to you. We see you. We believe in your hopes for tomorrow. A diagnosis alone doesn't tell the full story. True solutions begin by looking deeper. That's why at Terumo, the patient is always at the heart of our work with healthcare professionals. We strive to drive the future of healthcare forward. Because to us, progress means bringing care closer to you.
We all fall down, we get banged up, but the scars show what we're made of. Don't you look back, lift your head up, shake the dust off, tell me what you're made of. I can't hear you breath in our lungs, beating our hearts. Lift up the voice, you got something to say. It's a brand new day. 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 When the rain falls, when the ground shakes, when the wind blows, when your heart breaks, show me sorrow, show me laughter, show me starlight, show me what you have to. I can't hear you breath in our lungs, beating our heart. Lift up the voice, you got something to say. It's a brand new day. 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 See the sunrise, oh, fire in your eyes, oh. It's about time we all saw you shine. It's a brand new day. 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 It's a brand new day.
A single-minded focus, a mission-driven spirit. You are what you do, and what you do is move healthcare forward. Your patients, your care, your expertise, focused on an outcome, a result, a goal. But with changing needs and ever-evolving demands, it helps to know who is on your side to help discover, diagnose, and deliver. You may have heard of us. You may have even seen us. But now is the time to get to know us and why we're made for what's next in health. We've always been there, in more places than you may know, doing work today for all your tomorrows. Because when you're talking healthcare, you're speaking our language. We are BD. We understand the future can be unpredictable, yet full of possibilities. That's why we're constantly improving, turning what if into what is for more than 125 years. What you need now and what you need next is what we're made for. Matching your expertise with our innovations, and the only way we measure our success is by yours. In your offices, in your labs, and in your hands, for your patients, your families, your communities, and wherever care is needed and delivered. Because the future is more promising when we work together, when we innovate together, knowing we can make tomorrow better together. BD, advancing the world of health.
Life. It doesn't always unfold the way we imagine, but we all aspire to experience more of it. More time to connect with loved ones. More dancing, more playing, more celebrating, more living. Everything we do at Boston Scientific is so that patients
Ladies
can
and gentlemen,
experience
may I request
more.
you to please be
From our-
seated. The Honorable Minister of Commerce and Industry, Shri Piyush Goyal ji, will be here any moment now. So I'm going to request you all to please be seated. I thank you very much for your kind cooperation. Ladies and gentlemen, eminent dignitaries, may I request you to please be seated. We will very shortly begin with this special plenary in the presence of the Honorable Minister of Commerce and Industry, Shri Piyush Goyal ji. He's going to be here any minute now, which is why I invite you to please be seated. I seek your cooperation, ladies and gentlemen, in getting this house in order. I thank you very much for your kind cooperation. May I invite you all to please take seats, ladies and gentlemen. I invite you to please be seated. We will very shortly have in our midst the Honorable Minister for Commerce and Industry, Shri Piyush Goyal. I invite you to please now take seats. He's at the venue and he's going to be here any minute. I thank you all for your kind cooperation. Ladies at the back, gentlemen, gents there at the back, may I invite you to please be seated. Thank you so much. And here's another polite reminder for all of us to keep our mobile phones on silent. Thank you so much once again. Please be seated, ladies and gentlemen. Thank you very much. Yes, please take seats, ladies and gentlemen. Please take seats, ladies and gentlemen. This is an announcement for all of you to please be seated. We're about to begin with the special plenary. I thank you very much for your kind cooperation. Please take seats. Thank you. We will begin very shortly now. Thank you. Ladies and gentlemen, may I once again request and urge everyone in the room to please take seats. I thank you very much for your kind cooperation. Please be seated. The Honorable Minister is here, right outside, ladies and gentlemen, and he's about to make his way into this ballroom. We will request him to be seated on the dais very shortly. So I invite you all to please take seats. Please be seated, ladies and gentlemen. I thank you very much for your kind cooperation. And we will shortly begin with this special plenary session on Make in India, Make for the World with the Honorable Minister of Commerce and Industry, Government of India, Shri Piyush Goyal ji. Thank you very much for joining us back in the room. Yes. As you can see, ladies and gentlemen, we are on standby. The Honorable Minister is going to be here any minute now. So we must all settle in. And here's a polite reminder for all of us to keep our mobile phones on silent. Thank you very much. I appreciate your cooperation. The lady here is looking for a seat. Madam, I think there would be some seats that side and this. Can the organizers help her, please? Take a seat. Thank you very much for joining us back in the room, ladies and gentlemen. May I invite you to please be seated now. I truly appreciate, ladies and gentlemen, you cooperating in getting this house in order. We just wait for a couple of minutes and our Honorable Minister is going to be here. And then we will get started with the special plenary session on Make in India, Make for the World with the Honorable Minister for Commerce and Industry, Government of India, Shri Piyush Goyal ji. For those of you joining us now, once again, I extend a very warm welcome and greetings to our distinguished dignitaries and respected guests to the 17th edition of the CII Global MedTech Summit 2025 here in New Delhi. Thank you very much for gracing this occasion with your presence. We will momentarily commence special plenary, ladies and gentlemen, on Make in India, Make for the World. Thank you to the organizers for trying to get everyone settled. We appreciate your patience, ladies and gentlemen. We will start momentarily. Thank you so much once again. Ladies and gentlemen, I appreciate you joining us back in the room. We will begin very shortly. Please remain seated. I have been advised, and so I'd like to apprise you all. The organizers have just given me an indication. He'll be here in less than 3 minutes. Thank you very much. Let's all remain seated. We will begin.
Transform medicine and add more to patients' lives. But creating profound advancements in clinical life, it doesn't always unfold the way we imagine, but we all aspire to experience more of it. More time to connect with loved ones. More dancing, more playing, more celebrating, more living. Everything we do at Boston Scientific is so that patients can experience more. From our beginning, we've held a bold belief that meaningful innovation could transform medicine and add more to patients' lives. But creating profound advancements in clinical practice requires more than technology alone. It requires insight, courage, and the kind of collaboration that's rooted deep in our DNA. Working globally, listening and learning alongside healthcare professionals and patients is how we strive to tackle healthcare's greatest challenges. Never satisfied with the status quo, we have a passion for innovation, and together, we build solutions that extend and elevate life. With the same caring and winning spirit that got us here, we'll stay humble and driven. Driven to develop the best technologies and therapies. Driven to collaborate with our customers, and driven to advance science for Steve, Roy, Kyra, Rod, Cynthia, and millions of patients. Together, we're advancing science for patients for life.
In a world where large parts still face healthcare challenges, we decided to challenge the norms. With a simple vision, access to precision medtech for every patient globally. And we believe we have challenged the notion that Indian medtech can't be a global leader. Challenging it with our focus areas: advanced surgery, wound care, and arthroscopy. With 52,000 SKUs, our precision medtech products are used in 1 in 5 surgeries globally. Healthium today has a proven track record of commercializing its products. With a seasoned leadership team backed by an experienced board, our belief that we can is constantly challenging the norms and helping change the world. Because we believe that the change we bring matters. Healthium. Each life matters.
In Japan, care is not rushed. It's thoughtful, precise. For over 70 years, this is how Nipro has approached healthcare. Not as an industry, but as a responsibility. At Nipro, we live by an old philosophy, Sampoyoshi. Good for the seller, good for the buyer, good for society. Because when care is shared, everyone benefits. In India, we found a shared belief that healthcare is a calling and that behind every product is a person. That's why we bring more than technology. We bring experience, trust, purpose. We listen to Indian healthcare professionals and build with them in mind. Every vial we mold, every device we shape, every innovation we offer carries a promise that began in Japan and now continues in India. It's not just about enabling people to live their lives. It's about helping.
Immense privilege of the presence of the Honorable Minister for Commerce and Industry, Shri Piyush Goyal ji. I have been apprised, ladies and gentlemen, that he is now walking to this room. And he's going to be here any minute. Let us all prepare to welcome him. And ladies and gentlemen, he is there outside, as far as I can tell. Thank you, ladies and gentlemen. Once again, let us all get seated. Those of us who are still standing, let's take our seats. And then we will begin with the special plenary. I know that we're all eagerly awaiting the special plenary in the presence of the Honorable Minister of Commerce and Industry, Shri Piyush Goyal ji. He's going to be here any minute now. Let us all ensure that our mobile phones are on silent. I thank you very much for your kind cooperation. Ladies and gentlemen, please join me in welcoming the Honorable Minister, Shri Piyush Goyal ji, Honorable Minister for Commerce and Industry, Government of India, with a huge round of applause. It is our profound privilege, sir, to have you in our midst. Thank you so much, sir. Namaskar. Thank you for gracing this days and this occasion with your presence, sir. We have in our midst a leader whose vision has reshaped India's global economic position and industrial trajectory, ladies and gentlemen. Let's have a huge, rousing round of applause once again for the Honorable Minister of Commerce and Industry, Shri Piyush Goyal ji. We are deeply honored by your presence, sir, as we explore the intersection of medtech, innovation, and global competitiveness. We also have, and with that, ladies and gentlemen, we now move into the special plenary anchored on the powerful theme, Make in India, Make for the World, a vision that positions India as not only self-reliant, but also as a trusted partner to global healthcare. I invite Dr. Naresh Trehan to please now join us on the podium and deliver the welcome address. Dr. Naresh Trehan, Chairman, CII Steering Group on Health and CII Healthcare Council, Chairman and Managing Director, Medanta.
Good morning again, and I have the privilege of welcoming our Honorable Minister, Mr. Piyush Goyal, who has been extremely dynamic and deft at handling the challenges at hand recently. And in that background, Piyush ji, we were talking about this morning that in a way we look at the new challenges that have been thrown our way from our esteemed sort of trading partner who has given us some challenges, that I think the medtech industry has a new opportunity. We are standing behind every aspect of what our Honorable Prime Minister has been saying, and with your vision and your dynamics, I'm sure medtech industry will rise to the occasion where we were talking about that not only do we need to catch up on one side, but on the other side, we need to leapfrog the industry, because all the ingredients that go into making medtech are actually more developed in India and exported to other people to put it together and then sell it to India like the old British times. So I think it's time that we take up the challenge. The government has been very supportive, and this is what I'm going to request our Honorable Minister, that when you can actually draw down all your challenges and requests to the government, that we can arrange a meeting so that there can be, the real difficulties can be addressed. But one of the things that I warn you, whenever we go to the government, like the traditional way is to say, please give us this, please give us this, please give us this. That's not the way to move forward. We need to do it with our own pride. We need to go there and say, we need this to offer this. That we will undertake that in the coming 5 years, 10 years program, we shall deliver the finest medtech up and down, from the highest end to the lowest end, because we now, as I said earlier, we now have the opportunity not only to serve our 1.5 billion people, but to serve 4 billion people around us that we popularly now talk about South-South strength, and that's what we need to do. We need to seize that opportunity and actually also tell our people who have been manufacturing high-tech, which is not, the market is not big enough for them to transfer technology here yet, but look at it not only for India, but the 5 billion people that we are talking about. So with that, I would like to also welcome my colleagues, Shishir Agarwal, Gaurav Agarwal, and Hari Haran to this conference. And please take it over. Come, please.
Thank you very much, sir. Thank you for that opening and setting a compelling tone for this special plenary. Now, to frame today's discourse, I invite Mr. Shishir Agarwal, Chairman of CII's National Medical Technology Forum and President and Managing Director of Terumo, India, to deliver his address. Let's welcome Mr. Shishir Agarwal, ladies and gentlemen.
Thank you so much, Dr. Trehan, and good morning, everyone, once again. It's my privilege and it's an honor, sir, our Honorable Minister of Commerce and Industry, Shri Piyush Goyal ji, whose vision and leadership have been central to advancing India's Make in India, Make for the World mission. We stand today as we witness India's transformation from being a consumer of medical technology to becoming a creator, a collaborator, and also on the cusp of becoming a global catalyst. The theme of Make in India, Make for the World in this session, it is not just a slogan. It is also, it calls upon for a strategy to be built on scale, skill, and sovereignty. India's medtech market, $16 billion last year, is projected to continue to grow at almost 15 to 16% over the next decade. We are already fourth largest economy, largest medtech market in Asia, and our exports crossed $4 billion last year. At the same time, we've got some very fascinating medtech parks which have come up. Notable among them has been the AMTZ, but at the same time, there are others who are vying for a similar space. The journey has been possible because of some very bold government initiatives over the last 10 years, especially the PLI, the Ayushman Bharat, the MedTech Mitra, and the other different incentives in R&D, etc., which have made this journey possible. Looking ahead, we see an industry, we see opportunity, and we see that there is a great deal of momentum that can be carried forward. However, there are some of the open items which we believe, since the Honorable Minister is here, we would like to highlight. One would be expanding the scope of PLIs to MSMEs, because that is where the scale will really come up. Building a raw material ecosystem for the medtech manufacturing in India, because that is what everybody is looking at, not just assembling in India, but really getting all the pieces together available here. Creating a structured engagement, not only for global MNCs, but also for the rising domestic manufacturers, so that we get faster approvals as well as clinical trial access in India. But overall, if you look at it, some of the agreements which have come up, especially the India EFTA agreement, we believe that this will channelize a lot of investment and resources and also technology, which will help us to further our manufacturing capability. By combining scale with innovation, India can emerge as a trusted global hub for medtech, expanding exports and delivering affordable, high-quality, sustainable solutions, not only for India, but for the world. With this, I really look forward to hearing from Minister Sir as we step into this session. Thank you so much.
Thank you very much, sir, for highlighting how bold government initiatives, rising domestic manufacturers, and innovation are powering India's medtech journey from Make in India to Make for the World. And now, ladies and gentlemen, for the medtech industry perspective, for a perspective grounded in real-world industry challenges, it is now my privilege to invite to this podium Mr. Gaurav Agarwal, Co-Chairman, CII National Medical Technology Forum, and Managing Director, Innvolution Healthcare Private Limited, to share medtech industry's perspective.
Very good afternoon, and it's a proud privilege to have Shri Piyush Goyalji amongst us. I'd like to point out that this is the second medical device stakeholder consultation that the Honorable Minister has held with us in a space of less than 60 days, which reflects the support and also the growing confidence in Indian medical industry's capabilities and capacity. May I have the slides, please? So, sir, we just discussed in the BCG report, you said that 30 billion is not an ambitious enough target. 30 billion, I'd like to take a few steps back, sir, and tell you that in 2015, we were under $4 billion. The industry in 7 years has grown about fourfold, which is especially post-pandemic, sir, and in my next slides, I'll cover that. And we aim to get to $30 billion, and the goal is to become a $50 billion domestic market by 2047, the aim for a Viksit Bharat. Now, if you look at the imports and exports, and there's a reason why we've only captured it from 2019 onwards, because this was just the preceding year before the pandemic. Interesting fact that India's exports and imports have both grown at about 40% in about 5 years. But what's very interesting and encouraging to note that in the last 3 years, while our imports have only risen by 8%, our exports have risen by 25%. And, sir, this year, we have achieved $4 billion in exports, which has doubled actually in 6 years. And as Secretary DOP was here, we are truly now transitioning and making a shift from volume to value. We are known as the world's latex glove suppliers, IVD cannula suppliers, syringe suppliers. But today, you'll be proud to know, sir, that in AMTZ, probably the world's largest medtech zone, we are producing CT scans, MRIs, ventilators, cath labs, and several other equipments that are capital medical equipments. And I believe they'll pivot India from being a consumer to being a creator. This is a very interesting slide which shows a total import burden. If you look at medical device industry, it's broadly categorized into 5 segments. Medical electronics and equipments continue to be a large chunk, nearly 63%. The second largest being consumables. In consumables and disposables, sir, we have tremendous export strength. This is a rising example, shining example of India's export competitiveness. And if you look at the situation from 2019 to 2024, honestly, it's very clearly evident that one of the largest areas where we do not yet have self-sufficiency is medical electronics and equipment, an area where companies like Innvolution and several others are making sure that we make in India truly for the world. This is our export summary. Very interestingly, our largest export is also of medical electronics and equipments. Largely because of the value of these equipments, it's very difficult to achieve that scale in consumables and in volume. Now, Make in India achievements are setting up of the Kalam Institute of Health Technologies, which is creating a very enabling ecosystem of components that Shishir just spoke about, that we should not just become an assembly hub, but truly a manufacturing hub. And I was speaking to somebody recently, sir, and he very interestingly said that, and this is a professor from a leading university in Britain, and he said that India missed the industrial revolution and straight away went to the IT revolution. And I think now, with the help of enabling ecosystems like AMTZ, we are truly creating component ecosystem, which is ensuring that our supply chains are not fractured like they were in the pandemic. There's several other things, sir. ICMed is India's first certification designed for medical devices made in India, approved by Quality Council of India. IBSC, the Indian Biomedical Skill Consortium, is producing and training industry-ready biomedical professionals at a scale that was hitherto unbelievable. So we are very, very quickly transitioning from volume to value, as I've said before, and this is truly a transformative journey. So I'm not going to walk through all of these, sir. We are running slightly behind, sir, but this is the vision for 2030, that to be a 25 lakh crore medtech market domestically and to attract $15 billion in investment. And there's a roadmap to get there, sir, but that'll be part of the submissions that we make to you. Thank you very much, and I truly believe, as I said before, that what 90s was for telecom, 2000 was for IT, 2010 was for pharma, 2020 will be for medtech. And I'm sure Honorable Minister, sir, shares our enthusiasm for the growth and resilience of this industry. Thank you very much, and Jai Hind.
Thank you very much, sir, for that comprehensive industry overview and for showing us how India is moving from volume to value with innovation, exports, and Make in India achievements that are transforming us from consumers into global creators in medtech. Ladies and gentlemen, it is my great honor to just say that Shri Piyush Goyalji, the Honorable Minister of Commerce and Industry, Government of India, has been one of the most dynamic reformers in India's economic landscape. It is under his leadership India has recorded historic export growth, strengthened domestic manufacturing through the Make in India and PLI initiatives, and advanced landmark trade agreements that have deepened our integration into global value chains. He's a tireless advocate of innovation and industry. He has consistently championed policies that position India as a trusted partner to the world. Sir, your vision and clarity of purpose have not only propelled Indian industry forward, but have also created fertile ground for sectors like medtech to thrive and compete globally. We are so privileged to have you here with us today. It is now my honor and privilege to request you for your special address. Ladies and gentlemen, please welcome Shri Piyush Goyalji, the Honorable Minister.
I'll speak brief. A very good morning to all the distinguished participants. Mr. Gaurav Agarwal, Mr. Shishir Agarwal, Mr. Hariharan Subramaniam, Ms. Amita Sarkar, friends from the media, and all the very distinguished friends from the medtech industry. At the outset, my apologies that I was not able to come at 11, but I've been under the weather, had a very bad night. I don't know whether you were trying to increase domestic business through me as a guinea pig. But truly delighted to engage with you. The last time around also when we met, I think there was some sudden interruptions in my ability to spend more time with you. But the theme that you have set up for today's program very aptly captures India's aspirations and the world's expectations from us. Frankly, I was just telling Gaurav that it's good I didn't see your BCG report or your presentation before coming here. I may never have agreed to come. You're looking at an industry which you say will be growing to an $800 billion industry. How can India's aspirations, India's plans be so meek? Particularly when we have collectively resolved that by 2047, we want to see a developed, a prosperous India. Particularly when we are all so highly conscious of competitiveness and quality. Particularly when we have such fantastic talent in India, unmatched across continents. We will all have to relook at our own plans, ability to collaborate within the country, internationally, become bigger, bolder, more imaginative, and aim for the sky. India today cannot have modest goals. And a sector like yours, which is still 70-75% dependent on imports, is a natural candidate for Atmanirbharta, self-reliance. And COVID taught us such a big lesson. I still remember when the lockdown was first imposed, probably end of February 2020, 24th March 2020. On that same day, I had a video conference with 30 of the top industrial houses in the country, or Indians, prominent Indians internationally. There was panic all across the country. We had run out of PPE suits. We didn't know what medicine works, doesn't work. The only thing we knew was oxygen may help, but India was barely producing, if I remember correctly at that point of time, about 80-90 tons of medical oxygen per day. We have been going around the world to try and source syringes, needles, PPE kits, and whatever else we thought may help. And that's why on that VC I had requested them, all the Indians, well-meaning Indians, do what it takes. Throughout the world, wherever we can get any supplies, just go all out for the country. And I know for sure they all tried their level best. Many even entered into contracts, paid advances, only to see that money go down the drain because the supplies never came. Many commitments they received, which at the last moment was such bad quality from some of the countries who were at that time profiteering from COVID, that we couldn't receive those supplies. And I remember Dr. Trehan telling me that he had just about enough PPEs to last for 6 days. At that time, if I remember, we used to think that a PPE has to be used only once and disposed of so that the next patient doesn't get infected. Was that the original protocol? But collectively as a nation, we rose to the occasion. We didn't get daunted by the challenges and crisis. We decided to take that head on. And ladies and gentlemen, you come from an industry which should take pride in the fantastic achievements that our healthcare professionals, our doctors, nurses, technicians, manufacturers of equipment, manufacturers of consumables, all of you did the nation proud. And that's when the world recognized that India is the pharmacy of the world. That's when the world recognized the capabilities that all of you have for high quality, competitive products. From a country which never made PPEs, we started becoming the second largest manufacturer of PPEs. We even started exporting them. I remember when we put some export controls on food grains or on some of the medicines, the world thought that India is closing its doors and will not allow what is available with us to serve other parts of the world. And there was a big hue and cry. But I'd like to share with you why we brought in those export controls. The entire idea behind those export controls was to make sure that less developed or developing countries, the poorer nations, can also be eligible and can also get the benefit of the medicines or supplies that India had been able to rapidly ramp up. So we didn't refuse anybody anything at all, what we had with us. Whatever was available in India, we gave it to the rest of the world at fair prices. We didn't try to profiteer from it. But suppose we had not put those export controls, traders in 3 or 4 rich countries could have bought off all our production and made huge profits and made it nearly impossible for the less developed countries to get the benefit of our products at reasonable prices or our medicines, because that would have been cornered by a few rich countries alone. That is the level of sensitivity, that is the level of care and concern that India is recognized across the world for. I still remember a call I got from the advisor to Miss Angela Merkel, the then Chancellor of Germany. And he's a very dear friend, continues to be so till today, Lars Henrik. He called me up and he said, Germany would like to provide, I don't remember the exact figure, maybe tell the office to take out those files, 20 or 30 or 35 million, 30 or 35 million euros as a grant to support our fight against COVID. I said, why are you calling me up? I don't look after that. You ask your people to contact the finance ministry. They look at these grants, the terms, conditions, whether we are willing to take, not willing to take. There's always a catch very often when you're getting a grant. He said, no, but we'd also like to support you with so many ventilators. I don't recall the figure. I said, that's great. If you send me the specs, I'll share it with the pharma or healthcare industry, ministry, and let the ministry take a call if it fits into our Indian requirement. I didn't know whether German ventilators will work here. Then he further added sweetener to the conversation and said, we'd also like to give you 200 million euros, either at zero interest it was or at nominal 1 or 2% interest, which you can pay back in a long term so that you can fight against COVID. I said, the same thing, I can't negotiate or discuss this. Talk to the Ministry of Finance. I'll certainly inform them that you're interested in giving this, but it'll have to be between them and you. Then he came to the crux of the problem. He wanted some medicines. Paracetamol, of course, was important. There was also that hydroxychloroquine. Hydroxychloroquine. Well, world leaders couldn't pronounce it properly, so I think I'm a very small person. And I said, Henrik, there's no problem at all. Just send in a note what you require. We have a small group, the Foreign Ministry, Health, or Pharma, one of them, and my ministry, DPIIT. They sit as a committee and make sure that everybody gets the medicines that they require, basis the population of the country, basis the number of people impacted with COVID. We wanted to make sure that we democratize, we socialize the availability of whatever we have in India, so that the whole world can benefit, rich or poor. And I promise you, we made sure whatever they wanted in terms of medicines to fight COVID, India provided them, not at a profit, not at exorbitant prices which they would be willing to pay at that time. And I never once found out from the Ministry of Finance, never, I didn't even try to make an effort, that did they actually give that grant or that low-cost concessional finance or those ventilators. I never inquired because we never linked the two. For India, Vasudhaiv Kutumbakam, the world is one family, is more precious, more important than profit from somebody else's pain. And I'm sharing this with you because I see a huge potential in your industry to grow at scale, leave behind all this BCG report or whatever you have prepared, relook at your plans. Sorry, I don't mean to hurt anybody, please. I'm sure it is a well-considered target. But this youth of India, all these startups, all these young children here, I don't think this kind of an ambition excites or tickles their imagination. They are much bolder, they are willing to take much bigger challenges. We have a $100 billion FDI commitment from the EFTA countries, Switzerland, Norway, Liechtenstein, and Iceland. They're rich countries. Their per capita income is over $1 lakh. I think one of them is $1,80,000. But at that level of cost, they're totally unviable in whatever they have to produce. They need a reliable partner like India, where there's talent, where there's skill, where there's a domestic big market growing. With growing incomes, the demand for high quality equipment, healthcare, doctors, everything is becoming bigger and better. Plus, a government which is working with the advanced countries, with developed economies, to have better trading options, free trade agreements. We've already concluded Mauritius, Australia, UAE, UK. The 4-block EFTA will come into effect on 1st October, 1 month away. We are working with the European Union on overdrive. We are working with Eurasia, a bloc of many nations. Oman FTA should get sorted out in the next few weeks. Yesterday, the Qatar minister told me they want to start negotiations. Chile and Peru are going on. Of course, we are also talking to the US for a bilateral trade agreement, which first phase we had planned to complete by fall, October, November this year. All these engagements will open up new opportunities, new markets, new investment possibilities to bring scale, to bring quality, to bring innovation into India. We just approved a 1 lakh crore fund for promoting R&D and innovation. And by the way, that 1 lakh crore that we have committed effectively translates to R&D worth 7-8 lakh crores. So that same R&D done in Europe or the US or Japan or Korea would probably cost 10 times compared to what we can do in India, considering our purchasing power parity benefits, our talent benefits, our skills. We can transform your whole sector if you come forward with participating in this journey towards innovation, journey to R&D. And on our part, we are trying to look at several areas to make it easier to do business, to make life easier for all of you, to promote your industry, to make sure there's availability of healthcare across the length and breadth of the country at affordable prices but high quality. Dr. Trehan has often been telling me there's huge potential for wellness services from India to the rest of the world. And he's promised to come along with a small group to discuss what steps government can take. How can we make visas easier? How can we make high quality healthcare available to everybody? How can we train our nurses and technicians better? And countries across the world are looking for healthcare professionals from India. Australia minister was just telling me they may need at least 10,000 nurses and caregivers every year. Japan, I'm told, needs 500,000 caregivers with the aging population. Europe has a similar problem. And everybody feels the Indians are far more attractive because they work hard, they don't interfere in local politics, don't disturb any local working systems or processes. and give high quality outcomes. I do believe that if we were to look at much more ambitious growth targets, attract our engineers, our scientists to do innovation on areas which we cannot collaborate. Wherever technologies are available, we need not necessarily reinvent the wheel. We can, in the country, domestically, भारत के लोगों के पसीने से बना हुआ और भारत की मिट्टी की सुगंध जिसमें आए, वो स्वदेशी प्रोडक्ट है. It doesn't matter investment किसने करी, विदेश से आए, भारत से आए, investor doesn't matter. Ownership is a mere economic number. The fact that it provides jobs in India, the fact that it is made with the sweat and blood and hard work of our Indian brothers and sisters, that defines Swadeshi, that defines India's capabilities, not the color of the currency. So UK may have a different color of currency, US may have a different color, India may have another color. That's not material. What's material is that it adds to jobs, it adds to value addition in India. It serves our domestic market and we are able to export to the rest of the world. And towards that end, every suggestion that you can come up with through your various interactions are welcome. We will also have to look at improvements in our IPR regime if we have to invite investments into India and technologies to India. Some of these we have done. In 2024, the Form 3 for foreign filings, we have relaxed the timelines and simplified the disclosures. Form 27, the working statement is now once in 3 years instead of every year. We have reduced the fees for startups and women entrepreneurs, for academia and micro and small units. We have started doing expedited examination to grant patents. In fact, now we don't allow more than 2 adjournments. We make sure that there's no frivolous objections. All of this is now creating a buzz across the world that yes, India can become a source for innovation R&D. I hope all of you will grab that opportunity, whether it's industrial innovation and TTO frameworks with Ministry of Science and Technology is leading, whether it's Atal Incubation Centers and the Atal Innovation Mission, which inculcates the spirit of inquiry at a very young age, whether it's our fund of funds managed by SIDBI, which is available to startups, whether it's the National Research Foundation, NRF, which hopes to collaborate with private sector for 50,000 crores worth of innovation and R&D. In every respect, we are open to working with you as partners, as stakeholders. We'd like to further grow the Department of Pharmaceuticals initiatives, whether it's a national policy on R&D and innovation, whether it's the PLI scheme, whether it's the PRIP scheme, whether it's ensuring newer markets for newer products and new first-time exporters from India to the rest of the world. There's tremendous potential. And we really need to capture this opportunity. We cannot be weak-kneed. We cannot be suboptimal in our targets, in our ambitions. And I think our strengths need to be cashed much faster, much more. And towards that end, can we look at import substitution wherever we still continue to import goods, whether through technology collaborations or R&D? Can we look at greater self-reliance, Atmanirbharta, so that our supply chains are resilient and not dependent only on the mercy of other countries should there be another crisis like COVID-19? Can we innovate with empathy so that the poorer sections of society also are benefited from the good work that all of you are doing? Competitiveness and high quality determining your outcomes. We need to secure our supply chains for potential disruptions which seem to be growing by the day. We need to build for export markets so that we become providers of scale and go across the world, create at high production capacities, which will help our products to be competitive. We need to truly look at the entire ecosystem, from patient to doctor or hospital, and use newer technologies, possibly even artificial intelligence, to see how we can focus our energies on preventive healthcare, wellness, and reduce the nation's dependencies on other countries. It's a great opportunity in our journey towards Viksit Bharat for all of us to contribute, and till we ensure more inclusive healthcare for 1.4 billion people today, and possibly by 2047, 1.55 or 1.6 billion Indians, till we ensure that every one of them gets high quality health care at affordable prices. I think this journey will be incomplete. Let us go for it. Let us go with confidence. The government stands with you. We are open to your ideas, your suggestions. And I can assure each one of you that the days ahead, the government will be coming out with a variety of measures to support every sector, both to expand the domestic outreach and look for complementarities with other markets around the world to expand our global foray, so that this year our exports will exceed last year's exports. This year will define our self-confidence, and the naysayers and the weak-kneed, whether from media, whether from the economists, who are unable to understand India's true strength and our ability to take on challenges. We work together as a team to prove each and every one of them wrong. Thank you very much, ladies and gentlemen.
Thank you very much, Honorable Minister, for your visionary words. You have reminded us that India can no longer be modest, that with our talent, imagination, and global competitiveness, the medtech sector must lead boldly from self-reliance to world leadership. So your guidance inspires us to dream bigger, collaborate wider, and innovate faster, and that true innovation needs to be inclusive and be rooted in empathy, ensuring that even the poorest have access to high-quality healthcare and dignity of care. With that, I would now request Mr. Hariharan Subramaniam, Co-Chairman CII National Medical Technology Forum and Managing Director Siemens Healthcare Private Limited, to now deliver the word of thanks. Sir.
On behalf of CII, I extend our sincere appreciation and thanks to Honorable Minister of Commerce and Industry, Shri Piyush Goyal, for his truly thought-provoking and inspiring address and articulating a bold vision to position India as a global leader in medtech. Honorable Minister, you have challenged ourselves to think and dream boldly. And one thing which I picked up from your address is innovating with empathy. And you gave us examples of what we as a country did with Germany in terms of crisis, showing the leadership. As a representative of a German company with more than 100 years in India, deeply rooted in India, it was a matter of pride. And I do know that, I was not aware of the specifics, but I do know the health ministry in Germany was looking for antibiotics and a lot of other quality medicines from India, so it was heartening to know. We heard you, and we also have a very strong ecosystem of startups. Normally, MedTech includes startups and also the capability which you spoke in terms of the talent that is available in India. And we articulated this in the morning session that what is not often spoken is MedTech also includes software. And the biggest capability is what no other country has is what we have in terms of software capability, which plays a big role in MedTech. And AI, it's a cliched word in many sense, but medicine really lends itself to artificial intelligence, and that's a capability which we have to offer. We also are thankful to Dr. Trehan, who had to leave us because he had an OR commitment for leading and guiding us with his, at 80, yes. And we had to, and Minister explained that he was under the weather. I can assure you, Minister, we didn't have any role in that. But anyway, we are very glad to have you here. And yeah, thanks to my fellow panelists and speaker in MedTech, Shishir and Gaurav, for their industry inputs and our commitment to make the MedTech ecosystem more welcoming and more dynamic. And thank you for their vision. And as all stakeholders in the system, we'll work as a team in this platform to come together to work how to reduce the import dependence, how can we enable local MedTech innovation to scale and build globally competitive products. We will come back with specific inputs. The minister has already mentioned they're very open for feedback. He mentioned about the research grants that is available, and we will come back definitely with what we can leverage on the talent, the infrastructure in terms of expanding the testing capability, and also some of the regulatory standards which we can align. My sincere gratitude to all the speakers, partners, and participants. Your engagement today reflects the collective commitment to shaping a globally competitive, innovation-driven MedTech ecosystem that serves both India and the world. Thank you so much.
Thank you very much, sir. And now I request Mr. Shishir Agarwal, Chairman, CII National Medical Technology Forum and President and Managing Director, Terumo India, to please present the Honorable Minister with a small token of our appreciation. We cannot thank you enough, sir, for your presence. And while no gesture can match our gratitude, please accept this small token of our appreciation. Thank you very much, Honorable Minister. And with this, ladies and gentlemen, we conclude this special plenary. Thank you again, sir. Let's have a huge round of applause once again for the Honorable Minister of Commerce and Industry, Government of India, Shri Piyush Goyal ji. Ladies and gentlemen, we will now move on to our next set of discussions. And of course, we will move forward inspired as we have been left inspired by the Honorable Minister. I request you to please remain seated. We will reset the days rather quickly and then continue to plenary session 1, navigating the regulatory landscape of the medical device industry. So don't go away anywhere. Please remain seated, ladies and gentlemen. We will not take a break. It's just about 2 to 3 minutes to reset the days. Thank you very much. We're not taking a break now. We'll start immediately. Ladies and gentlemen, we won't take a break now. We will just reset the days in under a minute and begin immediately. Our panelists are all here in the room, so I request you to please take your seats so that we can all get the house in order before we begin with the panel discussion. अच्छा इसमें है इसमें ठीक है तो इनको कहाँ डालूं प्रोटोकॉल आधे ये भी नहीं था मेरे पास मेरी स्क्रिप्ट में नहीं था ना हमने चेक नहीं किया ठीक है चलो अच्छा है मैंने देख लिया ये तो नहीं है ना ये नहीं है सो A 1 2 3 4 5 6 and 7 ठीक है 7 people Hariharan to felicitate Hariharan to felicitate everybody. All right, ladies and gentlemen, we now move into the plenary session 1 of this summit, Navigating the Regulatory Landscape of the Medical Device Industry. I request you all to please be seated. And I'd like to say, with evolving global and domestic regulations, compliance and patient safety have become cornerstones of medtech growth. May I invite you to please be seated? The future of this sector, ladies and gentlemen, depends not only on the brilliance of innovation, but also on the robustness of its regulatory framework. So this is a session, ladies and gentlemen, we cannot miss. Please be seated, everybody. This session will explore pressing priorities, the new medical device rules, the Uniform Code for Marketing Practices in Medical Devices, and efforts towards global harmonization that can help fast-track approvals and accelerate access to innovation. Now, without your help, ladies and gentlemen, we cannot begin. I request you all to please now take seats, everybody. Thank you so much. So ladies and gentlemen, many pressing priorities that will be explored during this session: the new medical device rules, the Uniform Code for Marketing Practices in Medical Devices, and efforts towards global harmonization. And we will also touch upon expedited regulatory pathways, BIS standards, and quality control orders that together shape India's competitiveness in the global medtech ecosystem. To help us decode these complexities, we are privileged to be joined by experts from regulatory bodies and industry leadership, voices that bring unmatched clarity on how compliance can coexist with innovation and how India can set benchmarks for the world. And I have been given the signal to begin. So I'd like to take the privilege of inviting our distinguished panel, Mr. Aseem Sahu, Deputy Drug Controller, Central Drug Standard Control Organization, Ministry of Health and Family Welfare, Government of India. Let's welcome Mr. Aseem Sahu, please. Welcome, sir. May I invite Mr. Aditya Das, Scientist E and Head MHD, Bureau of Indian Standards. Mr. Aditya Das. Ladies and gentlemen, please help me welcome with a round of applause Mr. Manish Sardana. He's the Managing Director and GM, South Asia, Vigon India Private Limited. Welcome, sir. May I also take the privilege of inviting Mr. Vijay Kumar, Chief Commercial Officer, TransAsia Biomedicals Limited, and let's welcome him with a round of applause, please. Ladies and gentlemen, can we hear it for our panelists, please? Yes? Yes, let's get the energy going in the room. I'll also invite Dr. Rajiv Chibbar, Vice President, External Affairs, and Shahjahanand Medical Technologies. So let's welcome Dr. Rajiv Chibbar. And may I also invite at this juncture Mr. Sudhakar Merpadi, Director South Asia Regulatory and Government Affairs, Becton, Dickinson India Private Limited. Warm welcome to you, sir. With that, ladies and gentlemen, our panel is complete. Let me invite the session moderator. He's here with us, Mr. Hariharan Subramaniam, Co-Chairman, CII National Medical Technology Forum and Managing Director, Siemens Healthcare Private Limited. So that is our very distinguished panel before us, ladies and gentlemen. It is now my privilege to hand over the reins of the session to our moderator, Mr. Subramaniam. Over to you, sir.
Good afternoon once again. Yeah, we spoke about scale and ambition in the morning session, and every speaker was encouraging to dream and do bigger. One of the important topics as we deal with human health is patient safety and quality, and that's the reason this session is a natural progression, and we have with us a very eminent panel. I think Mr. R.P. Singh is not able to join, but we have Mr. Aseem Sahu, Deputy Drug Controller from CDSCO, Mr. Aditya Das, Scientist and Head of MHD from BIS. We have a lot of new quality control orders and coming from Ministry of Consumer Affairs, from Bureau of Indian Standards. It's very, very important to have his perspective here today. From the industry, I have Manish, who's Head of Managing Director and GM of Vigon. Mr. Vijay Kumar from TransAsia Biomedicals. Rajiv, a well-known face, dealing with external affairs from Shahjahanand Medical Technology, another leading domestic and a global exporter. Sudhakar Merpadi, Director of BD, Dickinson, India. Good afternoon, everyone, and welcome to this panel. Maybe I've been told because of the earlier schedule, we are a little running tight on the timelines. Maybe I'll quickly request Mr. Sahu to say a few words as we kick off the session.
Distinguished dignitaries, delegates, ladies and gentlemen, a very good afternoon to all of you, and my pleasure to be the part of this 17th Global MedTech Summit organized by the CII. So, as far as that regulatory provisions of the medical device rule is concerned, we all are aware that a lot of recent changes we had in the existing that our medical device rule 2017, and with the objective to have the regulatory ecosystem in the country without compromising the quality of the medical products, including the medical devices. With this objective, we have made that our law at par with the globally accepted requirement, and at the same time, the regulatory process to streamline the regulatory process, to have more transparency in the regulatory process, accountability. We have come up with the digitalized or the online platform for all the regulatory approval process for grant of various approval, including the registration of the certain activities. So this platform we have created, common platform where the state authority as well as the central authority can grant the various approval under the medical device rule 2017. Why it is so? Because to have the uniformity in the regulatory system throughout the country, that we have planned for the online portal, which is to be used by both the state as well as the central authority. And also for each and every activity, we have given the specific timeline, so that the time we can achieve to give the approval in time, and also the product should be made available to the Indian population. Also, during the last 5 years, if you see, so many changes, because recently we have come up with the comprehensive regulation of the medical devices. Earlier, we have already certain limited category of the medical device under regulations. To bring all the devices under the regulation, we have again changed our requirement, and also we have implemented. Now all the devices are under regulations. So once the regulation is started, lot of challenges with the existing manufacturers or the importer to fill up the regulatory requirement. So wherever we have faced we have identified the challenges, we have come up with the certain solution by way of increasing the FAQ to address the certain issue, so that they can understand what the actually regulatory requirement for that. Also, we have started to place the tool tips. So tool tips also, the objective is to understand what the actually requirement for submitting any application to the authority, what the authority actually require for particular activity, correct information, so as to reduce the unnecessary non-compliances as well as timely approval of the such products. So we have come up with that tool tips, which is also available on the website of the CDSO, and also various guidance we are just framed, and certain guidance documents are in the pipelines, and in near future you will see lot of guidance with respect to the new technology or the innovation, or even for the post-marketing surveillance and software as a medical devices, which are the new that coming area in the field of medtech sector. So we are ready for that draft documents, and shortly it will be published, so that the people can understand what the specific requirement for different types of the types of the medical products or the medical devices going to approve under the Medical Device Rule 2017. Also, lot of that interaction with the industry we have initiated, and CII is also one of the close partner with the CDSO, where we are organizing various stakeholder interaction meeting at different places. Two already we have completed, and next one is already we are planned to conduct in the southern regions. So the objective is to have interaction with the stakeholder, lot of that queries or the challenges that can be discussed in that forum, and that what the necessary measures need to be taken, that we are started to do that. So with this objective, several steps also we have taken, and also the government have taken so many steps, and one of the major steps is the Medical Device Policy 2023, with the objective to have the ecosystem in the country for growth of indigenous manufacturing, so that in future the India also become the global leader in the field of the medical technology. So this is the initial remark, and if you have any that further issue, definitely we'll discuss that. Thank you very much for giving the opportunity.
Yeah, thank you, Mr. Sahu. And yeah, there is a lot of changes since MedTech regulation CDO has been fairly recent, and we can see very big change in the way things, how it is developing. I will have some follow-up questions, but I think one thing what you rightly mentioned is in terms of being open for industry interaction as a regulator itself is a big step. And the first MedTech task force, actually Mr. Sahu was, a couple of weeks back, was there to listen and take feedback and also give his views on various topics. So thank you so much. Maybe I'll quickly move to Manish, because as somebody who's a player in the industry, how do you experience the regulations, and you want to share some thoughts on what Mr. Sahu has mentioned just now?
Sure. Thank you very much, Fari, and thanks for having me here. First thing first, the good thing, it's good to be on the right side of the regulator, isn't that? So that's a good start point. For me, regulations or regulators are like the lane assist. right? So while which ensures that you drive safely and you reach your destination safe and sound. In a shorter term, in a shortened time, probably the regulations would seem to slow down the speed and increase the time you take. But I think in a long term, it will help us to go robust, help us to reach what we want to achieve safe and sound. So that's what I would say as my initial remarks. Thank you.
Maybe, Mr. Sahu, one follow-up of what you said. We all know that while the intention and how regulation is changing is quite progressive, healthcare is also a state subject. And in our everyday life, the implementation of this laws kind of differs from intention in central as well as in various states for various reasons. What is your comment on that? How you want to harmonize? Because I know you mentioned about it. Second is, how do you look at newer areas like AI and machine learning and software, which are also not just for India, globally an emerging area in medtech?
So thank you for the questions. Both the topics what you have highlighted, already I have covered that, because the software as medical devices we have we have already prepared the draft document, so that what the actually specific requirement with respect to the software that is required for giving the approval, that we are coming up with that guidance document initially, then subsequently, because to frame the rule it will take time, certain time. So start with the guidance document. Future we will also incorporate that in the law to make the mandatory requirement for the software also. To have the uniformity already, initially when we have implemented the medical device rule 2017, the first steps we have decided to frame the single online portal, and separate online portal we have created, that is the CDSO MD online portal, so that what the regulatory requirement, because the checklist and the processing timeline already that we have given to the state authority, the particular requirement they need to follow these technical requirements to consider the application. But the interpretation is one of the challenges. So because of the complex regulatory structure with respect to the medical devices, what we started, we have also our training program. Training cell is there, and routinely we are giving the training to the state authority along with the CDSU official to understand the requirement of the medical device rule 2017, and to have the uniformity in the implementation of the rules. So that step we have initiated, and also the objective with the interaction with the stakeholder is to understand what the other challenges they are facing at the level of the state authority, at the level of the port authority, or at the level of the zonal or the central authority. And where there is a possibility to change this or to bring certain that clarification or some guidance to the stakeholders, definitely the CDSU is providing that guidance to that in that particular issues. So these are, and also it is a dynamic, so we don't know actually what the steps or what the requirements certainly require more that clarity on the approval process. So also we are just open for the discussion, and wherever the specific direction or the clarification need to be given, definitely the CDO is providing that guidance to the concerned state authority.
Thank you. Thank you. Maybe I'll quickly move to Mr. Aditya. Probably the emergence of new regulator, and there are several, when I say new, it's new for medtech as an industry. There are initially started with Ministry of Electronics and IT. Several QCOs have come. I must say there is a bit of, let's say, demand or let's say request from the industry that if we have CDSU as one regulator, we have now multiple QCOs coming. While the intention is understood, it sometimes creates overlapping mandates. But first I want to hear from you your comments, and then if you can answer to the specific request from the industry.
And thank you, Hariharanji, and good afternoon to all the guests here and all my fellow panelists. I think I'll take a leaf out of the book of Manish ji, and he made a very interesting comment when he said that compliance mechanisms, regulations exist as a lane assist, right? So I would request all of you to think of even standards or regulatory tools like QCOs or technical regulations also as something that are incorporated as a means to help, right? I have been privileged enough to be a fly on the wall in many conversations about QCOs or technical regulations. And what I have found is that the intention, the theme of the conversation is always to help the industry, to help consumers and the country at large. So that is the intent behind even quality control orders which are being brought out by multiple ministries. They have their own mandate, right? I mean, steel ministry will regulate steel, the electronics ministry will regulate electronics, CDSCO will regulate medical devices. There might be overlap, there is, but the good thing is, and I'm sure you will also appreciate that, is that all regulators, and you have Sahuji here, he has a difficult job, I don't envy his job. The good thing is that they are always there for having a frank conversation. What I have felt, and BIS also is a partner in those conversations, what is good is that those conversations happen and positive outcomes I have seen are always coming out of there. Standards, if I'm going to talk about as far as compliance and standards goes, there's always a basic theme running that this is something that is stopping the industry. I would like to turn the conversation on its head there. My feeling is that standards are there to essentially help, right? They are not an obstacle. They are a tool. Governments can use that tool. The industries can use that tool. Other professionals, anyone can use that tool, really. And they do. So today we're having the Global MedTech Summit, right? So with that in the context, with that in our headspace, I would also like to talk about how important it is for us to be taken seriously at a global level as far as standards go. And why do international standards exist at all? They exist to facilitate trade. And I mean, I think I don't need to tell the very knowledgeable gathering here how important, how fraught a environment we operate in as far as trade is concerned. International standards are non-negotiable instruments when it comes to facilitating trade. And we really need to come together, and I think many of you were there when BIS recently held a webinar on identifying experts who can represent us at international standardization for various projects. And there I would like to use this forum that CII has given me to maybe call upon all of you. It is very easy, and many of you are experts in your own fields. By collaborating, by putting your time in our possession there, and we are only looking for your time and expertise, we can help make international standards that are tailored to our own needs. And that is where this entire conversation, I'll bring it back to QCOs. India has not really weaponized standards or technical regulations to the extent that other countries have. I'm sure you know that. I mean, but if we are to really compete globally, not just in the medical trade, but in any trade, I think international standardization is something we need to compete on, we need to contribute to. So that would be my basic opening remarks here, that collaboration is the way to go. Regulations is something that we need to work together to get around, and I think the doors of various ministries are always open. I'm sure the doors of BIS are always open to you as a partner. So that are my remarks, Mr. Hariharan. Thank you for the time.
Thank you. I know it is sometimes seen as trade barriers, but you're very clear that it is not weaponized, and regulation is not meant to be an obstacle, but more to ensure safety and governance. So maybe I'll go to Sudhakar, another industry colleague, to say how in their intentions, like I think we've been discussing, everybody agrees quality and governance and regulatory is very, very important for any industry, and more so for medtech. Maybe his experience on the ground with respect to multiple QCOs, if you can share, it will be useful.
So first of all, thank you very much, CII and the chair, co-chair for giving opportunity. So over last, I think 9 to 10 years, these quality control orders by the multiple ministries has come as disrupting the innovation or manufacturing or the local assembly, etc. So what we are not contesting, we can understand the quality of the products coming into India as an accessory, spare parts, etc. The government intend to bring the best in quality. But what we would urge the BIS and also CDSU, our the main regulator, to consider is these are all parts which are already get tested as a whole of equipment and ensure the safety. So maybe we can understand the electronic industry and other industries which use the same parts. Maybe we can think of coming out with an undertaking or some sort of a commitment by the manufacturer where it is win-win for both. Otherwise, the repetition of testing which delays the market access and also sustenance of repair and maintenance will be hugely impacted. So we will urge, we are more than happy to comply with your requirement, and I think we will bring back through CDSU, which has enabled earlier including those accessories as a part of MD15. So that's one, sir. And I think I would appreciate the two comments, both by the South and the BS colleague. Over last 20 years, from 2006 to 2025, there is a seesaw change at the CDSU, which has enabled us. We can go on debating what went, what could have been better, etc. But last, again, 12 to 18 months itself, significantly there is a clarity, and then the availability of officers to meet and enabling, supporting, and then FAQs again, and intent to meet the industry and clarifying the doubts and addressing the requirements. That has been phenomenal one. In terms of BIS, I would urge the officer, sir, we are struggling in this area because each time we approach the ministry, we have been told it is a parent ministry, you please go. Our intent is not to run away. Our intent is to more than comply. So if you can organize a joint ministerial meeting, I think all of our equipments and people are struggling, maybe 10, 12 QCOs, we will be greatly helped to come out with some amicable, balanced solution, win-win safety of the patients and also enabling the manufacturing. Thanks.
Yeah, thanks, Sudhakar. Yeah, and like Mr. Aditya, what he mentioned, any mechanism, because we're all talking about ease of business and single window. So there are domestic and international manufacturers. If we have to reach out to multiple ministries, clearly it's really a challenge. I will actually ask Rajiv, who represents a leading Indian manufacturer of medtech, how do they see this evolution of regulation as well as how they balance with speed of bringing new innovation into the market? Rajiv.
Thanks, Hari. Thank you, CII. See, you just mentioned about ease of doing business, and the first thing that everyone thinks of is compliance and regulations. If those are easy enough, then possibly, the entire cycle to produce and entire cycle to manufacture becomes more easier and more clearer. And as Sudhakar just said, that if there is a clarity on how we could, look at convergence of a lot of compliances and regulations, not only between, the center or state, not only between maybe India and the global harmonization that we require, that takes us to possibly a much better era where what Piyush Goyal ji and possibly Naresh Trehan sir said in the morning, the collaborations will take India and also will have much more better manufacturing practices adhered to. Now, couple of things that we normally grapple and would want attention has already been said. I would rather say that as enablers within the ecosystem, the systems need to really take into account what innovation has to be made when there is a requirement of new age technologies. Now that is very important. I mean, if there is something that we find needs much more innovation, where possibly, we're trying to have a clear understanding on this particular product where clinicals is important, we may need to look at why do we have a predicate and why do we need to have something which can just be a copy that in the morning Dr. Trehan said. Can't we look at how robustness can be really initiated from the regulator and then that robustness followed by the manufacturers? So things like that really harmonize any kind of unsubstantiated products moving into the market, getting into the system. And the other thing is that if we talk on ease of doing business, as Hari, you also rightly said, and we all face, if there are too many orders, too many ministries, too many departments where we have to adhere to things, the single window system does not really end up helping us. Now that's something that needs to be streamlined not only from the departments, the various departments, but also that window needs to be active enough. I mean, why do I have to at the end of the day really go to 5 departments and explain to all of them, whereas it could have been a clear order which kind of like is harmonized between all these departments. Simple example, I mean, whether it is on labeling, I mean, understanding the labeling requirements from NPPA, from CDSO, from legal metrology, it becomes a challenge for, I think, all of us, not only at the state level, at the center level also. I think somewhere we are trying to look at how sustainable growth can happen if there is a right kind of adherence towards streamlining, understanding within departments, within the industry also. I think when the industry understands all of this, then we may not have comments what Dr. Trehan said in the morning, or what Piyush Goyal ji said in his address with regards to looking at an industry that could be one of the best, but then we still have to take it to a level where we're still grappling with amongst us.
Yeah. So maybe, Mr. Aditya, I think all of us agree on regulation. I think the only request, I mean, not to put both the regulators on the spot, is there is complexity. And we understand, recognize it is new and evolving, and there is full intention and commitment to simplify. But currently there is complexity. If you want to respond to this, then probably we go to the diagnostics segment as well.
I'll take what Dr. Rajiv said and spin it as a pitch to standards. Like basically what he is saying is that there is complexity, there are multiple requirements on the same thing. Taking the example of labeling, for example. I would pitch standards as a solution to this. I mean, in many products across the world, and not just in the medical sector, standards can really provide a one-stop document as, look, these are the 5 things you need to put on the label of a product. You all have your bottles of water in front of you. They comply with standards. And the Indian standard for this does lay down what the requirements are, and they take from various regulations. I'll again urge you not to look at standards as roadblocks. Of course, the issue regarding multiple, regulators or ministries being involved is a genuine issue. I mean, I don't claim to have a solution to it. And very honestly speaking, BIS's role is not really there. We exist as a support to the industry as well as to regulators. But irrespective of that, that is of course a challenge. I am aware of it personally. That can only be resolved by continuing dialogue, and I think the government has been committed to that. But you have to also appreciate that we do live in an interconnected world. Businesses do operate in an interconnected environment. The steel ministry cannot be asked to take a decision on electronics or vice versa. So there might be some coordination required, but I can be reasonably sure that for that, the conversations that need to happen will happen. I don't think there will be any situation of someone not talking to the industry or not facilitating. So this will be a continuing exercise. I don't see any very simple solution to this other than the fact that we need to keep engaging, and summits like these help. which is why I always try to come to them. So that is my response to this, Mr. Hariharan.
Yeah. Thank you. Maybe I'll ask Vijay, who represents, I mean, MedTech is a very diverse industry. He represents diagnostics, which plays a very important role in preventive as well as in treatment. So do you want to talk about any regulatory, let's say, challenges and which you face in terms of, you're also leading domestic player in terms of bringing innovative products in India as well as globally?
No, absolutely. I think, so I represent a very entrepreneurial organization, and diagnostics has recently, in recent years, been the speedboat of healthcare ocean, if I can say so. And it's thriving on innovation. Every day there are new tests which are being developed, and what we constantly see is that the speed to market is what brings core competence to the industry. If I look at what is the expectation, I think a lot has happened in terms of regulatory landscape changes in India, and I thank the authorities and the government for that. Maybe there should be a next level of sea change which has to happen in regulations and regulatory landscape. And C is, I mean, literally SEA. So speed, which means that can we take this challenge of crunching timelines from months to days and work it backwards without compromising on anything, but can we do it? The second is ease in the sense that we had MDR 2017, it's been 8 years, and we have I think tens or maybe hundreds of new notices or amendments or addendums which have come out. So is it something that we need to coalesce now and consolidate into something holistic so that it's easy for our regulatory managers to fill the forms? And the last thing is SCA. So A is acceptability, and acceptability will again, I think in my mind, acceptability will come when we do something drastic in terms of how we manage our regulatory mechanisms in India. And maybe AI and ML, this is something which is a brilliant idea. We know what to look for and we can train our AI engines to really look at the accuracy, the correctness of the regulatory forms, and be a help to, again, the industry colleagues and fill the forms correctly.
Thank you. I think it's an unfair setup. Two regulators facing a room full of industry providers, but they've been very upfront in acknowledging the challenges and openness to work. I think if I can summarize the whole discussion, I think CDSU, the transparency and the level of predictability over the time has really gotten better. Our only request is now on speed, but I must admit even speed has dramatically changed, and we also as global companies experience, like you said, globally, a lot has changed, I must admit. I mean, we have been putting you a lot of questions, but I must also acknowledge the change that has happened. QCO, if we can say one takeaway from this meeting is, there is acknowledgement that it is complex, and the challenge we have as industries, whom to address this to. But I think the mere acknowledgement that this is a challenge, and it's an active discussion with most of the ministries, that QCO is seen as in some sense, a bottleneck. I think that is a big step as well. I mean, for us, if you have to look at one takeaway for the next CII, will be this QCO issues, if we can get our arms around in terms of not running away from it. I want to assure you from representatives of the industry how to simplify it. I think that is what I would summarize as takeaway. I want to thank all the panelists and the regulators for the discussion. I'm sure this topic is so intense, we can go on for many more hours, but it is good that we have this openness to discuss the challenges we have, and the willingness from the regulators to come in forums, have separate session itself is a very, very encouraging and first step. Thank you, everybody. Thank you for all the panelists.
you very much, sir. I would request you to now present mementos to all our panelists. So, ladies and gentlemen, we need to take a moment to thank our esteemed panelists at this juncture. And I'm going to request our moderator, Mr. Subramaniam, to please do the honors. And we start with Mr. Aseem Sahu, the Deputy Drug Controller, Central Drug Standards Control Organization, Ministry of Health and Family Welfare, Government of India. So, sir, please help us thank Mr. Aseem Sahu with a huge round of applause, ladies and gentlemen. Let us thank him as well. And I thank you for the applause, ladies and gentlemen. Thank you very much, sir. Can we thank Mr. Aditya Das, Scientist E and Head MHD, Bureau of Indian Standards. Let's have a huge round of applause, ladies and gentlemen. Sir, we request you to please thank Mr. Manish Sardana, Managing Director and GM, South Asia, Vigon India Private Limited. And can we please accompany that thank you with an applause? Thank you, ladies and gentlemen. And Mr. Vijay Kumar, Chief Commercial Officer, TransAsia Biomedicals Limited. Let's have a round of applause, ladies and gentlemen. Thank you very much, sir. Dr. Rajiv Chibbar, Vice President, External Affairs, Sahajanand Medical Technologies Limited. And finally, Mr. Sudhakar Merpadi, Director, South Asia, Regulatory and Government Affairs, Becton, Dickinson, India Private Limited. And we will need a group photo opportunity with all of our eminent panelists. And very quickly, ladies and gentlemen, we will transition into the fireside chat, which is on the great leap India's rise as a global medtech leader. So I think this was a very rich and thought-provoking discussion indeed. This session has reinforced the importance of a balanced regulatory framework, ladies and gentlemen, one that ensures patient safety while enabling innovations to flourish. Thank you very much once again. And as we move forward, ladies and gentlemen, it is now time for a very special segment of the summit, the fireside chat that goes to the heart of our theme, the great leap, India's rise as a global medtech leader. Now, India's medtech sector is in the midst of a remarkable transformation. From being largely import dependent, it is now carving its space as a hub for innovation, manufacturing, and global partnerships. So this particular conversation, ladies and gentlemen, which is equally unmissable, I have to say, will reflect on India's journey so far, the enabling policy landscape, and the road ahead. And so we're going to hear perspectives on indigenous device development, the rise of startups, Atmanirbhar Bharat initiatives, and India's integration into global value chains. And together, honestly, these are not just milestones, they are stepping stones towards India's emergence as a true medtech powerhouse for the world. So I request you to please remain seated, ladies and gentlemen, and please be with us here for the fireside chat. As you can see, we are resetting the days very, very quickly so that we don't lose any time. I know we're running slightly behind schedule, but I request you to please be with us here, ladies and gentlemen. We will begin very shortly. We just need 3 chairs on that dais. We will shortly have this dais graced by Ms. Rupali Mukherjee, Editor, Pharma Times of India, in conversation with Mr. Anish Bafna, MD and CEO, Healthium MedTech, and Mr. Gaurav Agarwal, the co-chairman of the CII National Medical Technology Forum and Managing Director of Innvolution Healthcare Private Limited. So we're almost set, ladies and gentlemen, for the fireside chat on the great leap India's rise as a global medtech leader. I request you to please remain seated. We will not lose any time and transition into this segment almost immediately. Can I start? Ladies and gentlemen, we're about to begin with a fireside chat on the great leap India's rise as a global medtech leader. This conversation is going to explore India's shift from import dependence to innovation leadership, the policy enablers driving growth, and how India can integrate deeper into global value chains to emerge as a medtech powerhouse. So I have been given a signal to begin. Ladies and gentlemen, to steer this candid and thought-provoking conversation, may I take the privilege of inviting onto the stage Ms. Rupali Mukherjee, Editor, Pharma, Times of India. There she is. Welcome, madam. As part of this fireside chat, we have two stalwarts of the medtech industry. May I invite Mr. Gaurav Agarwal, Co-Chairman, CII National Medical Technology Forum and Managing Director, Involution Healthcare Private Limited. There he is. And Mr. Anish Bafna, Managing Director and CEO, Healthium Medtech. Let's welcome him. Let's welcome them, ladies and gentlemen, with a warm round of applause. And with that, without wasting any time, I now hand over the conversation to Ms. Rupali Mukherjee, who will take this dialogue forward. Madam, please.
Good afternoon, everyone. Welcome to our session on the Great Leap, India's rise as a global medtech leader. We have two distinguished guests here with us, Mr. Gaurav Agarwal and Mr. Anish Bafna. Welcome to you both.
Thank you.
So, since we are already running late, we'll quickly jump into the conversation. India's medtech sector has seen a huge transformation. It is now moving from import dependence to now local manufacturing, innovation, and an export push. So the growth is also reflecting in the market size. From a 16 billion market size, it's expected to increase to about 25 to 30 billion over the next 5 years. And what's driving this growth are a host of factors. You have the Atmanirbhar Bharat push by the government for local manufacturing, innovation, digital health. So these are the things which have been kind of leading this growth. Now, I would like to start actually with both of you. Now, let me start by asking you, looking back over the last 5 to 10 years, what stands out to you in terms of India's medtech growth? So, Anish,
Yeah, as was being spoken about in the morning, post-COVID, there has been a dramatic shift in the way the entire industry was both perceived, supported, and invested in. And if I remember correctly, about 6-7 years back, we had about 800 entities on the med device, med tech front. That has now grown to about 300 companies. So you have a huge amount of new entrants who are coming in and setting up shop in different reams of the med tech frontier. Gaurav in the morning spoke about the phenomenal growth the industry's had over the last 7 years. But what we are seeing now is an increasing acceptance of India-made products in the international markets. And quite a few of the companies now have the necessary registrations, the necessary accreditations that is allowing them to leverage the global market value and the domestic economies of scale, where the volumes sort of allow you to really reinvest back both on the manufacturing as well as on the innovation side.
Right. Gaurav?
So, I echo Anish, and I'm an eternal optimist, but I think my optimism is reflected in the data. We were a less than $4 billion industry in 2015, and it catapulted to $16 billion last year in 7 years. And I've said this in the morning, and I'll repeat this at the cost of being repetitive. But I think this decade to medical device industry is what 90s were to telecom, 2000 was to IT, and 2010 was to pharma. And there's several reasons for that. One is there is increased interest in the sector in general post-pandemic. In pandemic, we realized that we neither had the capability nor the capacity to produce COVID essentials. And in 3 to 6 months, the industry showed tremendous resilience, and we had export surplus. So the question whether it can be done in India or not was very effectively answered. We can. Today, I can proudly tell you that one of the world's largest ventilator and oxygen concentrator facilities exist in India. Right. We had technology for none of them. Second is a very enabling policy ecosystem today. I think today, for the first time as CII co-chair, just 2 weeks ago, I hosted a conference of the top regulators where the Drug Controller General of India, Deputy Drug Controller General of India interacted with us whole day on problems that plague the industry and how we can make the transition from good to great truly. And third, I think the global south that Dr. Naresh Trehan spoke about this morning. Now, medtech innovators, medtechpreneurs as we call them in India are realizing that the Indian market is only less than 2% of the global medtech market. And you have to produce in India solutions and products that are locally relevant but globally scalable.
Right, thank you. And you spoke about the policies, and that was what I was coming to. So what critical policies, regulations, or an ecosystem you think are most needed for this push forward?
The growth of any industry is dependent primarily on the captive consumption, especially in markets which are as large as us. And there are a few factors which are falling in place, but I think which need acceleration. One is the entire manufacturing ecosystem. The manufacturing ecosystem also involves the supply chain. Where we currently lag behind is that because the captive consumption is relatively small, you do not have a very large supplier base of components, of parts, and the dependency on imports on those components is also very high. Right. Now, as the local industry grows, as manufacturing comes in, new products come in, you will see that value chain, playing out, which will bring in both, scale as well as cost effectiveness, because access affordability is something which is definitely very important. The other thing is that there are two platforms that are getting created. One is a platform that has a good go-to-market, has access in the market, which primarily is focusing more on replicating successful products or models internationally, right? But these companies have scaled up and sort of cover the length and breadth of the country, and then of course move internationally, and they have sorted out the go-to-market strategy. There's an entire ecosystem of small companies which are primarily bringing in a lot of innovation to the fore. The thing is that they are two different, they are running parallel to each other, and the convergence needs to happen. Currently, in our industry, it takes time. By the time you design the product to bringing the product to the market, it's a 4 to 5 year process. And then an innovator struggles for getting access to the market. If we are able to bring these two sort of verticals together, then we will see the fostering of a lot of products that are built specifically either for the Indian patient or creating products that are capable of solving a lot of global medtech requirements coming out of India. There's lots more, but I think you'll do a better job of articulating.
I think I completely agree with Anish, and there's a reason why Technology Readiness 5 to TRL 8 is called the Valley of Death. 85% of the companies do not make that transition. They're able to make a great proof of concept, but they're never getting to prototype or productization. Now, I have a very simple framework, Rupali, to answer your question, because I'm not cognitively very intelligent. So I have an ABC framework: acknowledge, build, and champion. And I'll give you two very classic examples. First is India's medtech consumption per capita is the lowest in the world. You'd be surprised to know that it is half that of even country like Sri Lanka. Our medtech consumption per capita is about $3 a year. And even within the BRICS economy, we are one of the lowest. The fountainhead of innovation, Israel, has a medtech consumption of about $25 to $30 per capita. That needs to increase. Anish spoke about domestic consumption. I think the domestic consumption needs to build. So that's the part where you acknowledge what's missing. The second part is build. Anish also spoke about a component ecosystem. We cannot truly be creating in India, we'll only be assembling in India, unless we do not have an enabling component ecosystem, which is where parks like AMTZ and several others are of great relevance. Third is champion. You cannot be acknowledging where you have import dependence or you don't have Atmanirbharta, be building that and not consuming it. In our country, we have a very strong public procurement order, but there is no regulator to follow it. most of the public procurement happens with discriminatory specifications against the local producers. So you need to both do A, B, and C, acknowledge, build, and then champion their cause. The second thing I'll speak about very briefly though is GERD, gross expenditure on research and development as a percentage of GDP. There also we are under 3%, one of the lowest. Again, harking back to China or Israel, they're twice or thrice our levels. The schemes that today we have give you 30% of your capital outlay for R&D. But I'm giving you an example. If somebody is developing a project which needs 10 crores and he had 7 crores in the bank, chances are he'll manage the other 3 crores as well, right? In China, they give you $1 million grants for technologies that are import dependent. I think those were a couple of points that I had.
Right. And those are really very valid points. I understand you have to have a domestic play. You need to kind of have a supply chain so that you can, have an ecosystem. You can build an ecosystem. But you have initiatives now like the Atmanirbhar Bharat, which is there. You have the PLI scheme, which is started. So how are they kind of contributing to this ecosystem now?
I think in the last 5 years, the ecosystem has really started fostering with a lot of pace. Where we really need to sort of fine-tune some of these policies is the PLI has to be opened up to smaller companies as well. There's a minimum size of investment, there's a minimum size, a minimum amount that you need to export out, and for a single product company that becomes very, very difficult, right? So, how do we give enough capital to smaller companies, innovators, to sort of really build and accelerate and bring products to the fore? That becomes extremely important. I mean, we are going to be adding 34,000 more beds over the next 4 or 5 years. As I mentioned, the number of companies is coming. So there's a lot of things that are happening currently, but they're all happening in different silos. Now, one is, of course, a process of transition and transformation, which takes time. But if we are able to bring it all together, then we will be able to accelerate the growth element. Currently, as an entrepreneur, I might not even know of a lot of policies that exist. And if we can just sort of put them together in one place where everybody knows that this is how I can progress if I were to start a company from scale, or if I were to bring a new product and then create a go-to-market around it, that would solve part of the problem. The other thing is that I think the players who have really been ahead of the curve in terms of creating a platform here, they will have to open up and bring in more innovation, either through their own R&D spends or by nurturing an ecosystem and supporting the smaller companies or the smaller product innovators to bring their products to the market. Ultimately, it's all about scale and ensuring that we are able to cater to the domestic market size and take the products international.
Right. You would want to add?
I think PLI in its initiation was a huge enabler, but I think the contours of the policy were not drawn right. And I'll give you an example why I say that. The average size, and here I'm talking on behalf of IMED, I'm a joint coordinator for All India Medical Device Manufacturers Association also. The average size of an Indian medtech company is $5 million. 5 million. The growth target set to be, we are a beneficiary, and this is more poignant because it comes from a person who leads among the top 10 medical devices in the country. He finds the threshold to be high. So you can imagine, and I represent top 1% medtech companies in the country, but even for us, achieving 60 crores of incremental revenue year after year on an accumulated basis is nearly impossible. Out of 28 people who were selected as beneficiaries, I think there were only 3 who actually ended up getting the benefit. Could it be rethought in its version 2? Perhaps yes.
Right. So, but we have made some strides in terms of, getting a digital economy. I mean, we have a digital health, a lot of digital health initiatives which are there. And you are a pioneer in terms of the cardiac devices. So how do you see AI and digital technology now kind of going forward, helping you in growing the business?
Very valid question, and my favorite on that is that anywhere I go, I say that AI in medtech context is not artificial intelligence, it's academia industry collaboration. But I'll stick to digital health and AI, actual AI. So I think the industry is pivoting from industry 4.0 to industry 5.0. Similarly, healthcare is moving from 4.0 to 5.0, where from EMRs, digital health records, telemedicine, we are moving towards collaborative AI. We are moving towards personalized diagnostics, right? So at Innvolution, our goal is to create an ecosystem where cardiovascular care becomes more accessible to a large part of the world. We are truly on a mission to democratize cardiac care, whether on the imaging side or on the implantable side. And AI is helping us do a lot of prognostic work. We also today have tools that enable physicians to complete a procedure with greater safety and efficacy, with very little consumption of radiation, harmful radiation or contrast. So those kind of initiatives, and I think with SAMD being identified as a vertical within medical devices, I think digitization and AI ML are going to play a huge role in creating a completely new industry segment.
What would be SAMD? Sorry,
It's software as a medical device. So it now worldwide.
Not very well, and I don't think so. We very well versed.
Yes. So we also realized it that now there is a regulation for it, and there is a complete regulation with their MDR 2017 called 62304 standard, which is defined for software as a medical device.
For the medical imaging, you're saying?
Anything. If you're selling a software as a medical device, whether it's doing prognostic work, diagnostic work, or therapeutic work, there is a separate section within MDR 2017 that you need to comply to.
Right, right. So keeping in view the regulations, the certification, and you have this huge access gap in India, how are you trying to ensure that the affordability angle is met? And keeping in mind, of course, the quality, which is so important as well.
I'm sorry, because...
it's a question for you, and then we'll...
Yeah, so actually when we set out building a cath lab, there are only 8 manufacturers of cath labs worldwide. But having spent my formative years in cardiovascular companies, it was painful to see people arrive dead in tier 2, tier 3 hospitals because they didn't have availability of a cath lab. And we decided we'll do something about it, but honestly, it happened purely by serendipity. But we started our journey with 95% imported bill of material, 95%. This was 2018. Today, I'm proud to tell you that 55% of our bill of material is sourced in India by Indian companies, manufactured for us. We're running out of time, I guess. And by December of this year, we'll become the cost leaders for a cath lab globally, because we've been able to create value chains and supply chains within the country. And about the quality aspect, we are probably the most awarded cath lab globally today. We've won every single international design award that there is on our cath labs. So it's possible to make something that is relevant locally and scalable globally.
Right. That's really great. I mean, in terms of, ramping up the business and bringing it and trying to meet both is, I think, it's a big challenge. Coming to you, Anish, your company is one of, I think, is exporting to about over 80 plus countries. So how does Healthium kind of balance the export growth as well as the Indian play? The global growth and the Indian play.
So, again, for global growth, you have to invest ahead of time in terms of your regulatory accreditations, in, creating products that sort of suit to that particular market, and also ensuring that, your quality parameters are all out there, which caters to a large global footprint. However, the base of our business and the mother market is India. This is where we and our focus has all been on scale. So what does it take for us to be the number 1 or number 2 player in the country, at least from a volume perspective, right? So we are now India's largest volume player for sutures. We've created an arthroscopy product portfolio where we are now number 3. And the entire idea is that if we are able to leverage the economies of scale out here in India, it becomes a great platform for us to do clinical work out here, to make our manufacturing footprints more robust here, to invest more in R&D and new product development here, and then cater to the global market. And in some of the areas, what we are really doing is we are inverting. So for example, if you were to go for shoulder surgery today and get a new shoulder, it is a shoulder which is designed for a Caucasian bone and retrofitted for you. We are doing the reverse. We are creating a shoulder that is designed for the Asian bone, and then it will be retrofitted for the Caucasian bone, right? So I think you really need to have the patient at the center of what we are doing. Absolutely. And for us, the center of gravity is India. Our patient centricity revolves around India, and then we sort of take it outside.
Right. So if I were to ask, and this is a question for both of you, if I were to ask if you have described in one word, or maybe two words, what India needs to do most to drive, and for the push to drive this medtech change, what would that be?
I think if there's one thing that we need to do is don't compromise on quality. A lot of time we come with a trading mentality, and we have got a phenomenal potential right now. There's a big opportunity to create global brands, but this sort of trading mindset that comes into the play of wanting to scale up fast by compromising either on quality or circumventing some of the regulatory requirements, that just takes the entire country's image down, and then it takes a long time to repair that, right? So I would say, let's focus on building global brands. Let's look at collaborating, because there's so much happening with 3,000 players in the country. There's enough that we can all come together and do. There's an entire multinational ecosystem out here. Let's work with them and support them in their R&D, in helping them in creating products which are specifically suited to our markets, considering the size of what we have, and then create global brands. This going and playing on cost, going and undercutting each other is not going to get us anywhere. We'll just sort of keep on bringing our image down.
Yeah, both very valid points in terms of you need to grow and then look at exports as well.
So since you said one word, build local, think global. 98% of the market is outside India, and any medtechpreneur having his sight and eyes only on the domestic market will face a scale-up challenge at some point in their journey.
Right. Thank you so much for the Gaurav and Anish for this stimulating discussion. And the takeaways which I understand from this is that we need to have a stronger R&D. We didn't touch upon the fact that access to capital is very important, but since we're short of time, we're not looking at that. So a stronger R&D collaboration, you have the innovation play, you have initiatives, and these together could make India to grow its share from a 2% right now in the 680 billion market, or the global market, and grow by 2% further and establish as a global powerhouse. Thank you so much.
Thank you very much, Ms. Mukherjee, for steering that brilliant conversation. I now request Mr. Gaurav Agarwal to please do the honors and help us thank first the lady, Ms. Rupali Mukherjee, Editor, Pharma, Times of India. Let's hear it for her with a huge round of applause, ladies and gentlemen. Thank you, madam. Since we're struggling with time, ladies and gentlemen, we've had to squeeze in all the sessions. And now I request you, sir, to please help us thank Mr. Anish Bafna, Managing Director and CEO, Healthium MedTech. Let's hear it, ladies and gentlemen. And the photographer is going to need a group photo opportunity now of the three of you. So please give us that group photo opportunity. Ladies and gentlemen, with that, we now take a break for lunch. Lunch has been organized in the adjoining rooms, hall number 3 and 4. And our volunteers outside will guide you. So please do join us for lunch. And we will start here at 2:30 sharp. So I request you to come back maybe a minute or two before 2:30 so that you don't miss the proceedings. 2:30 p.m. sharp, we will start with the next plenary session, ladies and gentlemen, which is plenary session 2 on enhancing skill development and workforce readiness in medtech. So please do enjoy your lunch and come back a couple of minutes before 2:30 p.m. back to this room for the plenary sessions. For now, I invite you to hall number 3 and 4 for lunch, ladies and gentlemen. Thank you very much once again.
Japan, care is not rushed. It's thoughtful, precise. For over 70 years, this is how Nipro has approached healthcare. Not as an industry, but as a responsibility. At Nipro, we live by an old philosophy, Sampoyoshi. Good for the seller, good for the buyer, good for society. Because when care is shared, everyone benefits. In India, we found a shared belief that healthcare is a calling and that behind every product is a person. That's why we bring more than technology. We bring experience, trust, purpose. We listen to Indian healthcare professionals and build with them in mind. Every vial we mold, every device we shape, every innovation we offer carries a promise that began in Japan and now continues in India. It's not just about enabling people to live their lives. It's about helping them live better. Nipro, Japanese precision, Indian purpose. Live longer, live better.
Welcome to Teleflex. We are a global provider of medical technologies and are focused on driving long-term, durable growth. We apply purpose-driven innovation to benefit patients and healthcare providers. We have over 23,000 products across 7 clinical areas. We employ more than 14,000 employees in over 30 countries, and we serve over 100,000 customers worldwide. Our core values define our company, shaping our corporate culture and guiding our business practices. Our core values place people at the center of everything we do. We believe in sharing information across the organization, so all of our employees feel connected to the business strategy and goals. We are committed to advancing our environmental, social, and governance practices through our Corporate Social Responsibility Program. This also enables us to connect with our stakeholders through efforts such as diversity, equity, and inclusion, product stewardship, and community engagement and volunteerism.
Terumo was founded in 1921 by several scientists and physicians, including Dr. Shibasaburo Kitasato, with a vision to create Japan's most reliable, high-quality thermometers. Now, a century on, Terumo have evolved into a world-leading medtech company. Guided by our group mission of contributing to society through healthcare, we have expanded operations to over 160 countries and regions. Our dedicated team of 30,000 associates worldwide delivers more than 50,000 innovative products and solutions to medical settings. Since our foundation, we have continued to strengthen healthcare's foundations with 23 R&D bases and 34 production bases globally. We develop a wide range of products for treatments and procedures, including vascular intervention and cardiosurgical solutions, blood transfusion and cell therapy technology, to medical products essential for daily clinical practice, such as transfusion systems, diabetes care, and peritoneal dialysis treatments. We are dedicated to delivering superior quality, cutting-edge solutions across all our products. At Terumo, we take pride in our role as a medtech company, as we contribute to the patient's quality of life, healthcare professionals, and society. We are committed to delivering value in healthcare.
We see you. We recognize your struggles and your pains. We see you. We care about what matters to you. We see you. We believe in your hopes for tomorrow. A diagnosis alone doesn't tell the full story. True solutions begin by looking deeper. That's why at Terumo, the patient is always at the heart of our work with healthcare professionals. We strive to drive the future of healthcare forward. Because to us, progress means bringing care closer to you.
We all fall down, we get banged up, but the scars show what we're made of. Don't you look back, lift your head up, shake the dust off, tell me what you're made of. I can't hear you breathing, our lungs beating, our heart. Lift the voice, you got something to say. It's a brand new day. 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 When the rain falls, when the ground shakes, when the wind blows, when your heart breaks, show me sorrow, show me laughter, show me starlight, show me what you have to. I can't hear you breathing, our lungs beating, our heart. Lift up the voice, you got something to say. It's a brand new day. 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 See the sunrise, oh, fire in your eyes, oh. It's about time we all saw you shine. It's a brand new day. 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 It's a brand new day.
A single-minded focus, a mission-driven spirit. You are what you do, and what you do is move healthcare forward. Your patience, your care, your expertise, focused on an outcome, a result, a goal. But with changing needs and ever-evolving demands, it helps to know who is on your side to help discover, diagnose, and deliver. You may have heard of us. You may have even seen us. But now is the time to get to know us and why we're made for what's next in health. We've always been there, in more places than you may know, doing work today for all your tomorrows. Because when you're talking healthcare, you're speaking our language. We are BD. We understand the future can be unpredictable, yet full of possibilities. That's why we're constantly improving, turning what if into what is for more than 125 years. What you need now and what you need next is what we're made for. Matching your expertise with our innovations, and the only way we measure our success is by yours. In your offices, in your labs, and in your hands. For your patients, your families, your communities, and wherever care is needed and delivered. Because the future is more promising when we work together, when we innovate together, knowing we can make tomorrow better together. BD, advancing the world of health.
Life. It doesn't always unfold the way we imagine, but we all aspire to experience more of it. More time to connect with loved ones. More dancing, more playing, more celebrating, more living. Everything we do at Boston Scientific is so that patients can experience more. From our beginning, we've held a bold belief that meaningful innovation could transform medicine and add more to patients' lives. But creating profound advancements in clinical practice requires more than technology alone. It requires insight, courage, and the kind of collaboration that's rooted deep in our DNA. Working globally, listening and learning alongside healthcare professionals and patients is how we strive to tackle healthcare's greatest challenges. Never satisfied with the status quo, we have a passion for innovation, and together, we build solutions that extend and elevate life. With the same caring and winning spirit that got us here, we'll stay humble and driven. Driven to develop the best technologies and therapies. Driven to collaborate with our customers, and driven to advance science for Steve, Roy, Kyra, Rod, Cynthia, and millions of patients. Together, we're advancing science for patients for life.
In a world where large parts still face healthcare challenges, we decided to challenge the norms. With a simple vision, access to precision medtech for every patient globally. And we believe we have challenged the notion that Indian medtech can't be a global leader. Challenging it with our focus areas: advanced surgery, wound care, and arthroscopy. With 52,000 SKUs, our precision medtech products are used in 1 in 5 surgeries globally. Healthium today has a proven track record of commercializing its products. With a seasoned leadership team backed by an experienced board, our belief that we can is constantly challenging the norms and helping change the world. Because we believe that the change we bring matters. Healthier. Each life matters.
In Japan, care is not rushed. It's thoughtful, precise. For over 70 years, this is how Nipro has approached healthcare. Not as an industry, but as a responsibility. At Nipro, we live by an old philosophy, Sampoyoshi. Good for the seller, good for the buyer, good for society. Because when care is shared, everyone benefits. In India, we found a shared belief that healthcare is a calling, and that behind every product is a person. That's why we bring more than technology. We bring experience, trust, purpose. We listen to Indian healthcare professionals and build with them in mind. Every vial we mold, every device we shape, every innovation we offer carries a promise that began in Japan and now continues in India. It's not just about enabling people to live their lives. It's about helping them live better. Nipro, Japanese precision, Indian purpose. Live longer, live better.
Welcome to Teleflex. We are a global provider of medical technologies and are focused on driving long-term, durable growth. We apply purpose-driven innovation to benefit patients and healthcare providers. We have over 23,000 products across 7 clinical areas. We employ more than 14,000 employees in over 30 countries, and we serve over 100,000 customers worldwide. Our core values define our company, shaping our corporate culture and guiding our business practices. Our core values place people at the center of everything we do. We believe in sharing information across the organization, so all of our employees feel connected to the business strategy and goals. We are committed to advancing our environmental, social, and governance practices through our corporate social responsibility program. This also enables us to connect with our stakeholders through efforts such as diversity, equity, and inclusion, product stewardship, and community engagement and volunteerism.
Terumo was founded in 1921 by several scientists and physicians, including Dr. Shibasaburo Kitasato, with a vision to create Japan's most reliable, high-quality thermometers. Now, a century on, Terumo have evolved into a world-leading medtech company. Guided by our group mission of contributing to society through healthcare, we have expanded operations to over 160 countries and regions. Our dedicated team of 30,000 associates worldwide delivers more than 50,000 innovative products and solutions to medical settings. Since our foundation, we have continued to strengthen healthcare's foundations with 23 R&D bases and 34 production bases globally. We develop a wide range of products for treatments and procedures, including vascular intervention and cardiosurgical solutions, blood transfusion and cell therapy technology, to medical products essential for daily clinical practice, such as transfusion systems, diabetes care, and peritoneal dialysis treatments. We are dedicated to delivering superior quality, cutting-edge solutions across all our products. At Terumo, we take pride in our role as a medtech company, as we contribute to the patient's quality of life, healthcare professionals, and society. We are committed to delivering value in healthcare.
We see you. We recognize your struggles and your pains. We see you. We care about what matters to you. We see you. We believe in your hopes for tomorrow. A diagnosis alone doesn't tell the full story. True solutions begin by looking deeper. That's why at Terumo, the patient is always at the heart of our work with healthcare professionals. We strive to drive the future of healthcare forward. Because to us, progress means bringing care closer to you.
We all fall down, we get banged up, but the scars show what we made of. Don't you look back, lift your head up, shake the dust off, tell me what you're made of. I can't hear you breathing, our lungs beating, our heart. Lift up the voice, you got something to say. It's a brand new day. 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 When the rain falls, when the ground shakes, when the wind blows, when your heart breaks, show me sorrow, show me laughter, Show me starlight, show me what you have to. I can't hear you breathing our lungs, beating our heart. Let's take a verse, you got something to say. It's a brand new day. 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 See the sunrise, oh, fire in your eyes, oh, it's about time we all saw you shine. It's a brand new day. 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 It's a brand new day.
A single-minded focus, a mission-driven spirit. You are what you do, and what you do is move healthcare forward. Your patience, your care, your expertise, focused on an outcome, a result, a goal. But with changing needs and ever-evolving demands, it helps to know who is on your side to help discover, diagnose, and deliver. You may have heard of us. You may have even seen us. But now is the time to get to know us and why we're made for what's next in health. We've always been there, in more places than you may know, doing work today for all your tomorrows. Because when you're talking healthcare, you're speaking our language. We are BD. We understand the future can be unpredictable, yet full of possibilities. That's why we're constantly improving, turning what if into what is for more than 125 years. What you need now and what you need next is what we're made for. Matching your expertise with our innovations, and the only way we measure our success is by yours. In your offices, in your labs, and in your hands. For your patients, your families, your communities, and wherever care is needed and delivered. Because the future is more promising when we work together, when we innovate together, knowing we can make tomorrow better together. BD, advancing the world of health.
Life. It doesn't always unfold the way we imagine, but we all aspire to experience more of it. More time to connect with loved ones. More dancing, more playing, more celebrating, more living. Everything we do at Boston Scientific is so that patients can experience more. From our beginning, we've held a bold belief that meaningful innovation could transform medicine and add more to patients' lives. But creating profound advancements in clinical practice requires more than technology alone. It requires insight, courage, and the kind of collaboration that's rooted deep in our DNA. Working globally, listening and learning alongside healthcare professionals and patients is how we strive to tackle healthcare's greatest challenges. Never satisfied with the status quo, we have a passion for innovation, and together, we build solutions that extend and elevate life. With the same caring and winning spirit that got us here, we'll stay humble and driven. Driven to develop the best technologies and therapies. Driven to collaborate with our customers, and driven to advance science for Steve, Roy, Kyra, Rod, Cynthia, and millions of patients. Together, we're advancing science for patients for life.
Ladies and gentlemen, welcome back. May I invite all our eminent delegates to kindly join us back in the room and take seats, please. We're going to begin in 5 to 7 minutes from now. I invite all our eminent participants to kindly join us back in the room and be seated. since we're going to be starting in about 5 to 7 minutes, ladies and gentlemen. I thank you very much for your kind cooperation. We will start on time. Thank you for coming back in the room.
In a world where large parts still face healthcare challenges, we decided to challenge the norms. With a simple vision, access to precision medtech for every patient globally. And we believe we have challenged the notion that Indian medtech can't be a global leader. Challenging it with our focus areas: advanced surgery, wound care, and arthroscopy. With 52,000 SKUs, our precision medtech products are used in 1 in 5 surgeries globally. Healthium today has a proven track record of commercializing its products. With a seasoned leadership team backed by an experienced board, our belief that we can is constantly challenging the norms and helping change the world. Because we believe that the change we bring matters. Healthier. Each life matters.
In Japan, care is not rushed. It's thoughtful, precise. For over 70 years, this is how Nipro has approached healthcare. Not as an industry, but as a responsibility. At Nipro, we live by an old philosophy, Sampo Yoshi. Good for the seller, good for the buyer, good for society. Because when care is shared, everyone benefits. In India, we found a shared belief that healthcare is a calling, and that behind every product is a person. That's why we bring more than technology. We bring experience, trust, purpose. We listen to Indian healthcare professionals and build with them in mind. Every vial we mold, every device we shape, every innovation we offer carries a promise that began in Japan and now continues in India. It's not just about enabling people to live their lives. It's about helping them live better. Nipro, Japanese precision, Indian purpose. Live longer, live better.
Ladies and gentlemen, welcome back. We're a minute away from plenary session 2 on enhancing skill development and workforce readiness in MedTech. And I invite you all to please be seated since we will start on time, which is 2:30, which is less than a minute away. So ladies and gentlemen, as India strengthens its position as a global hub for medical device innovation and manufacturing, one truth stands out, that the future of MedTech will be defined not just by technology, but by people who power it. Developing a highly skilled, future-ready workforce is going to be pivotal to sustaining this growth trajectory. And this session will bring together industry leaders, policymakers, and academia to explore strategies for building a MedTech talent pool that can compete on a global stage. I invite you all, ladies and gentlemen, to please take seats. We have discussions in this session on bridging skill gaps, strengthening industry-academia collaboration, upskilling and reskilling programs, leveraging digital training technologies, creating policy support, and driving global competitiveness. In a sense, this conversation is about preparing India's workforce to innovate, adapt, and lead in the evolving landscape of MedTech. So I invite you all to please be seated. Please take seats, ladies and gentlemen, so we can begin. I invite all the eminent participants who are still outside in the pre-function area to kindly join us in the room and be seated, please. We have to begin with this plenary session 2 on enhancing skill development and workforce readiness in MedTech. Thank you very much for joining us back in the room. Please be seated. Welcome back, and please be seated, ladies and gentlemen. We're starting with our next plenary. In this session, ladies and gentlemen, we have our eminent panelists who are going to be gracing this dais very shortly. Mr. Aseem Sahu is here. He was in one of the earlier sessions as well. Deputy Drug Controller, Central Drugs Standard Control Organization, Ministry of Health and Family Welfare, Government of India. Professor Shailendra Saraf, Director, National Institute of Pharmaceutical Education and Research, Ahmedabad. Mr. Gautam Bhattacharya, CEO, Life Science Sector Skill Development Council. Mr. Milind Suresh Papu, CEO, Nipro Medical India Private Limited, and Mr. Nitin Gupta, Managing Director, India and South Asia, Fujifilm Sonosite India Private Limited. I invite you all to please now take seats, ladies and gentlemen. Those at the back. I know. An invitation to all the eminent participants to kindly make their way to the room and be seated. Thank you, thank you. I seek your cooperation in getting this house in order. Delegates, please make your way back to the room and be seated. I thank you very much. Thank you for joining us back in the room, ladies and gentlemen. Our panelists are here, ladies and gentlemen, and some of them have to leave for their very important appointments as well after this. So I request you all to please now gather back and be seated. Thank you so much. Ladies and gentlemen, this is an invitation to everyone who's still outside in the pre-function area to please join us back in the room and be seated. Thank you. I welcome you all back to this room, ladies and gentlemen. I hope you had a good lunch. I invite you all to please now be seated. I thank you very much. Please be seated. Thank you. If the panelists are on here, we can start. He had to leave. He's not there. So you're removing his chair. All right, ladies and gentlemen. So I have been signaled to begin, which is why this is my final announcement for all our participants outside so that we don't miss the proceedings. Please do join us quickly and be seated. I thank you very much for your kind cooperation. So this plenary session 2, Enhancing Skill Development and Workforce Readiness in MedTech, ladies and gentlemen, is going to address how India can really bridge skill gaps, align academia with industry, leverage digital training, and build a globally competitive MedTech force. It is indeed my honor to invite on stage Professor Shailendra Saraf, Director, National Institute of Pharmaceutical Education and Research, Ahmedabad. Let's welcome him to the dais, ladies and gentlemen, with a huge round of applause. Warm welcome, sir. May I invite Mr. Gautam Bhattacharya, CEO, Life Science Sector Skill Development Council, to kindly grace the dais. Warm welcome to you, sir. Ladies and gentlemen, can we please hear it for each of our panelists? We've just had lunch. I'm sure we've got a lot of energy. And I invite Mr. Milind Suresh Papu, CEO, Nipro Medical India Private Limited. Let's welcome him. Warm welcome, sir. Mr. Nitin Gupta, Managing Director, India and South Asia, Fujifilm Sonosite India Private Limited. There he is, joining us onto the dais. And moderating this panel will be Dr. Shabnam Singh, Principal Advisor, Healthcare, Confederation of Indian Industry. Let's welcome the lady with a big round of applause, Dr. Shabnam Singh. Warm welcome, ma'am. And with that, it is my privilege to hand over the session to you, madam.
Thank you. Welcome back. I have to say I'm happy seeing that at least there are some people straight after lunch, a long delayed lunch, which is considered, any session after lunch is called the graveyard session. So please don't go to sleep on me. We'll try and keep this as crisp as possible. Mr. Sahu unfortunately had to leave, but I did spend a lot of time with him understanding where the government is coming from and what they are doing, which I would share briefly after we finished with our panel discussion. Right from the morning, and in the interest of time, everybody's got flights to catch, so we will try and wrap it up in half an hour. If need be, we'll extend it. The need for innovation comes up repeatedly, that if the medtech sector has to actualize itself, innovation is extremely important. What are the challenges which lie behind the innovation? Some of those Mr. Sahu did share with us and say what the government is doing on that perspective. Then the other side of it is that the users themselves are not in sync or, I won't say prepared. They know they have to use the technology, but they actually don't know the 9 yards of how it is done. So then it becomes like a double whammy, and in between gets sandwiched is the person who actually manufactures the technology. So it is a situation ripe for disaster on one side, And on the other hand, it's a great place to be in to be able to solve for the cost of care. Clearly, the cost of care is not going to come down. The cost of medical technology will constantly move up because that is what innovation brings with us, that things get more and more expensive. So how do you make this happen so that the actualization of Heal in India by India for our people and universal health coverage for all of us sitting in this room actually becomes a reality? So with that, I would like to first move to Professor Shailendra Saab. Sir, as director of the NIPMERS, how have you seen this evolve and where do you see this trajectory of something where knowledge and application is evolving so rapidly? What is it that you see can be done both by the industry as well as institutes like yourself to solve for this problem?
So thank you very much for giving me this opportunity. Thank you, CII. And like my last appearance, I suggested to include more academicians into your this cohort. So if possible, you should have another wing of academics because you cannot, nobody can live in isolation. So like this industry paradigm shift 4.0, it's a beautiful example of amalgamation of all physical sciences and biological sciences and IT. This is the typical example with the medical devices as well. This emergence has demonstrated that it is still growing, but the country as such is not prepared. What is the academia in India is we love to work in isolation. And when talk about industry research and this industry research and academia, all are sacred islands, but the link is missing. So this is need to have proper connect between those sacred islands. It's very easy to blame the academia. But we forget when we are criticizing academia, we forget that we all are product of academia. So with this line, I can start my statement. This medical device, nobody can independently come out with a 100% solution to cater the industry or academia or research. So this requires a lot of collaboration. When I was heading one of the task force of the government of India for the medical devices, so they were expecting too much. And academic institutions always feel they can do anything. But they forget they cannot do everything. So there is a need to identify institutions which are having the proper connect with the industry, and accordingly they are providing the manpower with the specific need of a specific industry. So this is a big task before us, to industry as well and to the academia. And for this, if you allow me, I will right away, I can give a suggestion. At CII level or any association level, there is need to identify few areas, and accordingly you can map those skill set requirement with academic institutions to define their programs. Like I can give my example. NIPER Ahmedabad is offering a course which is having more focus on orthopedic joints, implants, and IVDs. If you talk about the NIPER Hyderabad, so again they are working on blood devices. And nobody is working in the field of high-end electronic devices. So this is a huge task before the academia, not only academia, as a nation, to cater, to address those areas if we really want to have the indigenously engineered medical devices in the market.
Thank you so much for the suggestions, sir, as well as what you very rightly pointed out. We have different moving parts of the entire ecosystem which do not necessarily speak to each other adequately. That's part one of the story. Part two, as Mr. Sahu also mentioned, that within एक होता है ना भावना होती है, there is an इच्छा to do things. So even that now has to be fast forwarded in schools, and from the beginning, that intuitive search for knowledge, intuitive need for children to want to solve for problems. Exactly like what Dr. Trehan said, that if everybody started thinking in terms of solving for a problem, then the innovation will truly happen. As far as the relationship between the industry and the academia and training institutes, we have got them here from the Life Sciences Sector Skill Council. So I'll be very honest with everybody. Till I did not join and be part of the Life Sciences Sector Skill Council, as a practicing clinician, you take it for granted that your technicians will be able to manage the equipment, and you just come, apna prescription likha, bola ye kar dijiye, and nikal gaye. But what lies behind it, we actually had we didn't have visibility in it. So life has changed a lot for all of us. So Gautam, where do you see in the years that these sector skills councils have come and this forging of relationships between academic institutions, training institutions and the industry, is there a stickiness in that relationship? Is it giving you a sense that yes, it is having an impact? Over to you.
Thank you very much, ma'am. First of all, thank you CII for this invitation. I've been very vocal in saying that in all such kind of meetings, we should have a session on the skills. And I'm glad that we have one and we are talking about skills. You know, we all have aspirations, we all want to grow, and we all know also that without skilled manpower, it is not possible. It is rather impossible. So you can't be growing your organization on machines unless you have trained hands on those machines producing great quality products. And for that, you need skilling. With that premise, I want to answer you first, ma'am. In my opinion, I come from the industry, and when I came into the Sector Skill Council, I realized that first of all, where's the supply coming from? Supply is coming from academia. Where's the demand coming from is the industry. So when I went to the industry and said that, tell me your demand. So they said, we have these many demands. However, we can't be taking the academia folks just like that because we feel that they are not trained on the industry ready skills. We started to then figure out where can we, skill these students on the industry-ready skills. One of the point that the entire skilling ecosystem missed, in my opinion, was creating enough infrastructure for training. And there are two components to it. One is the trainer, who's training, and second, where is the training happening? So, for example, if one student calls me up and says that, Gautam, I want to get skilled on certain program, where should I go? I should have an answer, right? Now, the training centers and the training infrastructure that we created in the country so far failed to impress me, to be very honest with you. So what we have started to do is, we went to a organization like, for example, Milind's organization, and we say that, Milind, you want a certain kind of skilled manpower, right? So would you be interested to invest a little bit on this? And okay, you have a CSR requirement and this kind of funds. So why don't we create some infrastructure on training? We successfully did this 4 initiative, ma'am. One of the initiative, and I would like to quote here, this is Pharma initiative. So we have a AC classroom with modern facility of education. So we have trainers who are well-educated trainers from the industry, training them. 30 of the students, they were doing hands-on on the real-time machine which is at the shop floor or the manufacturing of pharma company. So we got 3 or 4 of those machines. These students will come up and they'll change. They'll change on the clean room dress. They will sweat inside to know exactly how it feels inside the manufacturing setup. They'll go practice themselves for 4 to 5 hours to 6 hours a day as if they are replicating the manufacturing unit setup. They did it for 3 months. So for the 30 student, I just finished the convocation of the first batch, we got 60 offers. They said, people said, we want these kind of people. So I think what we have to do very critically is we understand the skill gap. So if you ask me what are the skill gap of MedTech, I will be able to tell you. We understand what programs are required. So with DOP, we created programs. There are 11 master's program which will be run by best of the academic institutions like IITs, NIPER, NIT and everybody. But then where do you do the training is the most important thing, in my opinion, right? So if we just fill that gap of training, I'm sure tomorrow somebody calls me up, where should I train myself on getting a best medical device testing, for example. I want to train myself on the testing. I should be able to give an address, go here. You will learn for 3 months the testing. And then I come to both of them and say that, do you want to hire somebody who's skilled on testing? They would say, yes, sure. They'll come and pick them up, and that fellow would be able to actually deliver skills that he's acquired in those training center. We do the certification or assessment is a separate thing. Now, I don't think that is more relevant. What is more relevant is skilled hands. And for that, we need infrastructure, in my opinion. That is one point I would like to emphasize.
Great. So the sense that I'm getting from Professor Saab and you are that Professor Sahu and Gautam is that compared to earlier, the problem statement is well understood and accepted. That is done. The second part, the availability of even sourcing students is also a challenge. I've been there, so I do understand. Matching a particular student, हम लोग बहुत बार क्या करते हैं, parents say become a doctor, engineer, nurse, and you get into that thing when actually आपका मन नहीं चाहता है ये करने के लिए. So you're never able to excel in what you're doing or be passionate about it. So today now that part has also been sorted out. The student is seeking it. The part which is missing is that after getting the knowledge, the translation into real-world application, there aren't places where you can go and train adequately. So I'll just share some sound bites before moving to Milith. In medicine, for us, it was very important. Internship was embedded in your training. Housemanship was your choice of what you wanted to. But given the paucity of healthcare professionals, now that has been removed. But from an application perspective, I can tell you truly, within the hospitals, when the children come, there is a serious lack of competency, right? And that serious lack of competency, it comes down in a trickle fashion. And while the numbers may be there, there'll be warm bodies, but if that warm body cannot deliver for you, then you are in serious trouble. And one area which one sees repeatedly coming up, and this I think for the house would be something that we all should internalize. Yes, if you get somebody who is not been trained, आप कहेंगे कल को कोई मेडिकल लीगल इशू हो जाएगा तो वो मेरे पे पड़ जाएगा, स्टूडेंट पे नहीं पड़ेगा. नहीं, I cannot let them come in and take care of this. So that is a real issue also. How do you protect somebody from providing space for training in the real world as well as protect themselves from any untoward reaction? The other issue is that in training institutions, and this is historic, आपने जो equipment ली है, you've put that in, is dated circa something. And the world is moving so fast today that you're not able to update that piece of equipment. So it becomes a challenge, Miran, and that's where I'd like you to weigh in. That while technology is moving with such rapidity, the learner is not on the same train. The learner is still on the platform when the train is hurtled away. So what do you suggest, or what do you think is the right way to address this?
My name is Milind from Nipro, but let me go back to start with a little bit on Gautam. Nipro came in 2010 to set up artificial kidney manufacturing. We had the know-how, we got a land from the government, but where to get 1,000 people to manufacture artificial kidney. Luckily, government came in a big way. They had a scheme called Learn and Earn scheme. So we picked up 12th pass people from the Satara, which is a small district next to Pune, and they were trained on the floor, on the shop floor of Nipro. And we gave a motivation that if you, after your on-the-job training, there was a little school in the factory, and they would go down for 2 hours or 1 hour in a day, and if they pass, if they do those tests, they get a diploma. And many of these people went on to achieve the diploma and they become more supervisors, and today most of them are also in charge of the shop floor. So what started with absolutely know-how in the Satara, we started with 1 line. Today in 15 years we have 5 lines. We produce 100 million artificial kidneys in India and we export to 25 countries. So I liked it, something which says make in India for the world. And this is all done by the Hindustani people. There were no, of course we got a training from Japan, but today this factory is managed by the Indians from the Satara district locally. Now the question comes is that we produce the goods. Where do we use them? We use it on patient, but we don't have a trained nurses. So dialysis patient requires a treatment all through our life, but because the nurses are not trained, they are maintained by technicians. And that is where we are thinking of collaborating with CII to have the upskill of the current nurses like GNM or ANM, who primarily do only delivery of the drugs. If they can be trained in 10 or 12 modules, they can do a dialysis, they can acquire dialysis skills. Probably they can get a job elsewhere also out of India. So huge opportunity for upscaling the training, and particularly life sciences skill institutes. We require hundreds of such institutes all over India. So yes, we can bridge the gap. There is a technology available, there are enough patients available. What is lacking is interface, which is a nurse.
So just to add on this, ma'am, today we have a possibility of shrinking the entire manufacturing line into a XR module, AR, VR, XR module, which can be trained, which can be created. The entire manufacturing line, we have got 5 or 6 of our modules converted into XR, and we just deploy it at around, say about 3-5 lakh rupees. People put in the headgear and start to operate. They are almost at about 60-70% proficiency of actually operating a machine. And if they miss any step, then the machine, that program points it out saying that this is where you've missed it, so you'll have to practice it again and again. Wish we could do it for GMP, good manufacturing practices. Just imagine, we can put it up everywhere and we have a good manufacturing practice, skilled manpower into the system.
Great. So Nitin, I'll come to you now. It's kind of coding down into the lack, or I won't say lack, the ability of the learner to come onto the shop floor. So clearly there is a gap between what the government's intent with the apprenticeship program is, right? So either they don't know it is there, and that is what Mr. Sahu also mentioned. He said awareness and penetration of what the government does to the learner is somewhat lost in translation. And the other is the willingness of the industry to adopt into mainstream. So the larger ones like say Milind is doing and others are doing. So how do we tackle this? How do we get the learner into the industry? What is required to make this happen?
So thank you, first of all. Thanks CII for having me here, and good insightful discussion I think happening, and it will definitely. So I always believe like the mission which we have developed India by 2047, and definitely we all know healthcare plays a vital role in 2 terms. One, of course, in financial terms, it enhances the GDP. Second, the healthier the country, the more GDP, like healthier people definitely will produce more, and definitely we will be able to reach that goal. Coming to that, like my experience is predominantly into diagnostics, and diagnostic is all about adoption of technology, because if you really see in a year or two, there is a huge shift in technology. So coming back to the topic, I think we see doctors like on the front of like diagnostic, whether it is ultrasound, CT, MRI, etc. But there are again technicians who are like using operating. And coming back to the topic of ma'am, what she said, in the adoption of the technology in terms of like acceptance, commercial acceptance, and then the people who will really operate that machine, that is also very, very important. And the topic came up like this new VR, AR tools which are there. So now like what happens, there are a lot of invasive procedure which we do. So now doctors and technicians can like really do it, and they can virtually prick a patient for maybe 300 times, which is technically not possible in a, like if you really do it in hands-on. So I think the technology is playing a vital role, and I think the collaboration between industry and like academia, which again and again being asked. So I think that plays like very critical, and like this way, with the help of AI, with the help of VR and the technology, we can like have a good skilled manpower. Is my thoughts.
Perfect. So CII, my own organization, is saying, ma'am, you've got to finish up because we were delayed in the pre-lunch. I'd just like to leave 2 points with everybody. And these are some data points. One is that by 2030, we will have approximately 1.4 billion youngsters between the ages of 18 to 24 coming into the workforce by 2030. And unfortunately, the number of jobs which are estimated to be available will be only 400 million. Because with the rapid movement of technology, those jobs are not being created. So there is a fantastic opportunity, not only for individual industries, but also for nation building, where if we can merge and we can work together. So create a platform for academia and industry, as well as have a platform where the potential of the equipment can be utilized for its impact and adoption, be created, co-create. And there I believe CII would be very happy to play the role of co-creation with you of this kind of piece, and we'll work on it. I'd love to take some questions, but if anybody of the panel would like to some last comments, and then I'll hand it back to the organizers.
So I would like to add here, you have mentioned co-created training program. So there is a need to have a co-created syllabus as well. So there is need for the industry to come forward, share their expectations. Because there is no single degree can cater the need of the industry. It's really more than 10,000 medical devices are listed under one list. So we cannot expect everything from the industry. What I'm saying, whenever we talk about the skilling, so we talk only about tier 3 level workers. There is equal need to produce the grooming of the leaders than tier 2 and tier 3 and tier 4 number of workers. So institutions like NIPERS, they are providing good leaders. And the most important, we can say, problem academia is facing nowadays, they have to produce graduates in such a way they are able to solve the problem of the future. And that too, this is expected, they have to solve the problems with the tools and techniques not yet invented. So you can understand this type problem. So when we talk about you talk about the 47 and everything, so there is an ample need of the leaders. And we can have the small training modules with our specific industry and specific line-specific modules to get the training, obtain those manpower. One single solution cannot give solution to the industry. So there is immediate need to the specific industry to identify their own needs, share those needs with the academic institution, their N number institutions, and if required, fund properly, and get those module implemented and get the trained manpower those academic institutions. This is the most effective model, in my opinion, may be suitable for the industry.
Thank you. Thank you so much, sir. And any questions, if you could take them offline. Over to you.
Very insightful perspectives. Thank you to our moderator and esteemed panelists. Now I request our moderator, Dr. Shabnam Singh to please help us thank our esteemed panelists here. Professor Shailendra Saraf, Director, National Institute of Pharmaceutical Education and Research, Naipur, Ahmedabad. And Mr. Gautam Bhattacharya, CEO, Life Science Sector Skill Development Council. Let's have a huge round of applause, ladies and gentlemen. Thank you for the applause. Mr. Milind Suresh, CEO, Nipro Medical India Private Limited. Mr. Nitin Gupta, Managing Director, India and South Asia, Fujifilm Sonosite India. And I think we need a photo opportunity first, gentlemen, before you go. Ladies and gentlemen, with that, thank you for the applause, everyone. Thank you very much, madam, and thank you. So, ladies and gentlemen, this session has underscored that skill development is not an adjunct but the foundation of India's medtech growth story. We've had a wonderful, wonderful deliberation there. Now we're going to transit quite immediately into the next session. This was a compelling discussion indeed, with very, very clear takeaways, bridging gaps, fostering collaboration and leveraging digital tools. India can indeed build a globally competitive workforce. And as we conclude this panel 2, we'll now go on to panel 3, ladies and gentlemen, which is on fostering global synergies for a thriving medtech future success stories from the globe as well. So I invite you to please remain seated. Don't go away anywhere. We will take under 2 minutes to reset the dates very quickly. But the session is about fostering global synergies for a thriving medtech future, success stories from the globe. And I'd like to say, in today's interconnected world, innovation cannot exist in silos. The medtech sector thrives when collaboration crosses borders, be it through co-development of technologies, regulatory convergence, global R&D partnerships, or shared capacity building initiatives. So I'm going to request you, ladies and gentlemen, to please remain seated here, because it's going to be a very, very compelling session as well. And this session will explore how nations can harness complementary strengths, technological leadership, we have manufacturing excellence, clinical research capabilities, and market access. So I'd like to now invite our eminent panelists to kindly grace the dais. We have a request from the organizers for members in the audience to join us in front, because we've got a lot of vacant chairs. So please do feel free to come and join us, join the conversation here in front as well. So as I was saying, we will also hear success stories from the globe, from nations that are known for their excellence in medical technology, regulatory innovation, and research leadership as well. And these global lessons will also provide us with practical strategies for forging trusted partnerships and delivering scalable, sustainable, and equitable medtech solutions worldwide. So we're almost set, ladies and gentlemen, for a session which will spotlight global partnerships in R&D, regulatory convergence, capacity building and market access, with success stories from Germany, US, Japan, from the globe, essentially. And just about set with the days, and we are about to invite our panelists onto the stage for this discussion, ladies and gentlemen. Can we start? So joining us on this distinguished panel, may I take the privilege of inviting Shri Rakesh Kumar, Deputy Director General, Department for Promotion of Industry and Internal Trade. Let's welcome him to the podium with a huge round of applause. Shri Rakesh Kumar, Deputy Director General, Department for Promotion of Industry and Internal Trade. Namaskar, welcome sir. May I invite Dr. Jitendra Sharma, Managing Director and Founder, CEO, Andhra Pradesh MedTech Zone, AMTS. And then may I invite, after Dr. Jitendra Sharma, it is Mr. Aditya Banerjee, Managing Director, B. Braun Medical India Private Limited. Let's welcome Mr. Aditya Banerjee as well. There he is, ladies and gentlemen. Mr. Arun Kaushik, Vice President and Managing Director, South Asia, Teleflex Medical Private Limited. Let's welcome him. Welcome, sir. Mr. Kulveen Singh Bali, Director, Regulatory Affairs, Philips India Limited. Yes, let us welcome him, Mr. Kulveen Singh Bali, ladies and gentlemen, the Director of Regulatory Affairs with Philips India. And to guide this important discussion, may I now take the privilege of inviting Ms. Priyanka Agarwal, Senior Partner and Managing Director, Boston Consulting Group. There she is, ladies and gentlemen. She'll be moderating the session. Ms. Priyanka Agarwal. So those are our very eminent panelists, ladies and gentlemen. And with that, it is my privilege to hand over the conversation to our moderator, Ms. Priyanka Agarwal. The floor is yours, ma'am.
Good afternoon, everyone. Thanks for having us on this stage. With every session after lunch, it becomes harder and harder. So hopefully we can capture your attention. To get us started and to make sure everyone's awake after that very nice lunch, let me just anchor the discussion on 2 or 3 highlights of the aspiration and why we're all here in the room today. So like I said in the morning session, today India's medtech sector is only 2% of the global medtech market. The aspiration which the respected minister also said for us that this should be multifold. So let us say over the period of next 10 to 15 years, India should have an aspiration of at least being a double-digit share of the global medtech market. And that double-digit share will not come just from volume. It will need to have a very vibrant manufacturing and R&D ecosystem in India. It will need a lot of convergence of the domestic local strengths combined with the MNCs and the innovation that they bring. And will need an enabling environment in terms of regulation, in terms of ease of doing business, so that together the sector grows and contributes not just in terms of volume, but innovation and leapfrogging technologies to the world. So that is how I would like to start it. Maybe to get us started, I first turn over the discussion to Shri Rakesh Kumar. He obviously represents a Department of Promotion of Industry and Internal Trade. Rakesh Kumarji, the government has obviously for a long time been promoting Make in India and obviously identified medtech as a sunrise sector where the government and the local industry should come together to make sure that we're not import dependent. And that in itself with the scale should also start to create innovation. So if you could throw us some light on what has the government done so far, but also what do you see as the next steps if we are to achieve this aspiration?
Thank you, madam, for having me today in this insightful discussion. As you know, DPIT, rather I must say, Government of India has issued just to promote Make in India, encourage manufacturing and manufacturing.
Can everyone hear you?
Am I audible?
Yeah, better. Yeah.
So just to promote Make in India and encourage manufacturing and production of goods in India, DPIT has issued a public procurement preference to Make in India order 2017. Then since then it has undergone several changes. Lastly, it was amended in 19 July 2024. So purpose of this order was to encourage production of goods and services and works in India, just to reduce the import dependence on foreign supply.
Thank you, Rakesh Kumarji. Maybe I will turn it over to Aditya. Aditya, tell us, Rakesh Kumarji just spoke about the local procurement order. It could be seen as a barrier to doing business in India, or it could be seen as an opportunity to really use India as a base and leapfrog both in India and abroad. So how do you think about this and how do you balance local manufacturing with your global supply chain?
Thanks so much. So thank you CII for inviting me to be part of this panel. B. Brown today operates in about 60 countries across the world, sells its products and services in almost 200, and we only manufacture in about 30. Now this was the classical model of having integrated global supply chain with a few production sites and selling across the world, which has worked for all these years. Of course, this is also what enabled us almost 50 years ago to set up our first plant in Penang, in Malaysia, and 3 plants in India 10 years back, more than 10 years ago. But now we see a change. We see that there is an increased focus on localization everywhere. Every country wants to be self-sufficient, especially after the scare of COVID, which means that this model probably will not work the way it has worked till now. And we need to innovate. The way I see this going forward is that as long as there is a scale, and as long as there are global quality standards which allow us to get a level playing field, multinationals like B. Brown will produce in the country where there is consumption. So we will need both scale as well as quality standards which allow us to manufacture the same quality of product that we manufacture elsewhere, because we strongly believe a life is a life is a life, doesn't matter what is the nationality of the individual. The second thing is that the second category of products, which I think needs to be seen differently, where it is simply not going to make sense to produce in every country every product. So there it is important, in my opinion, that rather than having the product being made in one country and sold in multiple countries, these products, I think, will get more and more made into a hub and spoke model, where you might find multiple players or multiple sites who form the hub, where you can use the scale, where you can use the skills and the capabilities to make a great product. And then you will have to use a spoke model to bring it to different markets, to customize it to those markets. So that will give us the agility. So I believe that going forward, multinationals will change, that some things will be produced in the markets where they're consumed, and some things will still follow a central manufacturing, but more and more of the activities in the value stream will move down to the markets.
No, thanks, Aditya, for those comments. I think so what the point you just made is that, for a long time and even more so going in the future, you do see India as one of the locations where a large part of the manufacturing can be based. Maybe I want to turn it over to Dr. Jitendra Sharma. You have been, obviously, I think AMTZ is definitely a beacon in terms of not just manufacturing and creating capacity, but almost creating an R&D ecosystem and a model which you want to replicate across, most of India. So if you could again talk about picking up on what Aditya shared in terms of the intent, both from local and MNCs to manufacture in India, what is the kind of infrastructure that is there in India today? And how do you think this can be scaled up and replicated?
Thank you, Aditya ji. Manufacturing does not need only infrastructure. It needs 3 or 4 components, verticals that support manufacturing, infra being one of them. If you go to a standard factory in Manesar, an MNC factory, doing credible work, you go inside, you find people wearing good uniforms, doing a good job, automated machines, good packaging, good storage. You just come out of the main gate of that factory and you see a real Bharat. Potholes, cattle, dustbin, garbage. So manufacturing ecosystem is not about what only happens inside the factory.
Sure.
It's a net perception we give to the world of what we are. Then we create an attraction. Then comes the scientific infra and component value chain that Honorable Minister was also telling this morning. Resilient value chain in terms of components, whether it is medical glass or electronics. Fab Lab is now coming in India, 2 or 3 places, Gujarat, Assam. So maybe in another 4 to 5 years, we will be sort of self-reliant, if not self-sufficient, on electronics because of the Fab Labs. That has nothing to do with MedTech. It would supply an electronic chip as much to a refrigerator company or an air conditioner company or a microwave oven company as much as it would supply to MedTech, because Fab Lab will produce for everyone, right? The scientific infra of MedTech, which requires lot of medical technology, biocompatibility related infrastructure, that's thankfully now there at AMTZ in India. Broadly, 22 scientific facilities. If you go to Shanghai International Medical Zone in China, you have 11 of them. Philadelphia has 7 of them. Ireland has 4 of them. If there is one place in the whole world where you have all 22, it is AMTZ India. That's all. And that scientific infrastructure at micro level does replication. And the third vertical after infra scientific facilities is human resource, human capital. Surprisingly, India didn't have an MTech for medical technology until 2018. India didn't have an MTech, only BTech. So people would study MTech biomedical engineering and go to join automation or machinery, mechanical and so on, including they would end up joining aviation. We created the first MTech syllabus and introduced it in 3 NIPERs, NIPER Guwahati, NIPER Mohali, NIPER Hyderabad as an experiment. Succeeded. Now we have NIPERs that are offering MTech courses. At AMTZ now we are setting up world's first medical technology university. We have taken 2 Nobel laureates on the board just to do that. This university, Global University for Medical Technology, would be giving MTech, MBA and PhD, only masters, only PhD, only on MedTech, nothing else. What I'm trying to say is, A country does not become a sought after place only because it has infra. And infra does not mean what you have inside your factory. It's a general social infra, logistics, supply chain, packaging industry, truck management, parking. I think the entire society has to move forward. Robotic surgery will not fall from the sky. It will need an evolution as a society. So infra, scientific component, supply chain, scientific facilities that are in clusters and in specialized zones like ours, and human capital. I think these four can only bundle and bring people to India.
Oh, lovely. Thanks for those very incisive comments, Dr. Sharma, on what are the key ingredients, and all of them need to come together. Maybe let me ask Mr. Arun Kaushik. So the important point that Dr. Jitendra was making about many enablers coming together, so essentially an ecosystem approach. So from the industry perspective and from your perspective, how are you thinking about both building this ecosystem, maybe your own upgrading, and how do you get, how do you upgrade clinicians to adopt technology, or how do you also think of other collaborations, creative collaborations, whether with local companies or whether with what has already got created in these medtech parks and otherwise?
Thank you, Priyanka, and I think a great opportunity to be on the panel and speak about certain things. But firstly, I would say congratulations to Dr. Sharma. I have been to AMTZ, and what a fantastic facility and intent that we see. I mean, it's phenomenal. I keep telling this to many people outside when I travel, is the intent that we are seeing now is something which was unforeseen ever that we have been. So I was traveling and I found out that Dr. Sharma was to travel to Delhi and I was traveling to his place. And then I was told that, can you change your schedule? I'll take just 1 minute to tell the story. It's like that. Then I said, no, I cannot change my schedule because everything is built and everything is through. So maybe, Dr. Sharma, I can meet up next time, and this time I'll go and visit the facility. I landed on the airport at around 5:30 sometime. I was having the car from his office to receive me, and he changed his flight to see me, and gave 1.5 hours to discuss about the things. And next day I traveled, visited the facility also. And the intent that I see now has never been there. That said, I have another point to talk about when we talk about Make in India. I think Make in India, you have set a point of barrier, but I see that opportunity-wise, what we manufacture at this point is minimal. What we cater to the market is minimal. I mean, as far as our access, awareness, affordability, even then we have a lot of scope in the market that we can reach out to. So actually, it's the scope for both of us, whether it's multinational that we work for or whether we manufacture in India. So there is no dearth of scope. I think the need of the hour is having a vision which is a different one. Whether we want to innovate or whether we want to manufacture only. Medical device today needs innovation. Innovation to see that there are better outcomes. Example is robotics. What is that adoption is happening in India? It's because of the training stuff which is happening. Physicians are very keen, and as far as our skill levels are concerned, we are at the top of the pyramid. When we see our physicians, when we talk to the physicians outside India, worldwide, then our physicians are the best. I mean, there's no discussion as far as that is concerned too, with my experience. From our side, what we do is, we are not a very structured industry. Mm-hmm. When I just look at Teleflex, or with my experience of 25 years that I've worked with medical devices, our hiring of human resources is also very ad hoc. First thing that we need to do is that to correct things at our own house, in the sense that when my people go out with the technology to a physician, are they trained enough to actually position the technology to be used in a real good way? And that is the first thing that we do. So what we do is that we have a trained man force or people. We try everything that people who are actually presenting the product to the physician, on which the other side is a patient, is a person who's actually aware of what they are doing. So that training happens. That is the first thing that helps in adoption of technologies. Other things that those we do is bringing the technologies to India, pitching it in a manner that this is the market. that you bring in and you see that how the adoption happens and what kind of sort of results that we see for patients. Third thing, that collaboration with hospitals that we do and with the overall industry that we do. And these days, it is heartening to see that a lot of big hospital chains are coming up with their own training centers, which also helps us. Just to give you a data, about 5,000 to 10,000 of the physicians, paramedics that we collaborate with year-on-year basis, and we are strengthening it. So there is a lot of scope that one can work on, and it is a continuous process, no one solution that one can find out. But certainly, we have to have a structured approach towards our own teams, towards paramedics, towards clinicians, towards new products. Everything has to come together, and then we'll see that this is even more strengthened compared to where we are.
Oh, thanks, Arun, for sharing that. I think the important point you landed is that it's not just about manufacturing, but about innovation, and that innovation can come from many places, both the local and the MNCs. Maybe this is a good point to invite in Mr. Kuvleen from Philips. Two questions. One, you've seen a lot of other countries and how ecosystem has got triggered there, whether it's Germany, Japan. Are there some learnings that you'd like to share specifically on innovation, on what more, how we can push our agenda further? And second, of course, Philips has also its big Philips Innovation Center. Do you see that over the next 5 years, the next CT, the next big product could come out of that center so that it's truly innovative, truly in India producing innovation and not just manufacturing?
Thanks, Priyanka. I think I'll take a leaf from our Honorable Minister's comments today morning when he said that it is in the industry that we are in, it's the patient, the health factor, the human factor that we need to address, right? It's kind of like the main thing, and our regulations are what they are. They are what prove that the device that we use is safe and is effective, right? It will do the thing that it's supposed to do. There's this whole thing about the size of the business and the segmentation, etc. I will not get into that. But the importance of regulations and the responsibility that the regulators have being to address this very key concept. As a patient, when I go to the hospital, I have no clue on what the medical device is and what it is going to do to me, right? The faith is not only on the doctor, but on the device for achieving its said objectives. And that's where regulations come in. And which brings me to the next point. These regulations, we talk about importers and we talk about exports, right? I personally, from a regulatory and a quality background, I believe it's a balance. It does not matter if I am importing or if I'm exporting. My device has to have that minimum, demonstration of safety and efficacy, which makes it usable on a patient and makes the patient a healthier person. So regulations are fundamental building step, I would say, to ensure that the device works the way it is supposed to work and as efficaciously it's supposed to be there. Which brings me to the point like in India, and that's a great example, right? Late 1990s, when I just got into this industry, there were only 4 medical devices, syringes, catheters, and the IV line. And from there to today, where we are regulating, everything from a tongue depressor to a thermometer to a CT scanner and, the complex of the complex equipments. All within this period, from a time when, I don't know, some of my earlier colleagues would remember, submitting thousands of pages as an application. I see smiles in the audience. Thousands of pages of application, for a device, and to this date when we actually do it online. So I believe innovation is there. Our regulators have been extremely innovative to have reduced the time to market, reduced the impact on the environment. I think that's always left unsaid. And the impact that has happened on the delivery of devices. So that has been something which is humongous. Can we learn? Of course we can learn. There are countries which are doing some amazing things, right? Germany has this program called the DIGA, which is basically digital healthcare application fast track mechanism. they have taken the step to look at preliminary evidence to fast-track medical devices to the market. US has got their breakthrough program, right? US has literally reduced their go-to-market time by 50% by looking at preliminary evidences again and by fast-tracking. I think one thing we can definitely look at is how US regulators, the US FDA, it's a massive organization, right? They are the ones who started off with a list-based classification system for devices, contrary to the European norms. They have regulators who actually work with the industry to understand their devices because they're innovative and they're coming on the cutting edge of technology. And between the two elements, right, sitting across the table, they determine how, they can demonstrate the safety of the device and the efficacy and bring it to market sooner. US FDA has reduced their regulatory approval timelines by 50% by this particular method. And I would also like to point out one thing which kind of gets taken in a little bit of a gray area in India. They have expedited mechanisms, right? So you pay more and you get priority services, right? We do have Tatkal schemes, right? I believe it is time when our regulators consider that as a possible mechanism where, there are critical healthcare devices which can improve and address key healthcare questions. And maybe there is a mechanism here that we can look at.
Tatkal reservation.
Thank you. Thank you, Kavleen, for, I think you laid out two wish lists for more innovation. You said, even more streamlined process of application, maybe even digital, and then expedited Tatkal, fast track approval. Maybe, Aditya, I can ask you as well. Do you have a wish list for, what would you like to see happen to bring more and more innovation to India?
I think, we do have a very strong innovation ecosystem in this country. As a legacy medical device manufacturer, I would say B. Braun has always been innovative, but the kind of innovation we have been used to doing is more in material sciences, in clinical outcomes. So it has been a very different kind of innovation. But where the world is now moving with so much of focus on digital, I think we are painfully aware that this is something that we don't have in-house, and therefore the fast track is to actually partner with others who can bring in this kind of innovations and this kind of knowledge gap that we have internally. And we have been doing it successfully, not only in India, but also across the world. But one thing is very clear, that as a medical device company which is quite focused, we do not want to pursue an innovation just because it is exciting. We will pursue innovations which either supplement, complement, or expand my current offering. So it's very clear that we will not get into any interesting idea which an investor might be interested in. We will not touch that. We will only touch very specific things. And I think India is a great place to do that. In fact, we already work with many companies in India who do designing work for us, who do this kind of innovative activities for us. And I think it will keep on increasing as we go forward. And certainly we will continue to work with India when it comes to innovation, for sure.
No, thank you for offering that thoughts. And as we all know, I think we are coming to time. We can take a few more minutes. So let me just ask the flip question. From the industry perspective, we heard their wish list on what they would like to see more. Maybe, Dr. Sharma, I can ask you, what would you like to see from the industry more on innovation? And I'll come back to Mr. Rakesh also on that.
So I was there on the 5th CII MedTech Summit in 2012.
Right.
And if you just look into the CII record and see the agenda of that year and the agenda of this year.
Right.
In this agenda, every panel, there are 2 companies that didn't exist in India in 2012. And that's a great applause to all of you. Motherson, my friend Sachin Nene is sitting there. Motherson was not there in MedTech. Zydus MedTech. You take the names and they didn't exist in MedTech space. Which means we are blessed already. There are big companies looking at medical technology for growth of their company, for the growth of their business, also leading to the growth of the sector. But I think as industry comes on board, we have to leave space. Every company will not be Zydus or Motherson. Every company will not come with a $10 billion revenues. there would be companies that will come with 10 crores of revenues. I think there is one indicator that we have not discussed in many of the forums is how many growth companies, mid-sized companies in India that were in medtech went for public listing, went for IPO. And that number is really, really small. Molbio, for example, is now going into IPO. It's a unicorn, one of the 110 unicorns of India, only one in medtech. We are blessed to have them at AMTZ. We had Times Medical going for IPO last year, Singapore-backed MRI imaging company. But unless a large number of growth-size companies, mid-size companies operating in the range of 50 crore to 100 crore, 200 crore, go for MSME IPO, the larger, and my friend Vaibhav just walked in, he's the one who invited me for 5th CII MedTech Summit 2012. And I was telling them that many companies that were there are there today, they didn't exist at that time. So we have grown tremendously. But that growth has not led to market creation and wealth generation because our mid-sized companies haven't gone for IPO. Now, the corollary to this is 60% of radiology detector and tube market, Varex Imaging. They supply tubes to almost every OEM that is in radiology space. Spellman for generators, X-ray generators. We have Monlinke Sweden for wound care. All of them are beelining in India. We are very happy that all of them are part of AMTZ because AMTZ is an ecosystem that welcomes them. But we would like to see from industry companies that are growing at a good rate, homegrown, in the range of 25 to 50 crore turnover, that can potentially be financed, supported, regulated, provided with component support, R&D, design engineering, through the ecosystem and our credible partners that can hit the IPO in next 4 to 5 years. And I think that will be the golden line of our industrial growth.
No, fair, and a great aspiration to have a much more inclusive and ecosystem where smaller and medium-sized companies as well are contributing to the growth. Rakesh ji, any thoughts from you on your wish list from the industry?
Actually, I would like to supplement answer given by sir. You will be surprised to know that Department of Expenditure published a list of 354 items on the pretext that these items are not manufactured in India and granted permission for issuance of Global 10 inquiry. 2 or 3 months back, we undertook exercise, and you will be surprised to know that 121 item out of the 354 items are now being manufactured in India. In many cases, there may be a single vendor, but they are now manufactured in India. So I think it is good to start, and we are also going to take up this matter with Department of Expenditure to exclude these items from that list. Thank you.
Thank you. I think I started this discussion with asking what more we can do, but actually I'm leaving this discussion feeling optimistic that we have already come a very long way.
Absolutely.
And we have the platform to kind of accelerate even further from here.
If I can make one small announcement, I have been asked by CII.
Sure.
We have the CII MedTech Quality and Excellence Award that's open for applications. It's the CII MedTech Quality and Excellence Award. Those of you who are in this space, please apply. It is CII's recognition for MedTech quality and excellence for the first time. CII does it for the whole sector. It is for the first time that it is for MedTech. So do partner with CII on this. Thank you.
Thank you. Thanks a lot, everyone. I hope that left you with more optimism. Thank you, everyone.
Thank you very much to our moderator and esteemed panelists. What a compelling and insightful exchange. Please stay with us on stage as I invite Ms. Shabnam Singh, Dr. Shabnam Singh, the Principal Advisor, Healthcare, Confederation of Indian Industry, to now felicitate our panelists, starting with Shri Rakesh Kumar, Deputy Director General, Department for Promotion of Industry and Internal Trade. Let's have a huge round of applause, ladies and gentlemen, for our eminent panelists. Dr. Jitendra Sharma, Managing Director and Founder, CEO, Andhra Pradesh MedTech Zone, AMTZ. Yes, that's right. Sir says her age is written over there. So I'm going to now request you to thank Dr. Jitendra Sharma. No, that we've done. Mr. Aditya Banerjee, Managing Director, B. Braun Medical Private Limited. Let's have a huge round of applause, ladies and gentlemen. And thank you for the applause. Mr. Arun Kaushik, Vice President and Managing Director, South Asia Teleflex Medical Private Limited. And Mr. Kulveen Singh Bali, Director Regulatory Affairs, Philips India Limited. Let's hear it, ladies and gentlemen. I know after the lunch session, like everyone's been saying, we need to just get the energy up. So let us participate in applause. And our moderator, please, ladies and gentlemen, Ms. Priyanka Agarwal, Senior Partner and Managing Director, Boston Consulting Group. And the photographer is going to need a group photo opportunity. Yes, madam, please. Please, gentlemen, I request you to please join us for the group photo. So, ladies and gentlemen, this was indeed a very interesting session that highlighted how India can leverage global collaborations in R&D, regulations and capacity building to build a medtech ecosystem that is globally competitive as well as inclusive. And we're concluding this plenary session 3 and transiting into plenary session 4 almost immediately, not taking a break. Very quickly we will reset the days. But thank you once again to our panel for spotlighting how cross-border synergies can fuel India's medtech future. Collaboration is clearly the new frontier. And I'm going to go on to our next session, which is plenary session 4, which is themed from research to real-world impact, accelerating medtech innovation in India. Thank you once again, esteemed panelists, and thank you, Dr. Singh, for doing the honors, for felicitating our panel. And we now go on to session 4, ladies and gentlemen. And I'd like to say that India today stands at the cusp of a medtech revolution. Emerging technologies such as AI-powered diagnostics, robotics, minimally invasive surgery, personalized medicine, all of this are really reshaping healthcare delivery in unprecedented ways. And at the same time, a massive national policy push is underway to drive R&D-led growth, most notably the 1 lakh crore RDI scheme approved by the Union Cabinet, PRIP by the Department of Pharmaceuticals, and multiple innovation missions led by METI, DST and ICMR. So this next session that we are preparing for will explore how innovation can be translated into very improved patient outcomes and how India can enhance its global competitiveness, enable inclusive and affordable healthcare, and position itself as a medtech innovation hub for the world, particularly the global south. We're almost set, ladies and gentlemen, with the days, and I invite you to please remain seated. Ladies and gentlemen, we now begin with plenary session 4, from research to real world impact. And I'd like to request gentlemen, ladies, kindly take their seats because we're starting now. And this is the discussion that will look at how India can translate medtech innovation into better patient outcomes, global competitiveness and inclusive healthcare access. Joining us on this distinguished panel, ladies and gentlemen, so, ladies and gentlemen, let me take this opportunity to invite our esteemed panelists onto this dais. We begin by inviting Dr. Jitendra Kumar, Managing Director, BIRAC. May I request you, sir, to kindly grace the dais. Dr. Jitendra Kumar. I invite Dr. Suchita Markan, Scientist E, Mission in Charge, Medical Device and Diagnostics, Mission Secretariat, Development Research, ICMR, Department of Health Research, Ministry of Health and Family Welfare. Dr. Suchita Markan. May I also invite Mr. Chandar Shekhar Sibal, Chief Executive Officer, SS Innovations, There we are, ladies and gentlemen. Mr. Abhijit Singhvi, Senior Vice President and Global Head R&D, Sahajanand Medical Technologies Limited. Warm welcome. Mr. Sunil Dinanath Joshi, Senior Director, Innovation Center and Production Hub and Managing Director. Mr. Sunil Dinanath Joshi, Senior Director, Innovation Center and Production Hub and Managing Director, Getting India Private Limited. And I'd like to also invite our moderator for this session, Mr. Gaurav Agarwal, Co-Chairman, CII National Medical Technology Forum and Managing Director, Involution Healthcare Private Limited. And ladies and gentlemen, that is our very esteemed panel. May I request you to please warmly greet them with a huge round of applause, everybody? Yes. And before we begin, gentlemen at the back, may I invite you to please come and take seats now. Please be seated. And those of you at the back can please feel free to take these front seats to join the conversation from a much closer view. May I invite you all to please join us in the front seats. Gentlemen at the back, may I invite you to either please take seats or take conversations outside. I thank you very much. Yes. Thank you. Gentlemen at the back, may I invite you to please either be seated or take conversations outside, please. I thank you for your kind cooperation. Yes, please be seated. And those of you at the back, if you may like to come and join us in front, please do so. With that, ladies and gentlemen, it is a privilege to now request Mr. Gaurav Agarwal to kindly take over as our moderator for this session. Sir, please.
A very good afternoon to all of those who are there. And I know it's a very rainy day and a lot of people have flights to catch. But I just wanted to say that the topic of this session, from research to real-world impact, resonates extremely well with the theme of the summit, which is innovation for a healthier future. My personal belief is that innovation is the ability to see change as an opportunity and not as a threat. This is not something I've said. I've copied it from somebody who's extremely well known. And also another favorite that I have, this is my own, that innovation is the ability to see that all of us see every day, but thinking and doing that has never been thought or done. So with that, I think it's a very, very esteemed panel. We have Dr. Jiten Kumar, Dr. Suchita Markan from ICMR as well as BIRAC. And to my right, we have Chandrasekhar Sibalji, who was till recently with Fujifilm, has now taken over at SS Innovations, one of India's proudly made in India robotics company, very successful one. We have Senior Vice President of Getting A, and we also have the Head of R&D of one of India's most successful stent companies, Sahajanand Medical Technologies. So the topic of today's discussion is really how can we foster collaboration and create innovation for a greater global impact. The first question, without wasting any time, is to the panel and Dr. Jiten, maybe to you, that India's gross expenditure on R&D, and I stand corrected, I thought it was 0.7, you said 0.6%.
It is reduced.
While the fountainhead of innovation, Israel, spends up to 7% as gross expenditure on R&D. Even within the BRICS economy, China and Brazil at 3 and 4%. So what do you think can we do to crank up the innovation engine and increase our spend on research and development to create an impact?
Thanks for that question. First of all, thanks to CII for calling me in this, inviting me in this panel discussion. A very pertinent question. We always discuss how to increase the R&D capacity, funding, etc. And we always get stuck in this question that India is spending very less of the gross GDP. The GDP total is 0.6% now. Now there are two parts to this question, and we have to carefully analyze this. First is, of course, the total amount, the percentage, of course, is less. There's no doubt about it, there's no question about it, which needs to be increased. However, the second part to this question is who is actually contributing to this R&D, whether it's government or a private R&D. So the data that you gave for other countries, I think the private R&D is substantial there. In US, at least I know about US. I cannot say exactly the figures, but private R&D is very, very substantial. When we talk about India, the private R&D is very less. So these two parts have to be dealt separately. Okay. For the government part, the public R&D, and of course India is mostly, whatever R&D is happening in India is mostly public R&D, government funded R&D. Of course, private R&D is picking up, is increased. But I'll give you few examples and ways in which we can engage private players to put money in R&D, and also how to increase R&D more and more from the public side also. So I'm dealing two parts of the same question differently. To increase the public R&D, of course, we have to create more channels. It's very difficult to say that we have less funding. But do we have utilization capability also is very important. I'll recall you one of the conversation with our Honorable Finance Minister Nirmala Sitharaman, who had come to visit a facility, Bangalore Bioinnovation Center, where I was MD just 3 years back, before I joined BIRAC. And I was telling her the same question. And she is very strict, and it's very difficult to argue with her. And I had an opportunity to spend 2 hours with her because she was visiting that. She told, but I hear from DBT that they are not able to spend the money and it's coming back to, who is the secretary I want to talk to? So I was little, afraid that time, because I was just, I just entered into the innovation ecosystem. I did not know that at the central level what is happening. So what I'm trying to say is that whatever money is given by the government, the treasury, is not being spent also. So it's going back. For example, our DBT last year, 2-3 years, the money is going back. It may not be true for all the departments. I'm just saying that, but sometimes there are departments where money is not being utilized. So we have to actually create channels and utilization and governance model in which the money that is being given is being utilized properly. Second is the scientists per 1,000 of population, or the R&D institutions in the region also is less. So if we can increase the capability, increasing more R&D centers, increasing number of scientists per 1,000 people in those areas, we are also less actually. If you compare with other countries, our per 1,000 scientists, per 1,000 people, per scientist is very less. And that needs to be corrected by creating more and more channels for utilization of funds that the government is giving. So this way we can increase the public R&D. And of course, we know about RDI fund, 1 lakh crore. I was part of the discussion that how to actually mobilize funds through private R&D also through this fund. So definitely we will have more and more funds flowing from public side. I can assure you that 1 lakh crore is there already. And this year 20,000 crore has already been sanctioned.
So Dr. Jiten, if I may interject, I think you bring two very important points. The first point is around whether there is appetite for consumption of the funds that are already allocated. And second, what can the private enterprise do to invest in R&D? And I'll throw the question right back to one of the largest R&D spenders in the country, SMT, that has carved a name for itself for bringing out very unique and innovative clinical cutting-edge products and solutions. So Abhijit, what's your take on what can private enterprise do to boost R&D expenditure?
So private enterprises do put a lot of money into R&D. For example, if I have to give example of SMT, we put about 5 to 7% of our total revenue into R&D, right? Where we lack and where the product development becomes slower is the lack of the ecosystem, right? So if we have to get a prototype done, right, for a new class 3 device, it can take up to 3 to 6 months to get that done, right? And why this happens? Because we don't have the required ecosystem in India, which is supporting the innovation, right? So this is where the spend increases, the amount of time increases. So if we have to really bring in innovation and really encourage
Abhijit,
people...
I'm sorry to interject, but could you take a pointed example of a product where you face this? Because we have two very important functionaries from the government. It will be important for them to learn.
Absolutely. So I'll take 2 examples in fact. Like if I have to take a balloon expandable TAVI, right? Yeah. So if you have to cut the frame, right? Get the pericardium, right, and make a prototype, right? If we have done 6 months of work in FEA, we come up with a design, and we have to check the prototype, test, do the testing, do the functional testing. Can take up to 3 to 6 months to get the pericardium, to get the frame done, to suture that, right? Because we don't have all the ecosystem in India, right? So if we are able to develop that ecosystem in India, the innovation and the encouragement to industries to spend would be much more compared to where we are right now. Because the amount of time we lose is also equivalent to money, right? So not everybody has that risk-taking appetite where they are able to wait for 6 months to see, okay, is it working or not? And then go back with the second iteration and see, okay, is it again working or not? And then we are in a loop where it can take a couple of years before we get a breakthrough. And then the amount of time and money spent, it is quite considerable, and is not possible for every organization to take that, amount of expenditure on their
Abhijit,
books.
I'm glad you raised that point, because SMT is among the top 10, 12 medtech manufacturers in the country. And if they find it hard to spend the kind of money that is required for a breakthrough technology, it will be very hard for startups in India to spend that money. Now I'll throw the question back to Chandrasekhar Sibalji. Very briefly, you're now at the helm of affairs at SS Innovations. What's your take on what can the private enterprise do to boost R&D spend? How did SS Innovations break that mold?
Yeah, so actually it is a project of Dr. Sudhir Srivastava. It's kind of a baby for him. And when he came to India in 2002, he did the first robotic surgery with Dr. Trehan. And so at that time, the cost of this surgery was very, very high. And one of the person was not able to afford it. It was around 4 lakh rupees for a ASD defect. And so Dr. Sudhir Srivastava, because this product was there from Intuitive. Da Vinci is the product robot, which was there. And the cost of that is very, very high. It is around $2 million, and now the new product has come with $2.5 to $3 million. So affordability, and also the reusable things which is required, almost 1.25 lakhs is the expenditure on those reusables items also. So to make this as a democratizing of the whole thing and reduce the cost of this, he has put all his money, all his efforts. He has made the team of 20-25 engineers and given his ideas. He has made the first robo with Mantra 1.0, then gone to Mantra 2.0, then 3.0 now has come. And I can tell you that yesterday he has done a surgery in a very small place in Mangalore, and at that medical college, and ASD defect was there, and he has done many surgeries, and he's teaching those things to many doctors now in India, and how the patient can recover very fast, and they can, and 20% of his patient can go home in 1 day after a cardiac surgery. And it has a better features than, you can say that Da Vinci also doesn't have those many equipment, because he himself is a surgeon, and he does all kind of surgeries, and he knows what is the advantage and how less blood loss will be there, how precise the surgery will be. So I think that what we need actually from the government or from the institutions like AIIMS and IITs actually to work on our equipment and give us the chance, so that once they work on that, and if they can suggest some changes and some more innovative ideas can come. And this product actually now we are exporting to 8 countries. We have got our CE and FDA is still pending. So we are trying for CE first, and then FDA will take a lot of time, and it requires a lot of money also. So these kind of innovations and the kind of products which has been made is wonderful product. And now we have more than 100 installations across the country, and worldwide 115 installations. And you can see the 1/3 of the price of reusable items which were used in Da Vinci, and half the cost of Da Vinci. We are giving this product, and it's a wonderful product. But still we require a lot of support from government, because to break even also, we require that ecosystem which he has talked, that we require that AIIMS should adopt this system. Many government institutes should take this system, medical colleges should take this system, because we require a lot of money to innovate.
Chandrasekhar, this is a great point that you bring in. I think SS Innovations is a classic case where innovation leads to impact.
Yeah.
You know, today SS Innovations robots are able to do remote surgeries, which is truly saving and transforming lives. Now, shifting gears a little bit, Dr. Sucheta, this question is to you. We are aware that PRIP, MedTech Mitra, ICMR IIT collaborations. These are some of the key initiatives that Government of India, especially ICMR, is taking. I would like for you to tell the audience what impact are these initiatives making, and are there any initiatives beyond the ones I listed?
Thank you, Gaurav. So basically, before coming to this question, I would like to address the ecosystem question, because that is clearly coming on the government, so we have to speak. So basically, I think that from the government perspective, when we look at the medtech sector, the sector is very huge and it has huge potential. And if we look from the bigger perspective of the government, that challenges in this ecosystem are huge. There are also 50,000 different kind of products and lot of challenges. So from government perspective, first of all, if you have to, get some kind of good, if you have to get some kind of good, maybe wheat from some kind of a land, you need to first of all sow the seeds, you need to make the land fertile, then you need to sow the seeds, you need to give water. So from that perspective, government is trying to do its best in terms of building that ecosystem. We always start, I'm sure the Honorable Minister and the ministers, Prime Minister and the ministers would have always thought that let's first of all try to bring policies in place. So that's the bigger umbrella from where anybody starts, and everybody in this room would appreciate that the kind of policies which are coming up in the medtech sector are overwhelming. So we first of all, everybody saw that National Medical Device Policy came, then came the PRI, then came the Research and Innovation Policy, it came up, and then 1 million crores are coming from the ANRF just to build that ecosystem. So first the government has tried its best to build the various policies in place. They had been put in place. Then various big initiatives were put into place wherein big money can be parked. Say for example, 5,000 was set aside for the PRIP scheme, and different schemes were then earmarked. Different people working in the government, different departments were given their allocated jobs that you have to do this job. Say for example, the BIRAC has the job of helping the startup innovation ecosystem. ICMR having the key role to validate technologies and then take it to the next level. We have been given a mandate to see how we can contribute. So every component of the government ecosystem has been given different tasks, and they are trying their best to do their job. Different schemes are being rolled out, and from that perspective, from ideation to impact, the last 3 journey that you mentioned, ICMR has been very, very serious about this business. I have been working in ICMR for just 4 years, but I'm really proud to see the kind of change we see in the ICMR ecosystem, being in the Ministry of Health, that earlier the kind of funding that would come from ICMR, it would go mostly to the intramural institutes. Now and mostly if it goes to the extramural institutes, which means all medical and engineering institutes across the country, it would primarily go for fostering biomedical research, not for innovations or product development. Now the mindset has completely changed. What we are trying to look under the guidance of Niti Aayog, that we have to really look at technologies which can be converted into products. So government funding should now go into technology development, not on basic research. The kind of funding outlay that we have, 3,000 crores, we never give any money back. That we utilize fully the money which comes to us, and every year we are getting 20-30% extra. In the last 3 years only, I have seen that our budget has gone triple or 4 times of what we used to get in few years back. So India can definitely do it. So I would like to request all of you, first of all, we should have that confidence in us that we are all a team. It's not that private companies are a separate entity, startups are a separate entity, government is a separate entity. We are all a team India, as I used always say, and we have to first of all believe that we can do it. And definitely the time of COVID has shown us that we could do it. So that ecosystem is very much there, but the medtech ecosystem requirements are so huge that every day you get some new requirements. So we have to be very, very flexible to understand what are the requirements of the sector and then build schemes around them. Like just before coming to this session, sir, you will be surprised that I was having a brainstorming session with the with the engineering institutes to understand what kind of thematic area-based centers we can put up across the country, what are the kind of testing labs we should put up across the country, so as to strengthen the capabilities. So we are also very intuitive, more of like innovators now we work within the government setup, trying to understand what are the requirements of the country and then build schemes around them. So looking from the other perspective, I want to tell you that it's really the best time that you could ever see in the government ecosystem, that we are very open, everybody is working together as a team, collaborative, different ministries are talking to each other. You will be surprised that ICMR initiatives like MedTech Mitra, Patent Mitra, we are PRIP enablers. Sitting in Ministry of Health, we are enablers of a DOP scheme.
Yes.
Likewise, you can see these kind of cross-talk and collaborations between different ministries. Patent Mitra initiative, which I am leading at ICMR, we have DPIIT sitting on board, and the controller himself would say that I want to contribute. So that is the kind of ecosystem we see at the government's end, and everybody is working together to see how we can make that impact. So that's the first part of it. The second part, coming back to your question on what is the impact that we have made, I think in 3-4 years of different kind of schemes which have come up after the launch of different policies, I can see that now people are having belief in government, and maybe that I can see a lot of change in mindset of people from the even from the academic institutes perspective, innovation ecosystem perspective, that that we can do it together. That is number one. Number two, what I can see is there are a lot of interdisciplinary collaborations now happening. Medical institutes are not just seeing patients, they are open to work with engineering institutes. So that change in mindset of working together as teams, interdisciplinary approach is also I am seeing from the mindset perspective. And what I can see as an impact is the number of innovators that can come now to even ICMR. ICMR earlier was looked at as a very bureaucratic kind of an institute which is just fostering basic research and nothing from the innovation perspective. I'll be maybe speaking on the next question if it comes, that the various initiatives of Niti Aayog which ICMR is implementing, like Patent Mitra, MedTech Mitra, we will be able to, the mandate of these initiatives is basically regulatory facilitation, clinical validation and uptake of new products. And and the interesting thing is that you don't need to get all three integrated services together. Yeah. The innovators, not only from the academic institutes, but industry can also come now to ICMR, and we will be very happy to facilitate clinical validation of your technologies, not only validation, but also field feasibility studies of your technologies for ultimately recommending those products for procurement by the government.
That's very important.
That is the intent, and we are not only thinking of helping startup companies, anything, anywhere in the country which is going to make our country strong from the innovation or product development perspective, we are open to that.
Dr. Sujata, thank you so much for that very, very comprehensive yet lucid overview on how ICMR is helping reshape the... So one of the things that I saw you touch upon is that ICMR is helping India bring solutions that are inclusive, affordable and equitable, and we saw that in plenty of measure during the COVID time. Before we let you go, if just in one sentence, if you could tell the audience about the first-in-man animal trial facility that you're setting up at Hyderabad. I think we truly have a dearth of these facilities.
Right,
kindly enlighten us.
Right. So knowing that maybe 5-7 years back down the line, when Dr. Bhargava was the DG ICMR, we had to just validate a cardiopulmonary resuscitation device which was developed at AIIMS, and we had to really look at foreign countries to see there was no facility in the country for large animal trial, to do large animal study validation of big devices in the country. So we looked at 100 options and we could not find any good option within the country. Only Shri Chitra, somebody told us that you can explore doing big kind of studies there, large animal studies there. So with that vision, when I think Dr. Bhargava came to ICMR, he thought that there is a really dearth need to establish a facility within the country, which is our own country's facility. And then he had set up ICMR Institute, which is only focused on doing animal studies. Any kind of animal study, be it from mouse to rabbit to horse, pig, any kind of animal studies can be done in this facility.
I think that deserves a round of applause.
This is called
an animal trial
NARF,
facility. Thank you so much.
And it's in Hyderabad. And it's a 100-acre plus facility. Our own scientists sitting in the institute are very trained veterinarians. They will be themselves preparing the preclinical study protocols for you and conducting studies. We were waiting for the GLP approval of the facility, and as of recently we got it for doing pig studies as of now, and for every animal study we will be putting in applications to get GLP
Thank you very much. Thank you. I think this was the
That is
need
one
of the hour.
part, and second part is that we also realize that because our core work is doing clinical validation, preclinical, clinical validation as a mandate which has been accorded to us as part of Ministry of Health. So from that perspective, what we observed that our industry is very risk averse. We need to see how we can de-risk technologies so that they can be taken to the next level. So ICMR has now started phase 1 clinical network as well, wherein we invite applications from the startups, industries, and we have set up some facilities across the country wherein we will also be open to conduct phase 1 clinical trial for you. Not only preclinical, but phase 1 clinical trial for you. And of course, we have an ICMR intent network with 75 sites across the country for doing clinical studies only. And they are a part of the MedTech Mitra platform. We use the strengths of the entire country, best of the institutes sitting across the country to facilitate clinical studies.
Another very welcome initiative by ICMR. Thank you so much. Now, shifting gears a little bit, touching upon the theme of positioning India as a medtech innovation hub for the world. Especially for the global south, Dr. Naresh Trehan spoke about it, that we shouldn't just look at 1.4 billion Indians, but 4 billion in the global south. Now, this is a question to the right side, especially to you, Sunilji. What do you think we can do to help medtech innovators break the jinx of going from TRL5 to TRL8? I personally have supervised, mentored a lot of startups, and 80% of them, they are not able to make it past TRL5, which is also known as the valley of death. How can we help our researchers break through the barrier of TRL5 so that we can truly be positioned as a medtech innovation hub?
Yeah, so first and foremost, I personally believe that India is not just a hub for, we should not just become hub for new technologies, but we should also take opportunities to, you can call it reverse engineering, but I call it more rationalization of products, which will make them relevant for these 4 billion people. A lot of rationalization is needed. And to come to answer of your question, what is really needed is a lot of hand-holding with an experienced industry. Like, let's talk about getting a 130-year-old company, 25 years in India, we have been selling, but no footprint of any R&D, no production. And since last 5 years, we have been trying to turn the elephant. It's never easy because it's a mindset. A company which is very north-centric, the northern world-centric, which is very, very lavishly doing the research work to make it more frugal and bring products into the world is never easy. I think the valley of death that you are talking about can be easily crossed if the collaboration between companies like these who have years of experience, I mean, they are there on the planet for 100 years plus, and they will be on the planet for 100 years plus because there's something that they are doing right all the time, So if that discipline can be taught in a very practical way, and at the same time, the frugal thinking and the practical thinking we can bring together, I think this valley can easily be crossed. I have an example of working with IIT Bombay, with Professor Srivastava, and we even got a prize from IIT Bombay for one particular IP that we created out there. And there are very talented people there. They're very much interested. Just that, at some point they start thinking too fast to push the product into the market. They actually skip a lot of steps, and then that muck under the carpet starts showing up when actually you want to commercialize the product, And that is where this discipline helps. And this is not my word. This is Professor Professor Srivastava, who also got Vigyan Shri Award last year, he himself told me that, if I could get some value out of getting a, was this, that you were not skipping any step. You were still making us do things faster without skipping any step. So I think that is very, very important. And and I would also like to make one more point here is, medical medtech industry, I'll say design and development is not new to India. In last 15 years, there are a lot of consulting companies out of India who have designed and developed almost all the leading products. And I know it better because I've been into sales and marketing, selling these equipment for German, American, French, Japanese companies. And when I moved out to R&D in Getting Gay and started meeting these consultants, I used to get shocked, seeing those products on their presentation. And I used to feel pathetic that, I was selling it as German technology and American technology, etc., etc. So it is not new. Just that we also need to take a very strong stand of spelling out what is exactly needed here. As I said, not to skip any step, be very, very sticking to all the process, but at the same time using our frugal mentality, using our speed of execution to bring product faster into the market. And that's exactly what we are trying to achieve at Getting A. We know we are much late in this market, but at the same time, we are also a boutique company, around $3.5 billion. Most of the products that we make are market leaders because of their technologies, and we are trying to make them more relevant. And the reason being, the company has a vision to double the number of lives saved in next 5 years, and that they cannot do without coming to this part of the world. We know that.
Sunilji, you very adequately said that elephants don't dance, but I hope this elephant will dance someday.
Yeah, sure.
We'll see the value of what India has to offer in terms of talent and the right ecosystem. Now, coming for the paucity of time, as engaging as it is, the last two questions, the penultimate question is particularly very dear to me. For a nation that is 80% import dependent for its consumption of medtech, I see an elitist attitude amongst research institutes, engineering institutes of prominence, to only do breakthrough and fundamental research. Should we not be looking at translational research, value engineering, frugal research? And I'd like very quick, maybe 2-sentence answers from this side, and then we'll take the government's view on this.
My one word answer is yes, with long S, because you can't suddenly become experts of some clinical thing, just out of nowhere. You have to build your own credibility. You also have to build your own personality in that particular field of
Sunilji, I'm on your side. Yeah. I think this is what the nation needs. Abhijit, very quickly, what's your point?
Yes, I absolutely agree. So innovation is not just a breakthrough device. I think innovation is also a next-gen device, which is improving the patient quality, which is reducing the time in OT. So I would divide the whole paradigm into 3 segments of projects, right? They would be next-gen projects, then there would be breakthrough projects, and third would be the moonshot projects, right? Then
Wonderful.
we are completing the whole spectrum of R&D and innovation.
Great structure. Thank you so much for that beautiful answer. Chandrasekharji, what's your take?
So definitely, actually, we have proved it actually that with our product and with the telesurgeries, actually, a best of the best doctors sitting in, I can give you example from Hyderabad, Dr. Vaddi has done a surgery in Muradabad. And that too done within 1 hour time, the best surgeon sitting in Hyderabad doing a surgery in Muradabad. And that's a wonderful thing. And we have broken a lot of barriers in that. And also a kind of a bus we have made, which is a Mantram bus for teaching the doctors and other people, paramedical staff and other people, technicians, as well as we can do the telesurgery.
I'm really sorry to cut this short, but are you in favor of translational research, frugal research, value engineering, yes or no?
Yes, 100%. Without that, it was not possible to have this project.
Dr. Jiten?
I think it's very, very important to pay attention to the translational research. Breakthrough research are important, but to take it to the translational level is where the value will come. And to this effect, I think we need to have scale-up facilities for these startups who are doing translational work. We need to have a good regulatory environment, because regulatory environment is really creating a lot of obstacles. We need to have early stage venture funding also for these companies to take these innovations forward. Otherwise, because these 3 are the values of death, In case we do not provide this, these breakthrough research will remain in the lab only. It will not get translated. So BIRAC has been doing all these innovation funding and regulatory affairs, hand-holding, as well as early stage venture funding through ACE fund. We have created fund of funds, and also that value of death, these three value of death which I'm talking about, is being taken care by BIRAC and the government bodies. So I think it's moving in the right direction, and we must pay more and more emphasis to this.
You spoke about a very relevant point of early stage seed funding for medical startups, and thank you so much for that.
Yeah.
Dr. Sucheta, very quickly, your take on whether the
So
nation
I
needs.
agree with all of you that we need to have all kind of products, but frugal innovations must be quality centric. The quality should be at the front is what we now really should really care for. So definitely for a country like us, we need all kind of innovations.
Thank you so much. And the last one is a very controversial one, has been in the debate for a really long time. On one hand, we are talking about making the transition from volume to value. And on the other hand, we are opening the channels for refurbished medical equipment import. Is it enabling quality and affordable healthcare, or is it an innovation killer? Your take, Chanchal.
Yeah. So I think it's the biggest innovation killer, I can tell you, that we must ban. Already, I think CDSCO has put a ban, and we must continue the same, because otherwise what's going to happen that the junk technology will be pushed to India, and which has already has useful life has been covered, and we will not be able to go to the higher technologies, and it will be very disadvantageous for anyone to make in India. So for that, I think that CDSCO has taken a right step, and we should not backtrack on those policies, which we have taken after a lot of consideration.
Any other views on this side?
I completely agree. I mean, even if we are a multinational, we always have an opportunity of doing so. Both me, myself, and our sales and marketing arm, which is getting a medical, Aruna, who's a managing director, we both have taken a very clear decision that no refurbished products in India. Company spends money, creates right product for India, or we continue as what we are doing.
Any thoughts from the left side?
Yeah, from the right side, I agree. At one level, I agree that, okay, this will have some adverse effect on the innovation in the country. However, the innovations that we are talking about, the deep tech innovations, the new horizons, AI, quantum computing, etc., bio AI, I think they will always be there, whether it's refurbished equipment coming or not coming. And India should pay more attention to these disruptive technologies which are on the horizon. AI, ML, deep technologies, quantum computing, quantum biology. Unless we pay attention to this, I think both levels look at from a different perspective. It will look at correct from both the first perspective is okay, we should ban this, but at the same time we should focus more and more on new horizon, new technologies, deep tech technologies actually. That will not be affected by all those imports.
Thank you for your insight, Dr. Jiten. Dr. Sucheta, quickly your point of view.
I believe that to foster Make in India in the medtech sector, the policies which are in place right now should be continued. That we may not we may ban these products, because this will again give a very strong message to the country that we are very supportive of Make in India technologies for an Atmanirbhar Bharat. So that's from my side.
Thank you very much for the paucity of time. Please give it up for Dr. Jiten Kumar especially, and Dr. Sucheta Markan. I think we've learned so much about the initiatives that BIRAC and ICMR are taking to enable equitable and affordable healthcare that is scalable globally. And thank you very much for your valuable inputs on the right side, Abhijit, Sunilji, and Chandrasekharji. Thank you very much, and it was a wonderful session. With this, we come to the end of the panel.
I would
Sir,
just
would you
like
like
to add one more thing which got missed in the whole conversation, how to increase private R&D. Actually, when government is funding, they always say co-funding from the private bodies. And that's what BIRAC has been doing. So if we fund, say, 70 crores, 30 crore has to come from the industry. Why this is so? Because, and now government is not giving any full grants, only 50 lakhs grant they are giving. Other fundings are through co-funding. So I think this point got missed here, that government is actually trying to attract private R&D through this mechanism.
That's a brilliant point. Thank you, Dr. Jitendra. I think very important point that we missed out on. Thank you very much, and we conclude the session. Thanks a lot to the esteemed panelists.
Thank you very much to our moderator and our eminent panelists for such a thought-provoking session. I'm going to request Mr. Gaurav Agarwal to please do the honors and help us thank first Dr. Jitendra Kumar, Managing Director, BIRAC. And ladies and gentlemen, let's accompany that thank you with a huge round of applause, please. Thank you very much, sir. So now please help us thank Dr. Suchita Markan, Scientist E, Mission in Charge, Medical Device and Diagnostics Mission Secretariat, Development Research, ICMR. Let's thank her, ladies and gentlemen. Mr. Chandar Shekhar Sibal, Chief Executive Officer, SS Innovations. Sir, please accept this small token. We'd like to thank you. A huge round of applause for him as well. Mr. Abhijit Singhvi, Senior Vice President and Global Head R&D, Sahajanand Medical Technologies Limited. We've thanked Mr. Sunil Dinanath Joshi already, Senior Director, Innovation Center and Production Hub and Managing Director, Getting India Private Limited. And this is Mr. Abhijit Singhvi. A huge round of applause, ladies and gentlemen, for all our eminent panelists.
One picture together, sir, please.
And a group photograph is what we will need at this juncture from our panelists. Thank you very much. I think this discussion has underlined that India's medtech future lies in converting research excellence into real-world impact innovation that is not only cutting edge, but also inclusive, accessible, and globally competitive. Thank you very much. That concludes session 4, ladies and gentlemen. Quickly, we will transit to the next session. So the changeover will happen very quickly. And then we will go on to our final session for today, ladies and gentlemen. The plenary as well as valedictory. Plenary session 5, which is tapping global markets, making India a medtech export powerhouse. So I'm going to request you all and urge you all to please remain seated and not go away anywhere. We are going to do this resetting of the days rather quickly. I thank you and I appreciate your cooperation, ladies and gentlemen. In case you have any conversations with the panelists of the previous session, ladies and gentlemen, we will request you to take them outside. But we need to get the house in order for the next session. An equally compelling one coming your way on tapping global markets, making India a medtech export powerhouse. And ladies and gentlemen, with the global medical devices market projected to exceed US $800 billion by 2030, India stands at a very historic opportunity. As the world seeks reliable, cost-effective and innovation-driven alternatives, India can leverage its manufacturing strength, skilled workforce and expanding R&D ecosystem to become a trusted supplier to the world. So this is, ladies and gentlemen, a very, very compelling, pertinent session that will chart a strategic roadmap for enhancing India's medtech export potential, looking at opportunities in emerging markets, leveraging trade agreements, building brand India and creating pathways for global market access. So this is our final session, ladies and gentlemen. I'm going to just take the privilege of inviting our eminent panelists as soon as our dais is set, which will take under a minute. So I request you to please be seated now as we reset this dais, because this is the plenary session 5 on tapping global markets. This discussion will focus on how India can leverage its strengths to become a leading exporter of affordable and innovative medtech solutions. Ladies and gentlemen, with that, it is now my privilege to invite to this dais Mr. Sachin Nene, Chief Executive Officer, Motherson Group. Can I please request you to join us on stage, sir? And let's bring him amidst a huge round of applause. Welcome, sir. May I invite Mr. Girish Gopalakrishnan, Senior Vice President, Zydus Medtech Private Limited. Let's welcome him, ladies and gentlemen. Mr. Girish Gopalakrishnan. Welcome, sir. Dr. Atantra Das Gupta, Business Head, HOD and Senior Director, India and SAARC Region, Samsung Health and Medical Equipments. Let's welcome him, ladies and gentlemen. Dr. Atantra Das Gupta. Welcome, sir. May I also invite Dr. Vibhav Garg, President, Corporate and Global Government Affairs, Merrill. Let's welcome Dr. Vibhav Garg with a huge round of applause. Welcome, sir. And this session will be moderated by Mr. Praveen Mittal, Executive Director, Medical Devices Export Promotion Council. Let's welcome Mr. Praveen Mittal, please, ladies and gentlemen. Warm welcome to you, sir. Now we are deeply honored by your presence, eminent panelists, including our moderator. And with that, it is now my privilege to hand it over to our moderator, Mr. Praveen Mittal. Sir.
Thank you, ma'am. Good evening. I know it's the last session of the day, and we are tasked with eminent panel like this, and also I understand that you have been here, and there's a lot of Gyan Varsha since morning, right? So we'll be very precise, but let me at the outset congratulate CII for putting this session, because export is extremely critical for all of us. And the session is very aptly titled that Tapping Global Markets, Making India as the MedTech Powerhouse for the exports for the world. And we'll be focusing in the session on the opportunities in the emerging market, Global South, leveraging the trade agreements, again, very important for all of us, our export readiness, and the global market, strategies, and then, of course, putting India on the global map as a trusted supplier for the medical devices to the world. We have all seen that there is a lot of, I would say, with the medical tourism, we have been really able to make India as a global healthcare destination, but simultaneously, and being the pharmacy of the world, so for the medtech sector as well, we really need to look at some very exciting strategies, I would say. And I have with me a very eminent panel today. Let me introduce you with all of them, while some of you may know them, but so I have with me Mr. Sachin Nene, who's a visionary leader with about 3 decades of experience, driving innovation in the healthcare, manufacturing, and strategy. He is the Health and Medical Division Chief Executive Officer for the Motherson's Group. Welcome, sir.
Thank you.
Along with us today evening is Mr. Girish Gopalakrishnan, again with a experience of 25 plus years, cross-functional, huge legacy of Zydus. He is the Senior Vice President and Board Member of Zydus MedTech Private Limited. We have Dr. Atantra Das Gupta with us, again known very well to all of you. He heads the businesses for India and SAARC for the Samsung, for the medical devices. He's huge experience again in the healthcare sector. And of course, Dr. Vibhav Garg, a known name, is the President for Global Government Affairs at the Merrill Group, a very eminent professional with over 2 decades of global experience across various verticals of regulatory policy. And again, somebody who has been at both sides, which is MNCs as well as the Indian companies, so has huge experience, and we are looking forward to, from all of them, a lot of insights as to how we can really look at our industry grow and become the powerhouse for the exports, specifically for medical devices. I'll straight away come to a couple of questions that we have planned for each of our panelists. And we'll start with, first of all, on the theme itself, before I come to my questions. Since we all know that India wants to be a leader in the medtech sector as well, and look at exports big time. So we can probably start with Girish. What are your thoughts on our theme today? We'll be very succinct in our response.
Good evening, everyone. Yeah. Thank you, Praveenji. I think I want to start off by saying that the healthcare demand is going up, especially in the global south, the export theme that we are talking about. And this is primarily because there's a large portion of the underserved population that need care. And definitely markets, companies like from the US and Europe will not be able to serve them. So that is a wake-up call. Second, the opportunity is the trust in India. I think India has proven over decades in pharma, and most recently in vaccines and other medicines, to be saving so many countries. And I think that is trust in India. There is also the current, anti-China momentum, which I think we could definitely leverage and move forward. Favorable policies from the government. I think we heard a list today. But I think I just want to summarize with one sentence for those of you who heard our Honorable Prime Minister from the Red Fort this time. He said, Dam kam, dam zyada. I think that's the key message that we should all go with. I'll leave it at that.
Thank you, Girish. Wake-up call was something very nice. And of course, dam kam, dam zyada again gives the momentum. Moving to Mr. Nene, how would you like to talk about a theme of the session, giving an overarching view on exports and the medtech sector?
Look, the export opportunity for medical devices has been immense, has been there for long. What started in India as a medical device ecosystem did not really start for make in India for India. It always started with make in India for exports, because that's where the money was. The in-country for country or make in India for India theme started as ICFC long time back, right? They used to say in China for China, then India started saying in India for India, now it's make in India for the world, right? So I think it has evolved over a period of time. The opportunity always was there. I think the biggest differentiating point from a standpoint of India, the advantage from a standpoint of India is the enormous talent that we have in the country. What started as cost arbitrage model soon turned into a model where India's competency and India's intelligence in the people could be very nicely leveraged for the globe. And that has been the reason now with opportunities coming, like Giri said, about things happening with China looking at, countries looking at a China plus one model. Obviously, India gets a greater visibility there because of the existing talent and the existing ecosystem that has been created over a period of time. Can we do more? Certainly we can. And if you look at the balance between the import and export, right? Today, Gaurav talked about India crossing export more than the imports in this financial year, right? If you look at the other 5 developed economies that are very active in the medical space, even US, despite the $150–160 billion market that they have, they at times end up importing more than exporting. Germany is the only country that exports more than imports. China is at a very good balance. India has a very big delta to cover up, but India, it's not only the import versus export delta. I think the overall consumption and the overall market from a standpoint of medical also has to evolve significantly. So the opportunity always remained, the opportunity will continue to grow, but I think we are at a point where we can only go north from here.
Thank you, Mr. Nene. Very interesting take. You've clubbed of course, the talent pool which exists in our country to China plus model. I'll come to you on some very pertinent questions later. But moving on to Mr. Dasgupta, your thoughts around our theme today.
So first of all, I'd like to thank CII for inviting me for this session. And thank you, Mr. Praveen. So what we need to do to augment our export, that's the basic question. So people are talking about taking lessons from pharma. I will divert a bit and I will take lesson from our defense. What they have done, they have kept the door ajar, invited the foreign technology, on top of that built the domestic technology and started exporting. Today we are one of the leading nations in the world who are exporting the defense equipments. So let's do the same in the case of medical technology, because medical technology is no less important than a defense, where we can keep our door ajar, we can invite the superior technology from outside, we can build our own, augment the technology, and then we can export. Because quality is the key in case of medtech. And in order to maintain the quality, we have to be open-minded. We cannot close our door. Swadeshi is a fantastic idea. But in order to augment that, the spirit of Swadeshi, we have to mix a little bit of Bidesi in it. Thank you.
Thank you, Mr. Dasgupta. Dr. Garg, what is your take on our theme and 2 points on medtech exports?
Sure. Thank you, Pravinji. Thanks, CII, for having me here. I think 2-3 points I would just make. One, somebody said in the morning that Indian global medtech industry is about $800 billion. It's gonna be $800 billion. And I got the number from Gaurav that India is about $16 billion. So about 50 times more is gonna be in by 2030. That's what I'm hearing here. 800 billion by 2030. And we are 16 billion now. Maybe 2030 we'll be, say, 30 billion. So we're going to be almost 20 times, if not more, or maybe more actually, right? The global industry. The challenge comes is, as a company which is manufacturing in India, as a company which is indigenous, do I have enough opportunity to grow in India? Or do I take global market as my sky to grow with, right? I think that's where each and every Indian company which is now has vision to go global, export is the way to go in my mind. That's one, Pravinji. So I think, anybody who would like to grow in this segment has to export. India market is there. Opportunity is there. We are the largest country, most populous country in the world. But at the same time, exporting is going to bring that critical mass that we are all looking for. That's point number one. Point number two is, I think, whether I produce for domestic market or I produce for export markets. One message that I've seen from morning, and I would like to reiterate that, is the quality. Let's not for anything compromise on quality, whether we are manufacturing for India or any other country which is outside India, basically. I think these two messages are very critical for a company like us, Merrill, and also for all my colleagues sitting in the room who are manufacturing in the country. Let's not for a second compromise on quality. So those are two messages I had in mind. Thank you.
I think quality is extremely critical and important for all of us. And not just for exports, but even for our domestic consumers and domestic markets. Very, because we are actually, you rightly said, touching the lives of humans. Mr. Nene, since we are talking about specifically Mothersons, and wherein you have huge experience with automotive and electronic sector, and you've seen the entire sector very closely, how do you bring in those learnings from the automotive and the electronic sector to the medical devices sector, number one? Number two, electronics and automotive have a lot of components and the complete value chain, I would say. How do you bring in that experience of the automotive and electronic sector to our medical devices sector?
Sure. So look, Motherson is not a known name in medical device sector, right? When I started 4 years back at Motherson and started meeting the customers, they would ask me, do you make baby diapers, right? Because that's how the name resonated. But it's a company that was started by a mother and a son together 50 years back, right? Been very, very successful in the automotive segments, amongst the top 10 automotive component manufacturers in the world. We are probably around $25 billion in top line, 400 plus manufacturing plants all over the world. We are based in 45 countries, 200,000 people family, right? So that has been a huge, success over a period. And then it's only about 4 or 5 years now that the company decided to diversify into non-automotive segment. So medical happened, and aerospace happened, electronics happened, and we don't know what else we will do next, because in our company we call ourselves a not yet company. So if we don't do something today, we don't say no, we say not yet, because that keeps the options open for us for the future, right? I'll give you what my experience has been since coming to Motherson. I was at GE Healthcare for about 20 years, and A couple of things. At GE Healthcare and the other companies that I've worked for, if we did something 15% more year over year, we would be amongst the best employees in the company, right? And the sector was good with a 15% growth. I came to Motherson, and yesterday we had our AGM, and our chairman was addressing. Over the last 40 years, we have grown 35% CAGR year over year, right? So 15% almost is like in the decimal conversion. That was a big shock to me. And I know that traditionally medical companies do not work with that kind of growth unless you are starting from zero, right? So that has been a big change. How to create scale, and how to create scale of big magnitude and at great speed. And I want to give you an example of what I mean by great speed, right? I was talking to one of you, and someone said building plants is very tough. Starting manufacturing, it takes just too much of an effort. I must tell you this, at Motherson we built and commissioned 45 plants during the last 5 years. 45 plants the world over, all greenfield. And we are currently building a plant in electronics, which is 1 kilometer in length by 650 meter in width, right? One single plant, one shade. And as things happen, that's going to become a multi-billion-dollar business over a period of time. The reason I'm putting these examples to you is because, look, it's only in our mind, and I realized it after coming to Motherson, that constraints are only in your mind. If you have creativity, and if you look for the art of making the impossible possible, everything is possible in this world, right? I keep quoting this, learning from Elon Musk. Elon Musk says, if you decide to do a job in 12 hours, you will take 13 hours. If you decide 6 hours, maybe you will take 6 hours. But if you decide 30 minutes, you will get it done in 30 minutes. The reason I'm quoting this to you is it's a big learning. I lived in the medical segment for 20 years, and like all of us talked about, QARA is very, very tough, regulatory is very, very tough, validation, verification activities become really tough. Come to automotive, all of us drive automotives. Do we think that automotive is any easy game? Don't we think that automotives also do V&V, right? Come to one of our wiring harnesses plants, right, in Noida. We bring 4,000 people in and out every day. They make wiring harnesses for cars. When a car gets designed, the first thing that gets designed is the wiring harness. Simple things like, your connectors, your lugs, your method of soldering, etc. The track and traceability that we so passionately talk about in medical exists in living every single day of work on the shop floor, even in automotive, right? So no other segment is as easy or as difficult as we keep saying that, medical is. I lot of times sit and think that as medical fraternity, medical device, fraternity, we have all got used to this thing about, medical hai to time lagega, right? I think most of us, and I'm not trying to be a critic here, but most of us hide behind that great thing called as QARA or regulatory. The one learning I have taken back, and I'll share back with all of you, is please challenge every single thing of it. It is possible to do things with a different mindset, a different thought process, a different methodology, and at a faster speed. Because I believe if something as big as what we are aspiring to do in medical as a fraternity, right, it cannot be done with the same speed that we are all used to, right? So give a serious thought to it. That would be my remark.
I'll come to you later, sir, again, but valid inputs. Moving to Girish, you have huge legacy of pharma, and what instills the confidence in the investor segment that if companies like Zydus, which have been traditionally pharma leaders, and have been big time into the pharma exports. What do you bring to the table when you get into the medical devices? How do you want to leverage the learnings of pharma into the medical devices? What is your take for our mid-sized companies and the investors and the companies which are looking to foray into the medical devices? Because you've got been really a inspiration story from pharma to med devices. So over to you, Grish.
Thank you, Praveenji. I think it was, as Sachin was speaking, I just realized there's 3 people that have worked for GE Healthcare and that are sitting on the dais.
It almost sounded like a GE alumni.
We can, yeah, we'll just turn around and start ragging Praveenji now. But again, yeah, I was with GE for about 20 long years before I joined Zydus as the first employee 2 years ago. And I would like to also inspire the audience with the speed comment that Sachin said, which is in 2 years from 1 employee, we went to 150 last year, and this year we are over 500 employees. Similarly, I think we were no revenue year 1, revenue and loss year 2, and then, profits in year 3. So I think that's the kind of speed we would like to give the confidence, a brand like Zydus coming in, and, large brands that are coming into this space should add to the momentum of what we're trying to do here in India with medical devices. So firstly, I think the pharma story can be a great blueprint. I think we all know the success story over the last 30 years. The effort that has been put in to scale pharma. We are the global giants. We are the global pharmacy. If you look at it, even with respect to pharma, it was not just one thing, right? It just kept evolving. What started as generics, complex generics, biosimilars, vaccines, and it just kept building on top, and the entire, pharma community kept building on that. So now this can be a blueprint for all of us, but it cannot be, we still have our complexities. Medical device, we still have our own complexities. So a few points that I wanted to make. Number 1, get ready with regulatory. I think start this quite early. I would say, getting ready with an ISO 13485 earlier on, maybe even an MD SAP ideally. And getting this earlier on will sort of address many, many markets. And this is something that is useful. I would strongly suggest that. The second is about the export readiness. And this is also, historically, most sectors said domestic base, फिर बाहर जाएंगे, right? And I don't think we all know that we don't have that privilege in India. So if we have to go out, we have to prepare from day one, because the domestic market is what it is. And of course, there is a promise that it will grow, and that promise has existed and will continue to exist. But again, the readiness for export is in terms of technical documents. And whether it's documents such as IMDRF, if you're aligned to that right from day one, most countries accept this. It's easy to adapt to several countries and then start to jump into that. So therefore, these are the 2 things. And to your point on, smaller companies, MSMEs, I think there is cost to this. Obviously, there's no shortcut. But a good way to do this is not to be a little bit more proactive, because many a times you meet a doctor in a conference from a different country, you want to enter that country. You meet a distributor, you try to, enter that country. But to be proactive is to start looking at what is the cost of entering each country, what is the historic market, what is the business model, who are the partners that we are getting along with. And these are extremely important criteria, because you're not there just to get in, sell, and scoot. You're there for long term, where you have to focus on post-market surveillance, you have to focus on vigilance, you have to focus on labeling. Almost every single thing that matters has to be given that attention. So I think being proactive in which country you enter and how you enter through the many partnerships, and I'm sure Praveenji and team can talk about which countries are closer in terms of trade agreements, etc. But I would say just being a little bit proactive goes a long way. And if you look at pharma, more than 600 facilities in India are US FDA approved. And this is the largest in the world outside of the US. So I think there's a lot to get inspired from the pharma story. Thank you.
Sorry, Girish, I have one more question to you. How does the, how do you leverage the regulatory relations which already exists for Zydus on the pharma side? Does it really help in terms when you're now approaching with a new hat of medical devices? How do they look at it from the regulatory standpoint and regulatory perspective?
Good question. I think out of syllabus question, is it? So no, I think the most important thing is you know the country, right? You know the country, you know the regulators, you know how to approach it, you know the market. And I think all it does is brings you that introduction. I don't think it's a platform for you to get in, conquer the market. It is a platform for you where you know how the country has approached India as a maker. And I think that's all we can say. I think it helps you get a seat on the table, but not necessarily get an entry.
No, why I was asking this question is because we have a lot of pharma companies, and this definitely lays a good pathway for them also to look into the sector, and it does somehow, we feel that, and if it does help us and benefit us in terms of reaching out to the global markets, because the idea is that we started with big fives, right from Zydus, Cipla, Sun Pharma, Lupin, and the others. So there is a huge legacy of pharma sector in our country, and we've been able to build up good business models there. Right. So it definitely is an inspiring story of Zydus getting into medical devices. Mr. Dasgupta, I have a very important question, because you come as a part of the global MNC framework, and what we are looking at is when you talk about the India medical devices segment of the market, how is the market perceived, first of all, from your other global partners which exist, or the people who lead this sector in various other countries, number one. Number two, what is the, India, Korea, how do you look at the bilateral trade relations, and looking at that, how do you want to, leverage that, relationship? Secondly, on the technology front, because Samsung is known as a technology company, and we definitely look forward to, because medical devices, again, technology is an important component. So what is your take on, and how we can really put India again at global map for the medical devices?
So, a lot of questions, Pravinji. Let me start answering one by one. The first is how India is perceived as a medtech market. So, to be very honest and to give you a frank opinion, India market is perceived as a trading market. So there we have to work. We have to build up an innovative ecosystem where we should start with the innovative products. Still we are lacking to that. Today, if I give an example of Trump, I know he is a very hated figure today, but one or two things he has told very correctly, that America has invented this, America has invented that. So the strength comes from the innovation. We have to be religious on that part and develop innovative products. Yes, the world consider India as a creative market. But in the case of innovation, we are little bit lagging. Now, what is our strength? We also have a strength. It's not we are the laggards. We are having a big strength in software development. The data, 1.4 billion people, lot of data, diversified data we have. So where we can piggyback on the technology. Because if you look at Japan, Korea, they are technology leaders. If we have a lookist policy and we work with them very closely, we can come out with a very strong products, which are hardware plus software or the AI-driven products. Because here we have got a huge talent pool for developing. But are we able to market those products? Are we able to bring those solutions in front of the world? Let us ask those questions. Because a lot of experts are here. We should do a brainstorming and find out an ideal solution where we and expose our strength, and we can rule the world. Because we are having the largest amount of young population, the working population. How we can leverage that? And now in terms of quality, the Vivabji endorsed that part. The quality is number one. Number two is the quality. Number three is also the quality. That front we have to work. We should set up an example that India brings quality product to the world. We cannot compromise on that. We had faced some bad experiences in pharma, but we have to rectify and we have to bring quality product. Today, when we are talking about the regulation, we talk about FDA. Why? Because everyone considered FDA as a topmost regulatory body. Today, if you go to a doctor and ask, which product do you prefer? 99% of doctors will say FDA approved. We need to understand why they are talking of FDA approved. We can shout at top of our voice and tell, no, Indian regulations has to be there. But on the background, when you are applying for a regulation, you will see they also asked for a FDA. It is there or not. A C, it is there or not, if it is a multinational product. Whether you have an FSC, free sale certificates in Europe, Japan, or Australia. So these are the questions being asked by our regulatory body also. So what we can do? We can improve, we can enhance, we can harmonize our regulatory bodies along with the world regulatory bodies, so that our regulatory bodies, our approvals are also being accepted everywhere in the world. For that, the first and foremost is we have to bring quality. The quality quotient has to be there in each and every product. As our Honorable Minister told in the morning, we should not reinvent the wheel. Yes, we should not reinvent the wheel. But what we should invent is our strength in which we can really play a global role.
Very, aptly made statements, and of course you spoke about quality at large. We make quality products and which we export to both US as well as Europe. Happy to share that we touched 4 billion on 31st March 2025 for the last financial year. It is the first time we touched 4 billion. And that's thanks to our Indian manufacturers who are actually making quality products. But yes, I do understand there are a lot of learnings from the global markets and that our industry is poised to. And with companies like yours, which are getting into manufacturing, which are manufacturing quality products, we definitely will be able to make a mark there. Yes, important. Perception is equally important because we need to be looked as a manufacturing nation and not just as a trading nation. Moving further to Dr. Garg, as I shared with you previously as well that you've seen the policy, regulatory, government affairs, both with the MNCs as well as the Indian company now, and of course have been briefly with an association as well. So what is your 3 points on looking at India becoming an export powerhouse, number one? Number two, we spoke about quality, we spoke about certification. How do you look at CE and US FDA certification? Because our Indian companies do face a lot of challenge. And there is quite a handsome cost for getting that. So how do you look at certifications? How do you look at, the export-driven markets?
Sure. Thanks, Pravinji. So I think, since morning, one thing all of us would have heard in different sessions. One, let's make India hub for innovation. Two, let's make India hub for manufacturing. And now last session talking about let's make India hub for exports also. Good news is all three are connected, right? Innovation is a precursor to make in India in my mind. So innovate in India will lead to manufacturing, because if you innovate in India and send the innovation out to get manufactured and then bring it in, obviously it's a costly affair. And so therefore I think it is important that indigenous manufacturers And I think my colleague from SMT mentioned 5 to 7% investment every year. That's the number, we should grow that number, right? I think the ideal number that I keep hearing when I was working for global company was about 10% of the sales. And all of us have that potential to reach that number. So let's talk about how do we innovate in medical devices and not really follow the path there for pharma, which started with generics. Because in my mind, there is no generic in medical devices. Even if you make two companies are making the same cannula, they can be very different from each other, right? So therefore, I think it's very important that all of us start investing and continue investing and enhance investments in innovation in our respective organization. Number two, I think Minister talked about in the morning, Pravinji, about bilateral agreement getting signed, FTAs getting signed with a lot of countries. I think I request all my colleagues from indigenous companies in this room to please participate actively with Ministry of Commerce and EPCMG on contributing those FTAs with our request, with our asks from those countries, because when they ask access to Indian market, we have the right to ask for access to that market as well. I think that's where EPCMD is helping a lot, and maybe we will engage more with you and your team, Pravinji, there. The very critical point of any FTA, either in FTA or in otherwise, Pravinji, is also mutual regulatory agreements, basically. Right? There are a lot of, I keep hearing a lot of companies coming, and it is mentioned in our medical device rules also that that the devices which are already approved in 4 or 5 countries, which are GSTF countries, do not require any studies or trials in India. But the same thing should be applicable otherwise also. That any device which is approved in India after due clinical trial should be able to access those markets as well. So I think mutual regulatory agreement, in my mind, will be very, very critical again. And we need to see as to how do we push this into FTAs as well. The last point, not last, but penultimate point, Pravinji, is, I think Make in India is a brand is getting established. We all know about it. But I think how do we enhance that brand expertise, brand experience, Pravinji? All of us in our companies have brand managers who brand our products, who brand our companies. We also need brand managers for India brand. IBEF, I know, is doing it, but how do we support them in doing it better in the export markets is going to be key again. And last point, Pravinji, is about, you talked about the MSME and access to global markets through the certifications. Yes, I think one of my colleagues mentioned in the previous panel that CE and FDA are very costly affair. Very, very costly certification, approvals required, a lot of processes, clinical evidence generation, so on and so forth. My suggestion here would be that I think for MSMEs, it's a definite burden in the country, right, who are operating. So I have a simile here. So a lot of trade associations, Pravinji, has a membership rule, which is 2 lakhs to turnover 20 crore, this is the membership, turnover 40 crore, this is the membership. Can we do the same thing for this? Where government says, if your turnover this much, we will support you for 80% of the fees. If the turnover is higher, we'll support you 50%. If the turnover is more, so I think turnover increases, the support can decrease. I think that can be the, kind of a support system that government can have for MSME. Thank you, Pravinji.
So I think very important points made on MRA, and you brought in the certification point. One point you very validly said that it's important to give timely feedback to associations in terms of what you want from the government. You would have all read today morning about the National Export Mission Fund, which Honorable Finance Minister had announced. I think it's the right time that if you're looking at funding support from the government, if you can submit your inputs to CII, to the other associations with whom you're working, it would become important as our feedback to go back to the government and tell them that this is what the industry needs. But overall, I would say that there's been a really good, insightful into the session. Thank you, CII, for planning. But foremost, thank you, Girish. Thank you, Mr. Nene.
Thank you. Thank you.
Thank you, Mr. Dasgupta, and thank you, Dr. Garg, for giving your insights into the topic. And thank you once again.
Thank you to our moderator and eminent panelists. Please remain seated, gentlemen. because we have a final word of thanks, and after that we have to take this moment to express our gratitude to each one of you. So I'm going to request for the closing remarks, Mr. Shishir Agarwal, Chairman CII National Medical Technology Forum and President and Managing Director, Terumo, India. Let's welcome him back on stage, ladies and gentlemen, Mr. Shishir Agarwal.
Thank you so much, and thank you, Praveen ji and the panel. I was sitting throughout your session, and really it was very insightful. Really trying to understand what will it take to not only scale up, but as Vibhav said, innovate, manufacture, export, and ultimately it is for the patient. But before I give my vote of thanks, I have two important announcements. The first one is regarding the second year of the CII MedTech Quality Excellence Awards, powered by AMTZ. These awards celebrate organizations across India in the medical device sector that are setting new benchmarks in quality, safety, and innovation, from manufacturers to support service providers, and from startups to large enterprises. So there are certain recognitions, platinum, gold, and silver, along with special awards for medical device innovation, best startup in medtech, and it is a platform which will honor driving healthcare excellence and improve our global competitiveness. So there are flyers which have been distributed in the packs. Request you to please go through it and also to participate and showcase your leadership. And we will, I'm sorry. I think it's a little late in the day now. So the awards will be, the felicitation will happen at the AMTZ in Vizag later in the year. The second announcement is regarding the CDSCO CII workshop in medical devices regulation, which will be scheduled on 30th September in Bangalore. So these are the two announcements. Request everybody to please participate in both of them. Since morning today, we have seen very rich discussions. I'm really thankful to everybody who's participated, all the dignitaries, government leaders, all the panelists, and all the industry colleagues and friends. Really a very rich discussion. It was made very meaningful by very authentic participation from everyone. So a big thanks to all of our participants and the panelists. I also want to thank the CII team, led by Mamta, Amita, and everybody, including Abhishek, for really hosting a very smooth summit today. So if you look at it, despite losing 40 minutes in the morning, we are almost on time. So that's a big achievement also. We spoke about innovation in the morning. We spoke about Make in India, Make for the World. We also spoke about regulation, skills, synergies, R&D, and exports finally. All of this is trying to build the brand India, or the brand Make in India. But at the same time, it is also to build the right healthcare access to our patients in India. So let us stay focused on that also, because that patient will require not only Make in India, but the best of the technologies, so that they get the best possible medical care. As chairman of the forum, I can assure you that CII will continue to act as a platform to connect policymakers, industry, academia, and global partners, similar to what we have tried to achieve today. Hopefully, we will try to strengthen this platform in the coming months and years as well. With this, I want to really thank you. Thank you for your participation, engagement, and I look forward to working with all of you as we carry this mission forward. Thank you once again.
I'm now going to request Mr. Agarwal to also help us thank our moderator first, Mr. Praveen Mittal, Executive Director, Medical Devices Export Promotion Council, with a small token of our appreciation. So please do accept our gratitude in the form of this token. A huge round of applause, ladies and gentlemen, for Mr. Praveen Mittal, Executive Director, Medical Devices Export Promotion Council. And I now request Mr. Mittal to kindly do the honors for our panelists. And Mr. Agarwal, please stay with us for the picture. Mr. Mittal, can we please thank Mr. Sachin Nene, Chief Executive Officer, Motherson Group first. A huge round of applause, ladies and gentlemen, as we thank him. Sir, please help us thank Mr. Girish Gopalakrishnan, Senior Vice President, Zydus MedTech Private Limited. Let's have a huge round of applause for Mr. Gopalakrishnan. Thank you, sir. And now maybe thank Dr. Atantra Das Gupta, Business Head, HOD and Senior Director, India and SAARC, Samsung Health and Medical Equipments. Let us thank him, ladies and gentlemen, Dr. Atantra Das Gupta. And Dr. Vibhav Garg, President, Corporate and Global Government Affairs, Merrill. And here we thank Dr. Vibhav Garg. And let's accompany that with a round of applause as well, ladies and gentlemen. Thank you very much, sir. I now request you gentlemen to please give us that photo opportunity. I request Mr. Shishir Agarwal to also please join us. And ladies and gentlemen, with that, we close this 17th edition of the CII Global MedTech Summit. And I know that we carry forward the resolve to make in India, make for the world, building a healthier, more inclusive future together. Thank you very much, esteemed panelists. Yes, sir.
I request everybody to please join the India MedTech Expo, which is happening from the 4th to the 6th of September at the Bharat Mandapam. It's being organized by Government of India. Look forward to seeing your active participation, and thank you CII for organizing the summit. Thank you.
Thank you to all our speakers once again, and for this final session, thank you eminent panelists, and thank you to all of you eminent participants for being such an integral part of this dialogue, such a rich dialogue we have had through today. 17th CII Global MedTech Summit now concludes with renewed commitment to making India a MedTech leader for the world. Thank you very much. Have a great rest of the evening. This is your host Aishwarya Singh. Thank you, ladies and gentlemen.